थोडा अजून वरती काय वो चेयर ना असेल मॅडम जॉईन झालाय मॅडम नाही लिंक दिली ना त्यांना काय अडचण येईल काही जॉईन करायला बरं आता कसं फक्त 5 मिनिटं राहिली बाकी काय मॅडम ऑटो रेकॉर्ड राहते तिकडे लोक जॉईन होतील तुम्ही सध्या तरी
मला काहीच माझी फक्त स्क्रीन ओपन ठेवून जाईल.
म्हणेन
त्याच्यावरती व्हिडिओ पण तुम्हाला दिसलं पाहिजे ना तुमचं, तुम्हाला बघायचंय ना त्याच्यावर. मला व्हिडिओ पण ऑन करू ना, तुम्ही असं घेऊन बसणार ना ते. सर आपण नमस्कार करून मग येतं का म्हणता येतं. चल सर मग आपण असंच
आवाज येतो तुझा.
हा 14 मिनिट सगळे कशी खाल्ले तुम्हाला ब्लूटूथ देऊ का मॅम ब्लूटूथ कारण साईडने आवाज पण होते इथेच आहे room.
Good morning to all. I welcome everybody online, those who have already connected. I request all the delegates who are connected, please mute your audio. You can put your video on, but please mute the audio because it is disturbing here. So I request again all the delegates and participants who have connected online to mute the audio part. I welcome everyone who are connected online for this international webinar organized by Government Ayurveda College, Jalgaon. I welcome Dr. Bhagyashree Khoth, Madam. She is co-host with me.
Hello, myself Dr. Bhagyashree Khoth, HOD and Professor, Prasutitantra Department, Government Ayurved College, Jalgaon. We Department Prasutitantra and Shalyatantra Department, organizer of this event, international event, SOUSHRUTI-2023, welcomes all the dignitaries, all the minute speakers, and all the enthusiastic delegates in this fruitful and knowledgeable event. Thank you. Thank you very much.
You can see today's honorable speaker, Dr. Aruna Patki, already connected online from USA. Welcome, Dr. Aruna Patki. Soon we will be starting this session. I can see Dr. Saudamini Chaudhary, Madam, Professor and HOD of Streeroga Prasutitantra Department from Nanded, and Dr. Manoj Gaikwad, Professor and HOD from Podar Medical College. He is already connected. So many people already are connected. And within a minute, I think we will begin this first session of today's international webinar on Garbhini Paricharya Gudgat Vyadhi, organized by Government Ayurved College, Jalgaon. Yes.
Director of Ayush and Ministry of Medical Education and Drugs Department, Maharashtra, Mumbai, conducting a campaign, Ayurved awareness campaign, and this part of this international webinar is the part of Ayurved awareness campaign.
As my colleagues from other government Ayurveda college in Maharashtra, they know, and Dr. Bhagyashree Khoth, Madam, just said that there is a Ayush awareness campaign being run by Government of Maharashtra and Directorate of Ayush Maharashtra State. And every government institute is running different kind of programs, organizing medical camps, lectures, and street plays performed by our students, the postgraduate students, CMEs, etc. So different varieties of program being run in this Ayush campaign organized by Government of Maharashtra and Directorate of Ayush. And this international webinar is part of this Ayush campaign organized by Government Ayurved College, Jalgaon. Now we are beginning the first scientific session, and I request our students to perform Dhanvantari Stavan. Thank you, dear students. And now I invite Dr. Mrs. Revati Garge, Assistant Professor at Government Ayurveda College, Jalgaon, to introduce today's honorable speaker, Dr. Aruna Patki, who is already present online from USA. Welcome, Dr. Aruna Patki. I request Dr. Revati Garge to please come and introduce today's speaker.
Welcome, Dr. Aruna Patki, madam.
Namaste everyone. Thank you.
Good morning, everyone. I would like to present a warm welcome to all of you. Friends, it's an honor that we have got our eminent speaker for this session, Dr. Aruna Patki ma'am. She is joining us all the way from America. Dr. Aruna Patki ma'am is an Ayurvedic doctor educated in India, founder of Ayurveda Healing Spa LLC Center, North Carolina, USA. She is national provider of 4 Ayurvedic courses of different types of recognized by NCB TMB Board USA. Dr. Patki ma'am has been practicing for 20+ years in different states of America, and also she is teaching different aspects of Ayurveda on various platforms. She is renowned author of 2 books. She has received Star 2021 award from World Book of Record, London, UK, for creating awareness of Ayurveda. She has been invited as honorable speaker, chairperson at various conferences and seminars. दोस्तों, ये हमारे लिए बहुत ही गर्व की बात है कि डॉक्टर अरुणा पत्की मैम सिर्फ भारत में ही नहीं तो अमेरिका में भी अपने आयुर्वेद का परचम लहरा रही है. So it's my great pleasure to welcome Dr. Aruna Patki ma'am for today's session. Now, I would like to welcome our today's honorable persons, Professor Dr. Saudamini Chaudhary ma'am. She's professor and head of department Streeroga and Prasutitantra, having a vast experience of more than 23 years. She is postgraduate and PhD guide. She was awarded Vidya Bhushan Award 2020 in Karnataka. Now, welcome ma'am. Now I welcome Dr. Manoj Gaikwad sir. He is professor and head of department Streeroga Prasutitantra at R.A. Poddar College, Mumbai. Dr. Manoj Gaikwad sir have received Best Teacher Award for year 2010 by Rashtriya Shikshan Mandal Dhanvantari Puraskar in 2019 by Ayurved Vyaspeeth Nagpur. India Beach Award in 2022. Welcome Dr. Manoj Gaikwad sir. Also now I welcome Dr. Kola Vijayakumari ma'am, professor and head of department Streeroga Prasutitantra, Dr. NRS Government Ayurved College, Vijayawada, Andhra Pradesh. She has outstanding career and achievements for her credits. She is regular guest speaker on health talks shows Doordarshan All India Radio. Board of Studies member Dr. YSR University of Health Sciences. Nominated coordinator for Heal India programs, Nation Commission for Indian Medicine, Ministry of Ayush, Government of India. Welcome ma'am.
Good morning all of you.
Now I welcome Dr. Geeta Patki ma'am, professor and HOD of Stree Prasutitantra at Gomantak Ayurved Mahavidyalaya, Goa. Board of Studies Chairman, Goa University. She is advisor and expert at Gujarat Public Service Commission. Ma'am has been also awarded as director of government program. She has received the Dhanvantari Award in 2020-22. It's my pleasure to present a warm welcome to our eminent speaker and honorable chairpersons. Now I invite Dr. Aruna Patki ma'am to start her session.
Namaste everyone. Good evening all. Good morning. Sorry. Yeah, good morning, madam. Am I audible to all of you?
Yes, ma'am, you are audible.
Okay, perfect. So, and is my screen visible to all of you?
Yes, madam. Yes, madam. Yes.
Yes, yes.
And speech is clear, right?
Yes,
Yes.
Okay, perfect. So, thank you for introducing me just few minutes back. I'm very excited to be here and put my 2 points of Ayurveda in my clinical practice. Basically, I'm going to share a little bit of clinical experience or evidence-based experience or evidence-based Ayurveda here in today's talk. I'm very excited to talk about the topic, which is very alive in day-to-day practice. As an Ayurvedic practitioner, specifically working in the Western world or Western side of the exactly opposite side of what we have learned in Ayurveda, and where I'm located in the States, where we see the concepts of Ayurveda in a very different way. And that's where I'm practicing, and I'm going to introduce how I'm practicing that in my day-to-day practice in today's talk. So I will start my session with remembering all my gurus with a shloka. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Guru Sakshat Parabrahma, Tasmai Shri Guruve Namaha. Om Shri Dhanvantare Namaha. So I have chosen this topic. My topic is the integrative holistic approach for the gynecological disorders. That's a very vast topic, but I have worked a lot on the First of all, I would like to put a disclaimer here that in today's topic, what I'm going to share all the information. This information is solely to educate. So this information is solely to educate the students and can you guys hear me?
Yes.
Yeah, please carry on.
Okay. If you can put the mute to all the participants, then it will be easy to continue the talk.
Yeah.
Okay, perfect. So I have chosen this topic, but before we start, I'm going to put a disclaimer here that this whole session, discussion, and what I am representing, it is only to educate solely, not to change or line of treatment of all the people or patients who are already on the medicine and taking the medicine, and they're learning this science, or they're going through these slides, or they're going through this Ayurvedic approach. This is whole and soul only for the educational purpose. So please do not take this as 100% guaranteed information and try Ayurveda on your own and get some disturbances or not the proper treatment. So if you are really looking forward, you approach to the proper Ayurvedic person so that you can get the best Ayurveda. So this is a disclaimer before we start the session. So I have chosen this topic, PCOS and PCOD, because I have worked on many cases which in my practice. And this is very close to me as I am practicing this from in an area where I deal with this on the day-to-day basis. Basically, when we are talking about gynecological disorders, gynecology is a vast subject, and basically, specifically with the female problems, what we generally see on the day-to-day practice is like menstrual challenges, irregularities in the menses, excessive bleeding, not a proper having flow, or going through the having the cramps, mood swings, like basic day-to-day problems with a lot of signs and symptoms, which which we can see and which I do see in the practice, and how our day-to-day Trayopastamba in Ayurveda impact on these problems, and over the period of time, as this continues, how it converts into the PCOD, PCOS. So why Ayurveda? Ayurveda is not just a medical science. It's more than a medical science, and it's a doctrine of healthy living which has survived the test of centuries, and our body absorbs and responds much better to nature than anything else. And Ayurveda is all natural, and in this condition, this really, really works. We all know the definition of Ayurveda and this, which I'm not going to share, but this pillar of life is very important when we are talking about the women's issues or gynecological issues or anything in the Ayurvedic pathology. We can break the pathology with this pillar, and I have used this very strongly in my practice. As I'm practicing in the United States, there are very less options to practice. And if in India, if we have 1,000 options to practice, then there are only 10 to 15 options in front of you to implicate or use the practical approach of Ayurveda on your clients. And then you have to choose out of these very few in your hands to practice. So this is a very, one of the best to use in our, in the day-to-day practice. For any kind of problems, you can think of this pillars of life, and you can improve or reverse, or you can change in the pattern of the disease or in the disorders or disharmonies in the body. The causative factors we always know. Ayurveda has given Pradnapara, which is like misuse of the intellect, the incompatible correlation of the sense organs, which is Asatma Indriyartha Sanyog, and abnormalities. In like these are the basic causative factors where the three reasons why we have the disease in the body, or what is the basic step or first step why we get the formation of the diseases in the body. Along with that, the Dhruti Smriti creates the spiritual, mental, physical, social, physiological imbalance, mental imbalance in the body. So your mental aspect, your mental faculties also comes forward to create the imbalance in the body. Okay, perfect. Let me go to my slide number 58 and was 127. I would like to start with let me know if you all can hear this video, and then I can go to the clinical aspect of it. So is this video audible to all of you? Let me know, okay?
My journey with PCOS began around puberty, around 13 or 14, when I started to notice hair growth on my chin and my neck that was unusual from those around me. Being that age, I was too embarrassed to speak up about it and would just either shave it or nair it off, which is just terrible.
Can you all hear this video? Hello?
Yes, madam. Yeah.
Okay, I will continue.
For my skin in hindsight. And it was one of those things where until I became my own advocate in my 20s, I went to doctors and tried to get diagnosed as I researched and saw the signs of what this would likely be linked to. I had to get blood tests done several times and was turned away by my gynecologist, who just dismissed my hair as me being Italian and having light skin, and saying that, well, I had no cysts on my ovaries, so everything was fine. I finally found an endocrinologist who was amazing in my early 20s, who was able to diagnose me with blood tests and who was able to really say, okay, here's what you're working with, here's what you have. However, the one thing that they gave me to treat it was metformin, as well as telling me to follow a low carb or keto diet. As those, if anyone's been on those types of diets before, they do give you results, but it's not sustainable for the lifestyle I want to live. So I failed on the keto diet eventually. I lost weight, I gained weight, I yo-yoed, and metformin made me so sick that I was not able to stay on it. I tried a number of different ways to stay on it, read different tips and tricks, and was just never able to keep things down. So I gave up on that and just tried to start to figure out things on my own. Fast forward a few years, and I've discovered Ayurvedic medicine and met Aruna, and she really kind of opened my eyes to how PCOS isn't just the numbers, it isn't just your testosterone levels, it's things that manifest in many ways within your body. So it's been quite a journey for the last year as I understood the Ayurvedic teachings and the ways of mixing foods and the type of dosha I was. Within this, I was also able to bring my boyfriend in. So while he doesn't necessarily follow Ayurvedic eating or teachings completely, he was here to support me. I became vegetarian, which was a huge change as someone who's eaten meat my whole life. My boyfriend as well is Puerto Rican, grew up on pork and different meats and stews. And he also decided to join this journey with me. He saw how much energy I had, that my weight was changing, and that just my mental health was different. So he is also, even though he's a muscular, tall person and has to do a lot of physical work, he's also been following a vegetarian teaching. I'd say that the support I've had from both Aruna in the teachings, in understanding it and really applying it, has made such a difference to my life. And then also having a partner in my life who has transformed not just physically, but I think also mentally in this journey, as he's taken away the things that have, blocked his flows. He's started to do more self-care and things of that nature. We're both seeing a transformation in our lives. It's goes beyond the physical. It's the mental, the physical, the getting, him losing 30 pounds and getting off blood pressure, me losing 30 pounds and not being on any medication, my numbers dropping, my testosterone dropping from 50 points to 30. And I'm still working on things. We're looking to conceive, and that's something we're going to be working on next to make sure that our bodies are in optimal shape for that. So PCOS has really been a journey, and I've really made the most progress in it in the last year of my life versus the number of years I spent chasing medicines and diets that weren't going to work. This is really a journey that takes in everything from food, mental, lifestyle, and just general happiness.
Okay, so that's where I was talking about, like very basic. When a client, basically I'm going to say clients because I cannot say patients, but when the client comes to you and you have very less options, how you can use and apply the practical Ayurveda is totally a beauty of us to understand whatever we learn in our gynecology, the Hetu Varjanam, the Hetu, figure it out, the Hetu, understand their compatible food, incompatible food, understand how they are living, what is their lifestyle, understand everything about your client, about their physical activity, physical approach, mental activity, psychological status of their body, emotional status of their body, hormonal status of their body. Try to understand your client as much as you can with the provided information, which as a massage therapist, which I can ask my clients, and there is a very less limit, there is a very less little window that you can ask the clients and get the utmost information from them so that you can apply your Ayurvedic approach.
Welcome to empty music world. Bluetooth mode.
So So these are the things what I was talking about, and this is one of the things, like, you know, there is a verse I still remember that Pathe sati gatiranasti kim aushada sevanam, Pathe asati gatiranasti kim aushada sevanam. This is a very well explained concept in Ayurveda. There is a sutra, Patya Patya Vinishchaya. This sutra makes a lot of sense, and a lot of it gives you a tremendous idea that how you can help your clients. So food plays a very important role, and where we are going to talk about the PCOD is, like, generally in the PCOD, what happens. We know, like Dalana says, right, our garbhashya looks like a kind of a fish, right? The opening, the mouth is at the bottom and the flings are on the top. So your uterus looks like that, right? So the normal ovary is, this is the normal ovary. In the polycystic ovary, what we see here is like eggs matures and are then released. The ovaries produce the hormones estrogen, progesterone, and testosterone. And in the case of polycystic ovaries, however, the ovaries are larger than the normal. There are a series of underdeveloped follicles that appear in the clumps, somewhat like a bunch of grapes. This is our polycystic ovarian disorder or syndrome. In the PCOS condition, what happens that prevents the ovaries from working properly. Most women in today's world, we ignore, or we do not give the attention for our monthly, day-to-day, monthly cycle. It is very common nowadays, what I have observed, that we have the 28 days cycle, right? The monthly cycle. Most of the time, there is not a regularity on the monthly cycles. There is not a proper flow. There is not a proper behavior. There is not a proper diet. There is not a proper lifestyle. There is not a proper offerings of the food to the body. In today's era, it's very hard for our working ladies. They're most of the time stressed out and burned out. They're working. They're in this equality. We are working as like we are working and acting and behaving like a male factor, right? So with all of this, what happens? There is this concept of stress, and today's most of the women has the stress. So it's a very commonly seen problem in today's world is PCOD, where most women with the PCOS grow many small cysts in their ovaries. So I have seen in my practice one student who is in 9th or 10th grade, and I remember she used to have the menstrual pain. The mother came to see me after they removed one of the ovary from this 11-year-old. They came after the removal of because they found some cyst, and she used to have some abdominal cramps and pain and discomfort during the menstruation. So this is what this topic is like. The age is so delicate. The lifestyle is fully working and stressful, and this is a very common thing to observe in today's modern ladies. So this is a polycystic ovary syndrome. The cysts are not harmful. It takes a time. Many times it takes a time to, and we give so much time in between to finalize this problem with the and diagnose this disease. So cysts are not harmful. So many times they do not even think about it. But when it is unbearable, then we can, they try to understand what's happening inside the body, which is a hormonal imbalance. The characteristics of PCOS, we all know the theoretical aspect of it. We can all see it's very common to see the obesity, menstrual irregularities, subfertility, hair loss, alopecia, baldness is very common, facial hairs, acne, dark pigmentations around the neck, acanthosis necrosis. So these are a few of the things what we see in today's teenagers, today's 16-year-old, 18-year-old. These are the very common problems which I see. I have observed many when there is a pivotal change, very commonly seen changes, very prominently and commonly seen change in my practice is having the facial hair growth. And when we have the facial hair growth, the first thing what people do commonly is like they go to the beauty parlors or they go to the waxing places and they remove the hairs. Because of that, they feel like, oh, it's a very normal thing to have this. So whatever is abnormal became normal in today's era, or today's kids, today's teens, today's working ladies, that, having the male feature is abnormal. But, nobody has a time to think because of the hectic lifestyle and because of the working hours, stress in the school, or too much study, going through a lot of things, that we ignore the physiological changes and we cover up them by by doing laser, or by doing removing them, or by applying whatever ways possible for them to remove it. Okay. The pathophysiology, if we see that it's this PCOD, PCOS, if we want to understand this is a lot of involvement of different systems is in this disorder or in this syndrome. There is a hormonal system involvement, there is a metabolic digestive system is involvement, there is a then we talk about the insulin, then we talk about the accumulations of adipose tissue formation. So what happens here is like a lot of systems imbalances comes together. That's why it becomes like a hard for many of the practitioners to understand where to start and where to end. So pathophysiology of this samprapti, or the pathophysiology, is like, if you see the luteinizing hormone, it increases, the follicular stimulating hormone, it decreases, the ovaries are involved, there is a impaired development of follicle. And then we see the hirsutism, which is I just explained, then acne and alopecia, then obesity is very commonly seen in central obesity, I can say, specifically adipose tissue formation or accumulations in that area. This is a very common samprapti, or what we see. If we want to understand the frame of a samprapti in Ayurveda, basically in Ayurveda, what we talk about, the dosha dusha sammurchana. And in the dosha dusha sammurchana, we are specifically going to think about the dosha. Never ever try to leave the basics, simple principles in Ayurveda. If we always remember the basic principles of Ayurveda, I think you can break any pathology easily. You can connect to the disease or the syndrome or the concepts, like whatever it will come in future. It's very easy to use the basic Ayurvedic principles and see the problem. So you can, as an Ayurvedic practitioner, I see Ayurveda in everything. I cannot separate Ayurveda from my normal life, from my personal life, and from my client's life. So I'm always with the Ayurveda, full into Ayurveda, drowned into Ayurveda. So I always see the basic principles plays very important role. So dosha, specifically the kapha dosha, and with the guru snigdha and mandaguna, kapha is involved. the dushas, specifically the rasa dhatu, the rakta dhatu, meda dhatu is involved. The strotas, if we want to understand this, artava strotas and medo strotas is involved. Then the strota dushtis, generally when we see there is a sangha is happening. So the flow of the energies or flow is not moving, the energies are not moving properly. So this sangha pathology we have to break. And then the Agni, because every disease in Ayurveda, if we have understood it, if I have understood Kai Chikitsa a little bit well, that, you know, the reason of formation of the first step of disease in the body is Mandagni. So Manda at the Koshta as well as the Dhatu level. So the Agni is low, slow at the Koshta level as well as Dhatu level. So this Samprapti, the frame of the Samprapti in Ayurveda, I think this way, I do not go very, very, very deep into the huge shlokas and the way we practice, where there are like thousands of the, like hundreds of the different bastis and hundreds of this and hundreds of that. Not feasible and possible in my practice. So I go to the very basics of Ayurveda. I try to understand the disease, and this is how I have seen in my client, which I'm going to show at the end. So the Ayurvedic perspective to manage this disease is like, it is a, this disease is basically the Artava Strotas. Artava, the Kapha, Meda, Dosha, Dusha Samurchana, we need to understand. Staulya, Samprapti, which is very much connected with the Kapha Pramaya, we can think of that also. And in PCOS, Kapha dominant Granthis. So when we are talking about the Granthis, the cyst, in the ovary, so when we say cyst or Granthi, we are always thinking about the Shleshma Vata Dikam, right? So Shleshma means Kapha and the Vata. So we are always thinking about these two doshas. And then Granthis are developed when there is a Sangha, that again, the blockages in the channels. So we are always thinking about that. And then Artava Strotas along with the doshas. So basically, this is what I just explained few minutes back, that one of the major symptoms of having the PCOD, PCOS is like not taking proper care. And these are the symptoms what we see in PCOD sufferers or PCOD female who are suffering with the PCOD. This is hormonal imbalance. This is hirsutism. So if we see, the pattern of the acne is totally different. The pattern of having the facial growth is different. These are all the clinical features what we see in the PCODs, like acne, acanthosis, hirsutism, obesity, irregular menses, hair loss, infertility. So my client, which the video which we just played a few minutes back, one of the client with most of these things in were seen in her at the time of the, this was like, as she explained, she lost 30 pounds, but she was very overweight also. She was 245. And then during the cleansing and after the cleansing, she has lost 30 to 40 pounds. So this is a so PCOS and Ayurveda correlation is like, you think about these important factors: the Staulya, the Medavritta Vata, Kapha Vritta Vata, Kaphaja Granthi, Artava Drushti, Artava Dosha, and Kaphaja Pramaya. Understand this, keep this in mind, bring some common herbs and common kalpas or combinations and use on your client. That's what I did later on. The pathology in Ayurveda, this is exactly what we discussed. The location of the PC, like the organ is pelvic cavity, right? So this cavity is dominated by the Apana Vayu, and Apana Vayu manages the whole this area of excretion, expulsion, cleansing, detoxifying on the monthly basis. So this is the pathology. This area gets obstructed, congested, clogged, and the energies are not moving properly. So this is the area we have to always think in the line of treatment. So the Ayurvedic approach for this is like avoidance of the causative factors which are precipitating in the disease. So Nidana Parivarjana is very important. The biopurification, which is Sanshodhana, which comes under the Panchakarma, it is very important. Use of the palliative remedies, Sanshamana therapies are very important. The health promoting regimen, which is a Pathya concept in Ayurveda, is very important. And in that, again, we are talking about specifically the Trayopastambha are very, very important. So the preventative approach is very good if we use this on the as a habit or on the day-to-day basis. The concepts of the goals of Ayurveda, the Swasthasya Swastha Rakshanam and Aturasya Vikar Prashamanam cha. So if we follow the Swasthasya Swastha Rakshanam or preventative approach from the first menstruation to the teenager to the adult life, if we follow certain rules which are meant for to practice during that time period, then we will stay away from such conditions after a while. Okay, but if we do not follow our monthly cycles, patterns, care, wellness, lifestyle, behavior, activities, then this is very common to get it in the future. You know, nowadays, this is one of the most which I practice, which I see in my practice. Very common, and people most of the time, even 40-year-old will come up with, oh, I have abdominal pain. I always feel a pain in my lower abdominal area. That's where they start. The treatment principles as per Ayurveda, Vata, Pitta, Kapha. Pitta has a direct relationship with the hormonal system. Vata has a direct relationship with the area, the location, the organ, the whole Yoni Vapat concept, which is dominated in the Apana Vayu area, and then the Granthi concept or the cyst concept. So the treatment principle is to clear the obstruction in the pelvic area, normalize the metabolism, and regulate the menstrual system, Arthava Dhatu. Kapha reducing, insulin enhancing, and hormone rebalancing Ayurvedic herbal help can help to relieve the symptoms of the polycystic ovarian syndrome. So the treatment principle is very simple as per me, and this is how I use it. This is out of maybe 15 options, I have 5 in hand to use on my clients. The Ayurvedic management, what we talked, preventative is always good, but it's very hard to follow the lifestyle, to follow the Ayurvedic Dinacharya and Rutucharya and Ratricharya. Ayurveda has given us so much insights to see around, act as per the season and Dinacharya, Rutucharya. But on the day-to-day basis, in the practical living, it's not feasible for people to practice this. So the preventative approach is always the least bothered. When client comes to us, or when they come to see us, the disease is pretty old. The problem is pretty chronic. The condition is gone deeper. So it is like when they're coming, then at that time we have to think about the herbs application, using the herbs, and then Panchakarma therapies and Pathya Apathya. So we can use this then for the Vikar Prashamanam cha. Which the treatment protocol, what I generally use is Thaulya Chikitsa, Dhatavagni Deepan, and Kapha Megha Dushti Chikitsa. Again, the kapha has a direct relationship. The test, specifically, I use the concept of the test when I'm guiding them the concept of food, and I make them aware about all these 6 tests of the food and how they impact on the body. So I try to educate my clients with every concepts in Ayurveda, what is required for them to understand what they're eating, what they're supposed to eat, what they're supposed not to eat, what combination they should eat, what is the incompatible food, what they should not mix, what they should not eat or drink, because the concept is very different. Smoothie, shakes, and salads is one of the major thing. And then meat products. This is something where most of my clientele comes with 80 to 90% of the way of living, the way they live. So this is very, very important for me to teach my clients the concept of 6 tests of the food and their impacts on the body. So I always educate my clients with this concept, following the daily, and then giving them the information about Delhi Code of Health Conduct, which is Dinacharya. Then conduct for the night, which is Ratricharya. Conduct in relation to the various seasons, which is Ritucharya. Personal and social hygiene, which is Sadvrita. Nutrition, dietetics, Pathya. Then Vega Varud, Vega Dharana. Importance of it and why you should not suppress them. You have to talk these simple points, which looks very simple to us, but their effects and impacts, and that's what it causes the samprapti or pathology in them. So you have to talk about this, because most of the clientele, they are in from the corporate world. Control of negative emotions, Dharaniya Vegas, avoidance of the unwise courses, and then restorative remedies. These are all what you need to use it in the practice. How Ayurveda can help? Ayurveda can help because it has taken care of this concept of health. If we make the client to understand the concept of health and show them where they are, then they will see the difference. The shlokas like the samadosha, samagnishcha, samadhatu, malakriyaha, prasanna atma indriya manaha, swastha iti abhidiyate. So when you're talking about this prasanna atma indriya mana, most of them will not understand. But slowly you try to explain them how they impact on each other, how the balanced doshas, balanced dhatus, agnis, malakriya means the waste removal, why it is very important to keep the harmony in the body. And then why it is very important to keep your the happiness in soul, happiness in mind. This is all why all this is very important for us to understand. And then only the concept of the client will understand the health and unhealthy, where they are. So when you explain them healthy concept, they will definitely understand where they are and where we need to change them. So this is very important. I always guide them. This is very typical Western approach. This is just for the slideshow, but in person, when I talk and when I connect with them, you connect with your client at their level. You cannot just bring Ayurveda and bombard the Ayurveda and the concepts of Ayurveda on the clients. Most of the time with these conditions, I have seen they're very overwhelmed with the knowledge of the Ayurveda. So in the bits and pieces, you have to teach them every day the concepts of Ayurveda. Unless and until you educate them, they will not follow what you are saying. Unless and until you connect with them at their level. Because most of the time, the concept of food in my practice is to-go food or drive-through food. That means you pick up from the restaurant. That's the concept of food. Now, how can you change the person who is living this kind of lifestyle from, that's what they have seen and that's what they do and they practice. how when the person is having this kind of central obesity, adipose tissue formation, the weight challenge, when they are having all of these, and then we are talking about the concept of food. Okay, take control of your diet, man, change your diet, do not drink the smoothies, do not do the salads, do not do the shake. Whatever they're doing, you're telling that you should not do it, you cannot do it. Then at that time, you have to teach the Vata, Pitta, Kapha. You have to teach their qualities. What is happening when they are aggravated in the body? What is happening when they are decreased in the body? So understand them and then bring Ayurveda into it. Teach them, make them understand the logics, and then they will follow you. If you just bombard the diet, and I have seen many of the clients, they cry on the chair when we talk Ayurvedic concepts. It's not easy to change a person at the age of 40 or 50 or 30. It's not easy to change a person when we do not know the concept of the food. What is food? Most of us, we don't know. What is the food combination? Really doesn't matter, because the 70 to 80% of we American eat incompatible food in the morning. And this incompatibility is like mixing the fruits with yogurt, mixing the fruits with the oatmeal, mixing the fruits with milk, and this sausages with some combinations, smoothies, shakes, protein shakes. This is the kind of where in the smoothies and shakes, what we have, the fruits and the vegetables and protein powders together. So we cannot, when somebody is using this for most of their life, and when they are coming to Ayurveda, and when we are seeing their causative factors, then you have to teach them the concept of food and how it is increasing their problem, how it is creating a pathology in them, how it is creating an impact on them, or it is making their disease to grow more, or it is enhancing their disease, or increasing their disease, or taking it deeper and deeper. So you have to educate them. That's why it is very important to talk a little bit in a different way, but when they are in person, it's very easy to connect them, meet at their level, and explain them. This is very common food, processed food, high fructose corn. Everything is, most of the time, it's made up of the white flour, bleached flour. And then dairy, meat, processed food, packaged food, frozen food, hot pocket food, food with artificial colors, sweeteners, trans fat, everything. Every food, most of the food is bombarded with this concept. Now, even if we want to escape from this kind of food, it is hard to find the good food. It's hard to find good choices. It's hard to find the good options. That's where the client has to take the responsibility. And that's where we as an Ayurvedic practitioner have a huge responsibility to connect with your client at their level, not at your level, their level. Talk about the food, guide them what is good. You can guide them because every culture is different. I see Italian people, I see African people, I see white people, I see Asian people, I see Indian people, not with the mentality what we have back home, American mentality, Indian people. So it's very hard to create the awareness on the huge level, but one-on-one, when they're coming to you, you can definitely, until now, I'm always like at least 99%, I am successful in my practice when I'm talking the concepts of Ayurveda like this way. So in the polycystic ovarian disease, in the Ayurvedic approach, Panchakarma plays very, very important role. I'm going to show my clinical slides, which I have used on my client. 120. Okay, so let me start with this. So this is, yeah. Let's talk about the evidence-based Ayurveda for this condition, because we have very less time. So this client who age was 36 when she came to see me. and from the age of menstruation, when she started, she used to always have the pain and discomfort, but she always suppressed it with taking the birth control pills. So that is very normal. That is very normal to take the birth control pills, keep it, or many times people takes the painkillers and over-the-counter medicine, and it's a routine, and it's very common to see in the practice that they take these kind of things. So, and then they bring a lot of side effects in the future, which we all know as Ayurvedic doctors. So this client used to have a traveling job, corporate world. She used to travel Monday to Thursday, and she used to always have the disturbed sleep, plane travel all the time. Vega suppression of natural urges was very common because you are always running, catching the flight, blah blah blah. Then the diet is like whatever is available in the market. She was like 80-90% meat eater, improper diet, incompatible food combinations, not enough sleep. Trayopastambha was always disturbed, and the lifestyle, like when you are a traveler, what will be your lifestyle? So the symptoms what I have observed in her, like what she has given, that menstrual irregularities, scanty menstruation, dysmenorrhea, inability to get the pregnant. That was one of the reasons why she came to see me, due to the lack of the ovulation. Increased hair growth, which was very common in her, acne, dandruff, obesity, baldness, and patches on the skin. So this was this was seen in her, and this is the way of Ayurveda which I use in my practice, that I try to cover every point which is mentioned in Ayurveda. I consider this PCOD as an endocrine system challenge. Consider it as a metabolic challenge. Consider it as a psychological challenge, emotional challenge. Then there is a social challenge. When I'm practicing here, I always include the social as well as environmental challenge also, because it impacts a lot on your psyche of the body. So I have given this line of treatment in the Shaman Chikitsa. What I have done, I used the Kanchanara as per the Granthada, Kanchanara Gugul in the palliative treatment, Lasun and Punarnava decoction, Shatavari, Kumari, and Trifara. This is such a easy available combination. In my practice, I cannot go to the Kalpas and another like where we have another major Kalpas I cannot touch, and I do not want to touch. So I have used this. In the Shodhan Chikitsa, what I have used during the Panchakarma, very nicely I have done the Virechana on her. Then I have used the like basic, very important in her is like weight, and weight was one of the major challenge in her because she was unable to breathe properly. There was so much fatigue and all of that other things along with the weight. So I did the first Panchakarma and thought about doing the nice Virechana for her, because the Basti is a little tough unless you teach to the client and client is willing to do it. So you have to start somewhere cleaning. You have to start somewhere removing this Sangha concept or the Samprapti. So I did this Udvartana, dry scrubbing, castor oil massages, Pichu Dharana, Shirodhara, Virechana therapy, Vata Anuloman therapy, which we used during her cleansing program. Diet change for sure. This person, you heard that she became 100% vegetarian. Within 6 months, she changed a lot. With the Panchakarma, she learned a lot. Then she started practicing. Then she started applying. And then maybe in 1 year, she gave up on the meat. And she thoroughly changed. She cultivates her own vegetables. She does her own herbal garden like the way I do. I teach my clients. I will show you how I teach them. So this is the breathing techniques, spices, herb, lifestyle change, diet change. This is what we just watched. And this was the client. So if you see her before treatment and after treatment, whatever the PCOD clinical symptoms we have seen, and this is the change in the client. These are all the therapies what we use. The client came to see me in 2019, and her, if you see her testosterone here, and her cholesterol level here, after our line of treatment as per Ayurveda, this was the result. The testosterone level drastically dropped, and her cholesterol level pretty nicely dropped. So with the before, during, and after the treatment, she lost 30 pounds in 3 months. 30 pounds in 3 months she lost. So this is an Italian client, and born in US, but impact of Puerto Rico because boyfriend is from Puerto Rico. They eat only meat, 100% steak eaters, meat eaters. So it's very hard for her, but it took her a while. And as she was changing, you will see the good change later on. So I would like to show you all like what happened here. As someone with PCOS, I have tried a lot of different ways, medications to lower my testosterone levels without success. One pill I took was a testosterone blocker that I was told to not consume on as it would cause birth defects. I went off of those after months with no change. Over the last year, I have worked on what I am eating and practicing Ayurveda since January 2020. Since January, my blood pressure, bad cholesterol, my cortisol level, my weight, all are down. But most importantly, my testosterone levels are testing in the normal range for the first time ever. I went from 56 to 30, being mindful of what I eat and how I treat my body is making all of this difference. So Ayurveda is truly a life-changing. I am doing well. My hair started to shed heavily, but about a week ago. I got blood work done, but everything looks good. Actually, the really good news is that my cholesterol and triglycerides, which were high in early January, have dropped drastically since being vegetarian and following Ayurveda. So this is a clinical change, like the reading change, what we call evidence-based Ayurveda. This is what the client gave it to me. I cannot ask, but she sent it to me. This is where I was, and she did not tell me until she came, until this whole change happened in her. She will not share it with me. She shared it with me only when she saw the positive changes in her. I cannot ask because I'm not MD in this country, but she shared it with me with the permission and with the sign on my paper that I would like to share this because you made my life change, not me. I always tell my clients, Ayurveda and you together. If you blend it together, you can help every client who is coming with a problem. You can see the Panchabhutik Siddhant, you can see the Tridosh Siddhant, you can see the whatever we learned in Kai Chikitsa, whatever we learn in Ayurveda. Do not leave the basic principles. This is her. Now see what happens. Ayurveda is not only for one person. When somebody is following Ayurveda, the whole family gets benefited. That's what I observe, practice, and that is what the blessings of Ayurveda is. When somebody is cooking nicely, so when somebody is feeding nicely, this person, which was her boyfriend, if you see his weight before treatment, when she started with me, he never came to see me in person. But he was doing whatever she was doing. He was just following her and he was just supporting her, her girlfriend, his girlfriend. This guy dropped from 260 pounds, he became 229. So he lost the weight only because the girlfriend was doing some change through the diet, through the lifestyle, through the way of living. and his BP was 140/70. And now, because of her and her panchakarma and her diet change and her lifestyle change, his BP came down. So Ayurveda is not only for one person. When we follow it, it is for that person as well as around that person as well as environmental too, right? So when I'm teaching my clients, this is the main key, how they learn and how they see. What I'm doing, I always share with my clients. This is how they learn by observing. And this is how I learned from my teacher. My guru is Dr. Samir Zamadagni. I have always observed sir teaching us, guiding us, showing us the herbs, showing us the real herbs, taking us somewhere to show the herbs when they are in the market, when they are in the mountains, and they will explain through the herbs, pure herbs. And this is how I continue sharing with my clients also here in America. I grow my own, I cultivate few of my herbs. There are at least 30 to 50 herbs in my garden. All from the Brahmi, from the castor, from the moringa, I have the herbs. So this is how they learn, and this is what exactly my client started doing for herself, and that's where she has got the results. This is fenugreek and moringa and lemongrass and rosemary and haldi. This is turmeric, and this is our squash. And this is why when she applied all of this in her lifestyle, she changed thoroughly. And this is where Ayurveda helped her for her PCOD and PCOS. So you can decrease any pathology, you can subside the disease, you can improve the condition of the person, you can improve the health of the person when you use Ayurveda, considering the physical level, mental level, spiritual level, emotional level, environmental level, social level, then you can definitely help the person. Thank you, thank you everyone for listening me for at least an hour and giving and trying to understand my way of practicing here in America. This is such a pleasure to be here on this forum and share with you all my evidence-based Ayurveda, the way I practice here in the United States. Thank you, Dr. Yunus and Dr. Ahire and Dr. Khod for connecting with me and giving me this opportunity to come here on this forum and represent my small talk for all of you. Thank you. Namaste.
Thank you so much, madam, for such a wonderful session. Also, you included the patient's videos, photos, so that we could get a first-hand experience. Hats off to you that you are spreading the Ayurveda all over the world. Now I request Dr. Saudamini Chaudhary, madam, to share her views for the session.
Unmute kara.
Just a minute, ma'am.
Second.
Saudamini Chaudhary, unmute please. तुम्ही unmute करा.
Ma'am, please unmute yourself.
Madam,
Dr. Saudamini, ma'am, please unmute yourself.
next घेऊ का सर मनोज गायकवाड सर नंतर त्यांना मनोज गायकवाड सांगायचं.
There might be some technical issues. So till that, now I request Dr. Manoj Gaikwad sir to share his views for the session.
Hello, am I audible? Good morning to everybody. It was really a wonderful talk by Dr. Aruna Patti, and I have excellent presentation regarding PCOS. Basically, PCOS is a metabolic disorder, and in spite of medicine, we have to change our lifestyle. So she has explained every aspect of PCOS, from the starting of the anatomical changes in the ovary, the etiopathogenesis, and how Ayurveda help. And she has described the importance of Asatme Indriyartha Sanyog and how it is helpful when Ayurveda treated PCOS, and Ayurveda gives Swasthirakshan by giving Prasanna Atmendriya Manaha. This is only because of Ayurveda. She has explained about the diet, how Viruddhahar, it plays a role in that PCOS, what kind of treatment, Shodhan Chikitsa, Shaman Chikitsa, everything, every aspect she has explained. And the important part is the cases that she has shown. That is very much evidence-based Ayurveda. And it is a very good experience while attending this very informative session. I congratulate Dr. Aruna Patti ma'am for giving her valuable time in this session. And I also thankful to the organizer, the director of Ayush, Dr. Raman Gungaradekar sir, the organizer, Dr. Bhagyashree Khoth madam, and Dr. Yunus Solanki sir, the whole organizing team. And Government Ayurvedic College Jalgaon and the team organizing this seminar. I congratulate that team that nicely conducted this seminar. I thank you all. Thank you very much for giving me this opportunity.
Thank you, sir. Now I request Dr. Bola Vijay Kumari, madam, to share her views for the session.
Good morning, all of you.
Good morning.
So, yeah. First of all, I congratulate the team who was organizing this, Dr. Bhagyashree madam and Dr. Solanki sir. So in the early morning, it's very good to hear by Dr. Aruna Patti madam. Yeah. So it's very good. And here, Dr. Aruna Patti, I congratulate you for your evidence-based treatment for PCOS. It's wonderful. Simply, you said what is the burning problem, what to be solved out. So you explained very well, and all the best for your future in US. But one thing I like to ask Dr. Aruna, is it possible to stay away without meat in cold countries? Just while I am listening, of course, there are many our Indians were veggies. But what about the other people, those who like to eat since their infantile days? So can they do so?
So the way you explain it, madam, to your clients is very important. When you do not leave the concept of psyche, the mana, when you always talk about the sattvic food, rajasic food, tamasic food, and their impacts, what it brings on you, what is happening in their body, why their body is susceptible to these changes, why it is happening inside their body. If you talk to the client, when they're coming to Ayurveda, means they're really looking forward to get rid of the problem what they are.
Yes,
get some solution or get some ease for the problem what they are going through. Like, for example, yesterday I had a client with 4 times COVID history. So when somebody is coming to Ayurveda with a hope, they are willing to change. They are interested to know what else they can do for their problem. So if you put Ayurveda, every concept from Ayurveda, don't leave Ayurveda and don't leave Ayurvedic principles. But take it slowly, meet at their level, and then you introduce Ayurveda. Education is very important. It's not, you cannot just guide the people, okay, do this, and then come and see again. It never works. I spend like 20 hours, 30 hours, 40 hours with each of my clients. And I explain everything. And when I'm working, teaching, I do not skip yoga. I do not skip meditation. I do not skip mantra. I do not skip the body work. I do not skip panchakarma. I do not skip, because when they're coming, they have so much dosh sanchiti, like there is so much stored in them. So you have to start from the Ayurveda and do not leave any small point from Ayurveda. When you use that tree, which I have showed you in that slide, everything you cover. Even my clients who are typical Catholic, Baptist, they will come to, on the day first, they will not even say a single word, and I will not even introduce a single Sanskrit mantra to them. Over the period of time, maybe when they come next time, you bring them to the mind healing concept, because mind has a lot of impact, as we know, right? Whatever you sow, you reap is the concept. So do not leave that concept. Samanane samanachi vriddhi hote viparitane ras hoto. Do not leave this concept. Then patte sati gatim nasti. Kim Aush. Do not leave that. Do not leave the qualities of the food on the sattvic level, rajasic level, tamasic level. Do not leave anything. If when you bring Ayurveda as a whole, then only I feel very satisfied with my way of practicing Ayurveda. I teach yoga, I teach meditation, I teach breathing techniques, I teach mantra, I teach them herbal teas, combinations of the food. I try to teach them each and every point regarding their disease. And then when you teach them, they get comfortable with the knowledge, and then they practice once they are knowledgeable, and then they will start having a faith in you, and they will do whatever you are asking them to do. But at the beginning, take it slow, meet at their level. First, be at their level.
Yeah, wonderful, wonderful. That's why you are spending 30 to 40 hours to a patient, means it's a great job. So that itself takes care of them. Right. Wonderful, very good, and all the best for your future, doctor. And very good, well said.
Thank you.
Thank you. Thank you, Bhagyashree ma'am.
I will request, now I request Dr. Geeta Patki ma'am to share her views for the session.
Am I audible and visible?
Yeah, madam, yes.
Yeah. Good morning to all. First of all, I would like to congratulate today's speaker, Dr. Aruna Patki madam. Excellent presentation by her. Nowadays, we are aware the polycystic ovarian disease have reached up to 33%. Why I'm telling 33? It have covered all corners of the world. Now it is not only the national issue. One among the three girls, one among the three ladies, either of they are coming to us as a direct presentation or symptoms like that. So the meaning itself, the femininity itself is at stake. She is turning towards the he, and that's a grave issue, what I understand. And on this topic, madam, you have excellently explained about not only the Samprapti or Ayurvedic principle, but what I mean to say, Desham Desham Viksham. We have the stanza Purusham Purusham Viksham. Okay, that's why the country, area, or where we are working, that is not the barrier. And that you proved it also. That's why many congratulations to you, madam. Second thing, what I like, consultancy kits, which are very, very, very important thing. Everything we read in books and application of the principle in practice is a sort of challenging, and I understood. You have proved it. Okay, that's why hats off to you, because proper consultancy is required nowadays for any patient or any client. Yeah, A, B, C, D, attitude, change in lifestyle, and last is a drug, D. It is also applicable to polycystic. Yeah, that's congratulations to you. And you proved with the evidence base also. Second thing, I would like to congratulate team of the SOUSHRUTI-2023 Jalgaon Government Ayurvedic College, organizing such a nice webinar on related to the Streeroga and Prasuti. Basically, topic is a Garbhini related. That's why I'm congratulating team of the Ayurvedic College Jalgaon, especially Dr. Bhagyashree Khoth and Dr. Solanki. If I'm not mistaken, he's HOD of the Shalya and his other co-colleagues. Thanks a lot, madam, and congratulations. And lastly, I will give the special thanks to the team who had given me opportunity to share the views. I'm highly thankful to you, madam. Thanks a lot and all the best for whole day program. We'll enjoy and we'll get benefited. Thanks a lot, madam.
Thank you. Thank you so much, ma'am. Now I request Dr. Soudamini ma'am to share her views for the session.
Hello, good morning.
Yes.
And sorry for the interruption. Good morning to everyone and to Dr. Aruna Patki also. It was a very nice, informative session. And I think it's a very difficult to explain how to the clients, how they should behave and follow the diet and go through the routine of Ayurvedic principles. Aruna, what you are doing in Western countries, really appreciable because of limited sources of conducting the therapies. And you have explained every angle of the syndrome, PCOS. So according to follow the basic principles of Ayurveda, it's necessary to go through all the hormonal assay also, and really appreciable. And thank you for everything. And thank you the committee to invite me as a chairperson. Thank you very much.
Thank you. Thank you, ma'am. Thank you, everyone. Moving ahead, now I invite Dr. Sana Sheikh, Assistant Professor, Shalyatantra Department, Government Ayurved College, Jalgaon, to conduct the next session.
Thank you.
Thank you, Dr. Dept, madam. Good morning, everyone. I would like to invite today's speaker, Dr. Vinod Krishnan, sir. Also, I invite chairpersons of today's session. So first we have Dr. Naveen Joshi, sir. Dr. Naveen Joshi is an associate professor in the Department of Swasthya and Yoga at Uttarakhand Ayurved University, Dehradun. He is also a founder member of Ayush Darpan Trust and the editor of Ayush Darpan Health Magazine. In addition, he served as a master trainer on Marma Science and Therapy for the government of Uttarakhand Ministry of Ayush. His online Marma training sessions are popular both nationally and internationally. Then next, we have Dr. Madhuri Bhandare, madam. Dr. Madhuri Bhandare, madam, is an associate professor in the Department of Shalyatantra at Ayurved Medical College, Worli, Mumbai. Her area of specialization is Marma therapy. Next, we have Dr. Sushil Vairagade, sir. Dr. Sushil Vairagade, sir, completed his undergraduate and postgraduate studies at Ayurved Medical College in Worli, Mumbai. He currently works as an assistant professor in the Department of Shalyatantra at Government Ayurved College, Nagpur. In this session, we have the privilege of hearing from the Dr. Vinod Krishna sir, a highly knowledgeable and experienced speaker. He is a senior consultant at Amiya Ayurvedic Hospital in Pattambi, Palakkad, Kerala. He is an expert and master trainer in Marma Chikitsa, which involves treating patients with musculoskeletal disorders using Marma therapy. So today he will explain Marma Chikitsa for breast cancer prevention and pain management. So I would like to invite Dr. Vinod Krishnan sir to begin his session.
Hello. Am
Yeah.
I audible?
Yeah, you are visible and audible. Please go ahead.
Thank you, sir. You are also audible and visible. That's the main prestigious thing for me. Okay, sir. Today it's a happy day because I'm presenting another aspect of Marma therapy. And this may be a new attempt because generally we are using Marma therapy in neuromuscular diseases in ortho complaints or neuro complaints. This is another attempt. Okay. First of all, I express my sincere thanks to the principal, Government Ayurvedic College, Jalgaon, Maharashtra, and also the Department of Streeroga and also the Shalyatantra, who conducted this seminar. It's a good idea regarding this breast cancer and its various aspects in the treatment and also the pain management. Now, I also express my sincere thanks and salute to the patrons of this program, Sri Azanji Musharif, Dr. Raman Khan Gralekar, Dr. Mughal Patel, Dr. Milind Nigumb, Dr. Milind Avare, Dr. D.V. Vange, Dr. Sujata Kalam, and also, of course, the backbone of the organizing is the secretaries and the other committees. I specially express my sincere thanks to Dr. Abhijit Ahire, Dr. Bhagyashree M. God, Dr. Ramesh B. Jadhav, and my guru, mentor, teacher, friend, and well-wisher, Dr. Yunus G. Solanki. We usually, occasionally, we have discussion about Ayurvedic Marma therapy, and he is a best advisor to my son who is studying Ayurvedic Shalyatantra in Trivandrum Ayurveda College. And my son, he is also considering Solanki sir as his guru. Okay. Now we are going to the subjects. Before that, I will express my wishes and blessings and also my friendship sharing with the co-speakers. Already Dr. Presented one paper and I was listening it was very wonderful and different aspects, how we can manage the treatment and everything. Okay. Second thing, I express the participants and the doctors, students who are participating in this program. Okay. Anyhow, breast cancer is a complicated disease. Comparing to other diseases, the problem of the cancer is there is very limited accurate treatment and life-saving methods in cancer. The severity of a disease depends upon, is it sadhya or asadhya, or in asadhya, is it krichar sadhya, what type of condition, or how we can save the life of a patient. If you can save easily with simple medicines, then we can say that's an easy curing disease, and we never bothered about it because you can go to a doctor and take the medicines from a supermarket like that. It's very easy, but the medicine is very rare and not available. And even though if a medicine gets, but the result will be very 10% or a very feeble, or we cannot expect the maximum. So that diseases we say it's a deadly disease. So still cancer is a deadly disease. In this total cancer varieties and types of cancers, hardly 10 to 15 or maximum 20% we can treat very effectively and very sharply. That means we cannot predict what would be the result of the treatment if we treat the patient and we cannot predict the pathology, or we can predict what will happen after 1 month or 2 months. Reverse may be happen. So this is the symptom, or this is the problem we are facing in the management of cancers overall. But breast cancer is more complicated because area-based breast cancer is more problematic. Okay. In Ayurvedic classical text, we get very less description about cancer. Roughly, Arbuda is and hardly Acharya Sushruta given hardly few slogas, or we can say 1 or 2 pages about Arbuda. But nowadays, cancer or Arbuda in modern science and also Ayurveda, it is with a million, so many books of knowledge. So that we want to accept. What was the reason for this one? Actually, on the olden days, when our Acharyas written the books about, or granthas about these Ayurvedic subjects, that period, I think according to my observation, the number of cancer patients was very less. And also they were following a Prakriti balancing or nature balancing way of life. So what happened? The problems or the issues taking place in the body of a patient was very, very less. If more complicated issues are taking place either in the body or otherwise in the mind, then automatically that will leads to cancer or other diseases. It depends what type of mental stress, then mental problems you are taking place, and also what type of food you are taking place, natural foods, or is it okay to your body, or is it making any issues in your body, and also how your mental conditions with your family, and also your relationship with the social system, and also how you are dealing or how you are conducting your relationship with your colleagues in the profession or in the work. So any side effects or any resistance from your family, your social system, or otherwise from any other professional aspects may induce, may inject, or it may trigger cancer. So that is the problem you can face in the, I would like to get the previous slide. Hello. Previous slide. Okay. Again, previous slide. Next. Previous slide. Okay. Now in Ayurveda, this Arbuda is there. Arbuda is the word which we are referring or explaining about cancer. So what's the problem means from the explanation of the Arbuda mentioned in the Ayurvedic classical text, the symptoms and everything very less already I told, but the problem is that one, nowadays we are facing a highly terror-formed cancer patients. This type of cancer was, I don't know, was it available on those days, or the management was, or otherwise our Acharyas forgot or they neglected that type of symptoms. And another one is Granthi. Granthi we cannot say Arbuda because mostly it is benign tumors, but this may leads to Arbuda in later stage. Next is Vidradi. Vidradi is also again another problem. Vidradi, under Vidradis we can consider, especially in the breast, in the under Vidradis we can say is Stanarbuda in later stage, not always. So roughly we can coordinate. I think we want to do more research and take separate divisions in the case of breast cancer or otherwise all the other cancers, and we want to unite together and we want to develop a cancer treatment and its methods. Next slide, please. Now, this is simply 7 I mentioned, but there are more than 20 or 30 types of breast cancers are there. In this one is angiosarcoma. Angiosarcoma means actually it's a complicated cancer, and this can be not this one. Previous slide I want. Hello. Okay. I will, madam, I will tell next, then only you please change it. Angiosarcoma. Angio means the chest area, especially the pectoral area. And this sarcoma, again, it's a deadly, complicated condition. And ductal carcinoma, then when the ducts of mammary glands get carcinomated, it's again another complicated condition. And next is inflammatory breast cancer. That means inflammation of the lymph glands and lymph channels. And this may be different type, and inflammation there will be. In that condition, there will be fever and the other complications. Next is invasive labor carcinoma. That means it originates in one area and it moves to other areas. Next one is Malbi cancer. This is also a complicated cancer. You will get all these details from the text and the internet. Next is Pages disease. This in the nipple area, there will be pages like that. Pages means osteoarthritis and that of conditions getting before puberty. Next is recurrent breast cancer. Recurrent type of conditions. So different types of breast cancer observed in this area. So I suggest the new doctors and also the practitioners to concentrate on different types of breast cancer. Now in India, in Kerala, there are a lot of collaboration between Ayurvedic doctors and also with allopathy expert in cancer management. Together works are going on. Even trying with our medicine. One research was in between, I am telling that the effect of Rasagandhi Melugu, one rasa preparation, and that is the only drug effective in the pain management in cancer. But now in allopathy, they are giving the OPM or the ganja, that the preparation of the ganja that they are giving for pain management of. But our Rasagandhi Melugu is more effective. Studies conducted and it is highly effective, but we are not propagating it. We can give this Rasagandhi Melugu in different areas of the cancer. Okay, madam, next slide. Okay, this is very important. Already Dr. from USA, she explained about Nidana of the breast cancer. Actually, we cannot say what is the exact way of Nidana or what is it. Generally, we can say that Mityahara Vihara, and when we are swinging a gate against the flow of the nature, against the Prakriti Purusha, against the combination of the Prakriti, so that we can say the reason of the or the Nidana of the. Nowadays, everything in the practice or in the usage is artificial. If you get a material which is available in the natural form of the nature, for example, food items or otherwise water or whatever it may be, that never make complications to you. But if you make a new material chemically with a new combination and it is not natural, For example, paracetamol, there is no plant in the world, or you cannot get paracetamol as it is from any mines or any area in the world. It's a combination. So what happens? It is, according to Ayurveda, it is asura. It makes reverse action, like the new generation foods. It is tasty, giving quick result, but it is asura. Always asuras are more violent and acting than devas. Deva means Swatiga, asura means Rajasa or Tamasa. So this explained the doctor from USA about the food, Satika Rajasa food, which we want to get. Again, it's another complicated thing that if a person is Rajasa in Prakriti, up to what level the Satika food will act on his body. Again, Tamasa person, up to what level of Satika foods or Rajasa food may act on this one. So that concept we want to take. The same Satika food is not Satika to another person. Okay, next slide. Okay. Next. Okay. So already I'm telling that the reason or nidana of the sthana cancer, or otherwise breast cancer is not indicated in Ayurveda exactly. Somewhat some descriptions are there, but that is not sufficient to manage the breast cancer patient nowadays. And we want to derive a lot of drugs, new drugs and combinations and all other methods for the treatment of it. Rest of the treatments which we are following is general and not specific. Now we are coming to the symptoms. The first symptom in breast cancer may be lump mass. It's also called lump mouse. A mouse is moving around the breast. It's not in a particular or firm or stagnant in one area. It is moving like a mouse. So it is moving. So that condition is called the lump mass. This never be a cancer indication, but there will be chance for cancer indication. So that if a lump mouse is feeling, then we want to observe what is the style and is it making pain in future or in coming days, and is it enlarging, that we want to observe. So according to my suggestion, after the menarche, we want to advise the girls how to palpate the breast and feel their style of or any other complication in the breast regarding this lump mouse or something. So this in future they can continue in their life to identify lump mass. Next is inverted nipples. This is one special indication. Usually the nipple will be projected or protruded. If it is inverted, it is going sunken or inward, that is another symptom. And next is the discharge. Any various discharges are coming, frequent discharges there, and is with blood or pus, then it want to be careful. Next is pain. Pain means usually there will be pain in any type of breast complaints, and that indicates there will be a pathological development. And it may be one symptom or any of the symptom is going to other condition, then there will be chance of cancer. Next is redness, that is inflammation. Next is leaf gland enlargement in breast area or otherwise neighboring area. Next is bleeding. Very rarely bleeding will start. It may be due to the symptom of the breast cancer. Then resting, that means any type of throbbing type pain and like that one. Another indication is especially headache. If frequent headache is coming and it is not under the control with medicine, it is not becoming controlled, then you must suspect, is it a chance of breast cancer? Another one is that suddenly the patient starts fatigue. Then you go through the blood routine and everything and also examine the breast palpation and everything, then you will get the idea is there is a complication of breast cancer. Next one is the typical symptom of the Agni dyspepsia. So these are the symptoms we can we want to cover in a lady who is coming to your clinic with then automatically 1% or 5% of your idea must goes to breast cancer. Next slide. Hello. Next slide. Okay. Now, in India, according to some statistics, about 40 to 50% of 15% of the ladies are with the breast cancer. Mostly the symptoms is, according to the expert, it is starting after 50, but it is not correct. We are getting it before that one, after 25 or 30, there will be chance of breast cancer. Some complication. If these complications are observing in your patient, any type of mouth infection, any infection in the mouth area, and don't take it is Asyabaga, Gandhabaga, or otherwise any other oral complaints mentioning in the Ayurveda classical text. Think about a link to the breast cancer. Next is the throat infection. In the esophageal or in the throat infection, there will be a chance of it. It will be a symptom of the breast cancer. Next, different sinuses, frontal sinus, maxillary sinus, repeated sinus inflammation, sinusitis. There will be a chance of breast cancer. Next is the lungs. Repeated bronchitis or otherwise any type of cough, productive cough or non-productive cough. If it is not responding to the medicines, then immediately suspect about any type of cancer is there, and especially the breast cancer in the ladies. So through the complications, we can finalize what is the breast cancer, or we can diagnose it. Next. Already I explained this one, Ayurvedic classification, it is Arbuda. But in Ayurveda, we get two types of classification along with the dosha base, Adyarbuda and Durarbuda. Adyarbuda means cancer is coming in one particular area and we can treat with it and it's curing. But again, after a period of months or a year, then again, in the same place, if breast cancer is coming, in that condition, it is called Adyarbuda. And another complication is Durarbuda, means it is moving to other areas of the body, and it's called metastasis. That means if in the lungs, the cancer starts, it moves to vertebrae, liver, breast, brain, and other areas. So that is called Durarbuda. So this is the amazing or astonishing fact that these type of descriptions are there in Ayurveda, Adyarbuda and Durarbuda. Even that one, allopathy doctors find out very later. That means 30 or 40 years back, they find out that there will be a spreading pattern like this. There is no reference in the previous text in modern books about Durarbuda. That means metastasis, which is going. But now they are telling that it is spreading, not it's an origin place. It's spreading to the other areas. So Ayurvedic classification is there. But even though this type of descriptions are there in the Sushruta Samhita, Arbuda treatment and its classification and more details are not getting. I don't know why Ayurveda Acharyas missed these things. We want to do historical research for that one. Okay, next. Okay. So, spreading pattern of breast cancer. Already I told you the origin may be in the breast or some other areas, or if it is in the breast area, sthana area, it may move to the uterus through the lymphatic vessels and channels. This may move to the lungs. Already I told it may move to the vertebral column. It may move to the liver areas, brain, and kidney also. So there is no specific area where to it moves. there is no specific pattern of movement or spreading in breast cancer. Actually, what is cancer? I'm telling that everybody know that if a cell is growing and maturing, then it multiplies. But in cancer, premature growth and also multiplication is taking place, and the speed of the multiplication will be very high, and this leads to so many complications. So that is the basic structural development of the cancer, and still we don't know why it is happening. Not in everybody. Is it okay or not? It's good or not? But anyhow, that is the complications are there. So spreading pattern, we cannot say the same train may move in the same railway track in every day or every time. In cancer, it may move in another railway track into another station, or sometimes it may goes to opposite side, and sometimes it may goes to the loco shed, and the directions are different. That is the case of breast cancer. That means it is not following the Prakriti. It's not following the Prakriti Purusha concept. So that is the difference in the case of breast cancer. Next slide. Okay. Now I am coming to the Marma related breast cancer. Actually, this is a new theory or concept I am deriving. Not only me, a group of doctors in practicing the Marma. Actually, I am very afraid of presenting this paper related with Marma and breast cancer and the Indian lion or legend of Marma therapy. Dr. Naveen Joshi is moderating the paper. He is the king of Marma therapy, and we together, he is my close friend, and also he is very expert in Marma therapy, and we also together we are going for presenting the papers in various seminars and colleges regarding this one. So this is a different subject, and I think after my class, Naveen Joshi will add more about this breast cancer. Next slide. Okay. Every time we are telling that prana and marma. Actually, prana is the main thing in the body. If the prana is properly functioning, then there will be no disease. And prana and its outcome, we can say as ojas. So what happening? There are 107 marmas according to Ayurveda and 108 marmas in Tamil. Marmas are the energy plants or the transformers in our body. But prana means it is oxygen or air, or that concept is going into our body by inspiration, and it is making its action in our body, and that gives the life. Actually, life is Chaitanya, not prana. Prana is like a cylinder gas which goes to the gas stove, and the flames are the Chaitanya. The outcome is the Chaitanya, and the prana is the fuel which gives Chaitanya. If the prana is cut off, Chaitanya is cut off. That means the person dies. Whenever the prana is cut off, automatically the flame of Chaitanya will be over. So prana is very important in the marma. And if it is working very properly, then there will be no diseases. Ojas will be okay. But in cancer, what the problem is, in the initial few years or months, even without any symptoms, the Chaitanya or the ojas in the body of the patient will be glowing. So that's a different in the case of cancer. Cancer patient, we cannot diagnose the patient, but there will be no symptoms. Ojas will be okay, everything will be okay. But internally, the prana is blocked and it makes complication. Next slide, please. Okay. If proper flame is there, if proper prana is going on, there will be no carbon on the stove. But if there is some problems, obstructions, then the flames gives char or otherwise black colored things. That is, we can say, disease or cancer in here in this case. Next slide. Okay. What are the direct marma involvement? In the sthana area, two special marmas are the Stanarohida marma and Stanamula marma. Stanarohida means 2 finger above the nipple and Stanamula 2 finger below. We can say that is locally, these two marmas are the areas of the breast cancer. In normal case, actually it is not lethal. These marmas are kalandra pranaras. That means the patient may die after 14 days, in between 28 days or after that. But it is not such a pranara. So area based Stanarohida marma and Stanamula marma. Next slide. Next is the Hridaya marma. Area based, the relationship with the marma is that Hridaya, it is very near to the or in between the Sthana marmas. So Hridaya functions are okay. There will be no chance of getting, not fully, chance of the breast cancer. Next slide. What are the other marmas? Indirect marma involvement means if Lohidacha marma, Kachadara marma, Nila marma, Manya marma, Brihadi marma. Lohidacha marma in the axilla you can see in the photo. If that area is affected, automatically the drainage of the lymph from the breast or reverse, there will be chance of obstruction and this may lead to cancer. That means the chance is only 5%, but that 5% we cannot predict in which patient or in which woman this may happen. Next is again Kachadara marma. This Lohidacha marma and Kachadara marma is very near, hardly 2 fingers different, and it is hidden marmas. Normally there will be no chance to get injury, but in warfield only one can expect. Next is Nila marma. Nila marma, anatomically it is the upper lobe of the thigh, and Anya marma, it is the backside of the neck in the central area. Another marma is the Brihadi marma. Brihadi marma is just opposite to the Stanamula marma. So if these marmas involved and it is not powerful, then there will be chance of breast cancer in ladies. So the energy flow through these marmas should be indirect marma. These indirect marmas should be very proper. They want to take, I'm explaining what are the other things to be done. They want to take proper exercise, food and everything. Next slide. And in a breast cancer, where we can expect the pain originating? Any pain in these areas, for example, in the Lallada area, in the throat area, that means Adam's apple location, and it is called Kokki marma in Tamil, and the Bhuja marma, that shoulder points, in the Urvi marma or Bahi marma on the hands, and the breast area, then the liver area in the front side, then in the uterine area or vaginal area. In the back side also again the Krigadiya area, Bhuja marma area, that means the shoulder joint, and Bahu area, and also the Parsasandhi area, and also the elbow joint. If pain is persisting in this area continuously, then there will be a chance of cancer in future or present. So this area should be considered. Next slide. Characteristic of pain, this breaking, cutting and bursting, and in some cases there will be no pain. So any type of pain originating in the breast area or other areas, and it is repeatedly getting and acting, or otherwise the pain is sustaining there, then you must be very careful, and there will be chance of sthana arbuda or breast cancer. But the problem is that this may be an indication of the other complications of liver or otherwise heart or kidney or other areas. So you must be very careful. Okay, next slide. Yes, next is prevention aspect in breast cancer. This is very important. My topic is prevention aspects. So food is the main thing. Already the first presenter told about the food understanding. Actually, I told that one the food, Satika, Rajasa, Tamasa classification. Generally, we in college and in between the seminars, we say that always Satika food be taken, Satika food be taken. Like we are concentrating on the Satika. The Satika food, according to the karma or what type of work we are doing, there we want to consider the Satika. Satika means those who are not doing any physical hard work, but intellectual works, they want to take the Satika food. And if a person is doing warfield as a soldier, then he want to take the Rajasa food, not Satika food. Yes, because Satika food taking person cannot fight properly. So food will be very. So next thing is the exercise. Here exercise means different type of exercise, yoga, and also Kalari martial arts, and also karate, kung fu, even plays like football, volleyball, everything is exercise. So if proper taking exercise, then there will be very less chances of. Usually in India, according to Indian status, usually people take exercise up to 40 years. And after that jogging, they think that jogging or walking is the best exercise. That's not correct. All the muscles in our body, both external and internal muscles should work, and proper setting should be there. And already in our classical text that Ardha Shakti Vyayamam, that means not fully exhausting, half exhausting, and not every day, maximum 5 days is sufficient. Next is the sleep. If sleep is not proper, definitely there will be so many diseases. For example, a person is continuously taking night duty, then there will be chance of different diseases. And one of the diseases is the breast cancer. And for example, nurses are taking continuously night duty, then there will be chances of different uterine or breast related diseases. Next is sexual life. This is very important. Already doctor told about this one. If proper sexual hygienic active sex is taking place maximum in a life, there will be very less chance of breast cancer, uterine cancer, fibroid, PCOD, PCOC like conditions, ovarian cyst and everything. And also, if sexual life is performing mental, what we can say, nirvana will be very high, ecstasy will be very high. This may leads to proper health. Usually in our classes, Naveen Joshi and me talks about the importance of the sexual life. I suggest this one also, because in sexual intercourse, sexual mating, it stimulates all the Marma points in our body, because in our body there are 107 Marmas in Ayurveda and 108 Marmas in Tamil. In between the sexual intercourse, each of them mutually stimulate all the Marma points in the body, and this will lead to, if sexual life is not satisfactory, properly, regularly, or otherwise satisfactory, then there will be chance of breast cancer. For example, if husband is working somewhere here and in Kerala, and the wife is working some other areas, and they get hardly few days in a month, or otherwise within 6 months they get very few days for sexual life. So there will be accumulated sexual frustration, and this may lead to breast cancer and also uterine cancer, uterine fibroids. Second thing is that the reason of increasing of the breast cancer and also this thing is that nowadays after 2 delivery, they cut off that means due to the sterilization, then the hormones act in the other areas. So according to my observation, the uterine fibroids is due to the sterilization after the delivery, 2 delivery. Then the hormones are acting the different age. That's the reason for the uterine fibroids. The same thing is in the breast cancer. Next is the Panchakarma therapy. Panchakarma therapy is the purification. Earlier in Kerala, I am from Kerala, it was custom. Now also some families are traditional families. It was mandatory to take purgation every month once in. So that purifies, the accumulated dosha in our body purifies. Now I think we want to take it once in a, because we are taking all the artificially prepared food items. Next is the Marma therapy. Madam, next slide. Hello. Hello.
Yes, sir. Yes, sir.
This is ghee. I forgot to put a photo here. I will tell it. Please, next slide. Okay, I will come to this one. Ghee is properly, suppose you are taking the ghee, then there will be very less chance of cow ghee if it is taking cow ghee. Because what is the importance of cow ghee? In Susura Samhita, it is mentioned that every month at the time of the pregnancy, you want to give ghee to the mother, the pregnant woman. Why it is? Because the only food item in the world which is balancing the Panjabhuta is ghee only. For example, suppose you take fruits, then it will increase the rasa dhatu. If you take mamsa, it will increase mainly mamsa dhatu. You take asti, then it will increase the asti dhatu. But only material, food material, which we can use to proper balanced development of a fetus is, that is cow ghee, because it is very balanced. And it equally improves the dhadus in the body, and that is, and Panjabhuta, the 5 elements, and that is only the cow ghee. So like that, here cow ghee is taken, then there will be chance of minimizing the chance of breast cancer and all other cancer. So prevention aspects of the breast cancer, my suggestion is, first one is massaging Adhipati Marma on the head with oils, plain oil. We can take coconut oil or otherwise til oil, or otherwise you can use Chirabala repetitions above 41 divisions, or otherwise 101 Chirabala. Suppose you put some Chirabala on the head or Dandam on the head, then clockwise application, that means pressure application. Suppose you give 5 minutes every day, that will reduce the chance of cancer all over the body, and also especially in the breast area, and it will minimize the pain. Next slide. Next slide, please. Okay. In prevention aspect, another Marma point is Shankha Marma. Shankha Marma is in the lateral side of this, the position already mentioned there. In clockwise, suppose you apply pressure on that particular area clockwise with the oil application, Chirabala or otherwise Dhanandra Thailam or plain ghee you can apply. That will reduce the pain in the breast area and also reduce headache and other complications. And this will be helpful for management of the pain and also prevention. Next one is Sringadaka Marma. Already it is below the skull, I mean base of the skull. And Sringada, the importance of the Sringadaka Marma is the meeting point of the eyes, nose, ears, and the tongue. And if you apply Nasya, it acts on the Sringadaka Marma. And this Sringadaka Marma, it's spread to all other areas, because suppose you go how it is action, the action of the Nasya, it is clearly mentioned that it is acting on the Sringadaka Marma and it spreads to all other areas of the body. So Sringadaka Marma is very important. So in that condition, again Nasya is coming, Nasya, then Kabala, Gandusha, all these type of techniques you can apply according to the pain style of the patient. You can use either Dhanyamla or otherwise milk or otherwise Mamsarasa, soups, even Arista you can use for Kabala or Gandusha. Next is the Nila Marma. Nila, already I told that it is upper lobe of the thyroid. Here you can use pressure application and it will minimize. And Nila application, you want to sit the patient, but in Shanga you can, in Nila you want to lie the patient, and Shanga you want to sit the patient. Okay, next. Manya is the another Marma, because Nila and Manya is brothers, but their action are different. It is in the back side. I put the points in the front side only. That is for visual purpose. And Lohidacha Marma already told that in the axilla, you suppose in stretched condition, suppose you apply pressure on that area, then it will minimize the pain. Next is the Kachadara Marma. Again, I told. So in Kalari martial arts, stretching pressure application is given. And in foot massage also, sorry, that is Padagada. In Padagada, we give in stretched condition. That means hands are stretching, then giving the pressure. Okay, next slide. These are the marmas present in the hands. All the 11 marmas are there. Kachadara marmas to the Chipra or the Talahridaya, Kurcha Silas, all the marmas. Any type of pressure application giving on the hands in stretched condition, different stretched conditions. That means pulling to the sideways, to the backwards, and to the front sides, and to the upper sides, and giving pressure on different points. Or overall oil massage will give result to the pains. And with the thumb, you want to give the pressure, and thumb application will be more effective. I think at the time of the conclusion, Naveen Joshi will give more details because because I cannot explain how can all this, because it's not fully visual. Next slide, please. Okay, prevention aspect again, Talahridaya Marma. Every day with oil application, pressing and releasing in the Talahridaya Marma, it is highly effective to reduce the pain. In Chipra area also we are applying that one. And Chipra, actually we say this portion is the Chipra, but these points are Chipra in Tamil Marma. So not only Angushtanguli Madhyastham, but other finger joints, in the gap between the other gaps, fingers also you can use as Chipra Marma. Next is the most predominant Marma in controlling the pain is Indrabasti. In Indrabasti, pressure application with 2 thumbs you can use. And this another one is Ani. And Ani is also called Kaitharipan Marma. That means local anesthesia giving, and it gives pressure anesthesia to the other marmas. And Urvi Marma also. Urvi means in between the upper arm, and it is called Bahyu also. Next slide. Okay. Prevention aspects in breast cancer. Already I told Adhipati Marma, Sringadaka Marma, Neela Marma, Manya Marma, Abalapa Marma, Apastamba Marma, and Nabhi Marma. Here the problem is that one, Apalapa Marma and Abastamba Marma is breast. So very soft application, soft pain, and clockwise movement around the nipple, and close to the nipple and away from the nipple will help with the oil application. And Nabhi, another important area, because Nabhi is the center of the body, and it is the connecting point between the umbilical cord and this one. So Nabhi application, actually we do it, lie the patient on examination, in the treatment table or a Dara vessel, and then pour some oil. Usually we apply the another thaila, then clockwise massage. And always this give very good result, not only for this, so many other complaints. Next slide, please. Prevention aspect of breast cancer, Marma pressure massage, that is prevention aspect. So what we are giving, the theory behind is that prana is flowing all over the body, and each Marma points are connected. Sub-Marma areas are in between each Marma points, because 2 Marma points are there. Neighboring Marma points are there, Marma areas there, and rest of the areas the sub point. All over the body is totally, we can say it is a Marma. So that Marma pressure we are giving them Marma points and surrounding areas, that will prevent various aspects in the pain management and prevention or origination of the pain. Usually stretching massage, stressing, you stretch the body of the patient. In Kalari, we are doing it, Kalari martial arts and foot massage. Stretching massage always. According to my experience, those who are practicing the Abhyanga or body purification, Panchakarma therapy, there will be very less chance of getting not only cancer, but other, because it is eliminating the doshas from your body. Next is the Labana. That is to prevent prevention, and this one, Marma Guliya is one of the very important treatment application of the medicine. With butter, we are making a paste and putting it around this. Generally, even other ladies also you can use. this one, Marma Gulika, at least once in a week, that may prevent. Another one is sandal paste. If it is cooling, because breast area is cooling area, Kaba area, so cooling materials like sandal paste, then Shirisha, Shariba, like that one. These things you can use and make a paste in butter. Then cold application of the Lebanese will prevent the formation of the breast cancer. And pressure massage. Next is stressing massage. Already I told different types of stressing massage is there. Next is bandhana, different type of tourniquet near areas or away areas will help in breast cancer prevention and also pain management. Next slide. Okay, I forgot to put a photo here because okay. Another main thing is that Nasya. Already I told that Nasya is highly effective to prevent. Here actually we want to do Tishna Nasya, but sophisticated. For example, Sarshabal Thaila, you mix Sarshabal Thaila with coconut oil, til oil, any other Chirabala like that one. Then you apply this Nasya once in a month for 3 days. That will prevent the chance of cancer in your body. Also in breast areas. Already told Gandusha and Kabala. The Kabala, Gandusha materials you can select. Which Dravya you want, you can select. Another one is Karnapurna. Every week, at least 1 or 2 days, you put few drops of oil suitable for this one. In Nasya, you can use Vajadi Taila also. Vajadi Taila is highly indicated in Abaji, Gandusha, Kandamala, like that one. That the same drug you can use in this also. Next one is Siropiju. Siropiju is a simple method. You just put a cotton cloth and put some oil on head. This will help you to remove all the bad energies in the brain, Sahasrahara, Padma, or otherwise Ajna Chakra, and all other Marma points, or otherwise Shat Chakras. So Piju, every day, suppose you are putting oil on the, according to Tantra, there are 64 Tantras. According to Tantra, when you are practicing the Tantra or Shat Chakra methods, they are advising to put oil on the head, Shiro Piju. Okay, next slide. Pain management. Already I told that one. Pressure management. Talahrida Marma, Indravasti Marma, Ani Marma, Urvi Marma, Arsh. Then, sorry, it is Amsa Marma and Amsa Balaga Marma. So what I'm telling means these are the mechanism to prevent the pain, but you want to think about what is the root cause, how can you remove it? That is another thing. Marma applications you can use and other methods you can use. Next slide, please. This is very important. Brihadi Marma application. You apply pressure with oil on the Brihadi area, because according to Tamil it is called Chorati in the blood circulation increase on that area, and also in the Parsha Sandhi is very near to this breast cancer area, breast area. So these two marmas are very important. Backside massage always release the pain complications. Next slide, please. Next slide. Okay. Already I told that Vamana. At least once in a month, simple Vamana you can practice. Then there will be less chance of cancer. The cost of Vamana will be very less, maximum 200 rupees or 300 rupees. They can do it themselves with salt water. By Vamana, the dosha goes out. Next is the Virajana. Already I told that the cost of one Virajana drug is about 25 to 30 rupees. And if a person do it every month once for 1 year, it costs about 3,000 rupees maximum. From 20 to 55, 60 years, if they are practicing, the cost of the Virajana drug is hardly 35,000 rupees. But Now we are doing these procedures. We are compelling the patients to follow their these things. And by this, the chance of so many diseases, including cancer, kidney diseases, then cardiac diseases, and so many other conditions. So even the diagnosed patients, you can try with this one, Virejana. Next is Vasti. Vasti is highly antioxidant. With Dhanvantara Taila, Matra Basti is doing every month, at least 2-3 days, Dhanvantaram Tailam. So you can arrest so many diseases. And especially because we are conducting a study here, by this, the Basti is highly effective. Next slide.
Excuse me, Dr. Vinod Krishnan, we are running short of time, so please, if you can.
Within 5 minutes, I can finish.
Thank you.
Next is Shira Duma. Already I told Dashmola and Karaskara we can use. With this one, you can minimize the pain in the breast area. Okay, next slide. Next slide, please. Okay. Diagnostic method. Everybody know this one, USD, mammogram, MRI, biopsy. Next slide. Next slide. Already I told about different bandages. Next, few tips about what is the reason for cancer in astrology. And astrology, if the planetary position, alignment and its distractions take place, then in particular planetary alignment, there will be chance of cancer. Next slide, please. Hello. Next. Okay. This is astrology and Nasya, not only Nasya, which selection. Next slide. Next slide. Next slide. Okay. When we are thinking astrologically, when we are thinking about the breast, we want to think about the position of the moon. By this, we can predict different aspects of the moon in ladies and also the breast milk also. If in a zodiac, both Mars and Saturn is aligned with the moon, there will be chance of breast cancer. And in which period it is coming in their horoscope, there will be chance of breast cancer. Next slide. Then cancer and the moon position in your horoscope, is it full moon, then there will be, in horoscope it is full moon, then there will be very less chance of cancer. But it is in the black moon area, that means that 14 days, there will be chance of cancer with alignment of the Mars and the Saturn. Next slide. Next slide. Okay, that is Mrityunjayam. Mrityunjayam is one method of Homa we are following, and it is highly effective to reduce the, because here when we get the patients, we suggest them to follow Mrityunjaya Homa and Mrityunjaya Mantra. Dr. Naveen Joshi will explain about that one because I have no time. Next slide, please. This is body astrology and Marma. What are the link between the Marma points and the astrology? And from this, we can predict what are the complications we can expect. One lady can expect. Sthana, this one, cancer. Okay, next. Okay, thank you very much. Sorry, I took a little more time. I don't know because my watch was not here. So I am very much thankful to the authorities and especially, Solanki sir and all the other. Thank you very much for giving me a chance to this. Thank you.
Thank you.
Thank you so much, sir, for presenting a new aspect, that is Marma therapy in pain management and breast cancer. Marma Chikitsa is an innovative modality and young generation needs more guidance. Now, I would like to invite Dr. Naveen Joshi, sir, to give his views.
Thank you, Government Ayurvedic College, Jalgaon, Dr. Yunus Solanki, sir, and Dr. Sana, for inviting me as a chairperson of this beautiful presentation, which is given by Dr. K.T. Vinod Krishnanji. He beautifully explained about the Marma role of Marma therapy, especially in the breast cancer or cancer patients. I already he already explained many things about this, and last he explained the Mahamrityunjaya mantra, Actually, it is very essential to know about the mantra and Om Trayambakam Nejamahe Sugandhim Pushtivardhanam Urva Rukumiva Bandhanat Mritturum Kshiyamamritat. This mantra already explained about how to reduce pain, means the painless demysal. And one mantra I also want to add, that is mentioned he also mentioned in his presentation in last, Durga Saptati. There is a mantra, Gulfayo Nara Singhi Chapada Pristay to Tejasi, Pada Angule Surakshes, Pada Vasani. This is a mantra in which all the Marma points beautifully explain that, oh Goddess Guru Durga, please come and recite Gulfa Marma as a Nara Singhi, Pada Pristay to Tejasi, and Pada Pristay the Tejasa, Pada Angule Surakshes, as a Pada Angule Surakshes, as a Chipra Marma. So very beautifully explained, Dr. Vinod Krishnanji. So many times we met in many different programs. Your presentation is very nice. And Marma therapy is really a very, very important, as many of the students are, I think that they joined in this session. And I think the Department of Shalyatantra is conducting this session. And it is a non-invasive, cost-effective, as well as the drugless therapy. So this is the demand of the present era. And one thing also I want to add, it's not for the patients also, it is also for maintaining your good health. So I hope that that Vinod Krishnanji have beautifully explained his presentation. As he's a very, actually Kerala is also a state in which the Marma and Kalari are, from a long time it is in the practice. They are practicing these things. In North India, yes, there is so many, there are centers in which the Marma Chikitsa is already, OPDs are going on a regular basis. And I hope that the program like this, you organized Government Ayurvedic College Jalgaon, they also create awareness to the students as well as for the practitioners. Thank you.
Thank you, sir. Thank you so much to give you a. After this, I invite Dr. Madhuri Bhandare ma'am for her views.
Good morning. Am I audible?
You are audible but not visible. Please make your video
Okay. Oh, okay. Now, yes, I think I am visible now. Okay. Good morning, everyone. First of all, I would like to congratulate Dr. Vinod Krishnan sir for giving such a new aspect of Marma therapy in CA breast, because Marma therapy is popular in musculoskeletal disorders. Sir explained very well the Marmas involved in CA breast and also the importance of Panchakarma in pain management of CA breast. I would like to add that Panchakarma are nothing but the stimulations of the Marmas. Charaka told it in the Trimarmi Adhyaya of Vimanasthana that Panchakarma procedures are nothing but the stimulations of Marma, and we should take care of these Marmas regularly to avoid the disorders. And Marma therapy is a very important upcoming parasurgical therapeutic method, and it needs further research and documentation. Again, I congratulate Dr. Vinod sir for giving such a nice and informative presentation. Sir, I would like to tell you that I am also doing my PhD in Marma therapy at R.A. Podar Medical College. And it's a very beneficial talk I heard today from you, sir. It will definitely help me in my PhD research. And finally, I also would like to thanks the organizing committee, especially Dr. Raman Ghungralekar, sir, the director of Aush, Maharashtra, then Dr. Abhijit Ahire, sir, in charge dean of Government Ayurved College, Jalgaon, and the organizing secretary of today's webinar, respected Dr. Solanki, sir, my colleague and my PhD guide, for giving this opportunity to me. Thank you so much, sir.
Thank you so much, ma'am. Now I would like to invite Dr. Sushil Vairagade, sir, for his views.
Good morning.
Good morning.
Am I visible?
You're audible, visible.
Yes, sir. Yes, sir. So, good morning, one and all. It's my great pleasure to be part of this great session by the legendary speaker, Dr. Vinod Krishnan sir, who has covered all aspects of the breast cancer preventive measures and also the pain management. It is a very good non-pharmacological pain management. It will beneficial to the patients also, and it will trigger the new scope in the management of in the pain management. Thank you, sir, for giving such a wonderful session. Due to lack of time, I'm not going to go in detail of this explanation. I also thankful to the organizing secretary, Dr. Solanki sir and Dr. Koth madam, and our director, Dr. Gungralekar sir, for giving me the opportunity as a chairperson. Thank you. Thank you all.
Thank you so much, sir. Thank you so much to Dr. Vinod Krishnan sir, Dr. Naveen Joshi sir, Dr. Madhuri Bhandare and Dr. Sushil Veragde sir. Thank you. Now we move to next speaker, and to conduct this, I would like to invite Dr. Pallavi Jadhav madam, and she is an assistant professor in Shalyatantra at Government Ayurvedic College, Jalgaon.
Good morning, everyone. Good morning, friends, for this wonderful international webinar, SOUSHRUTI 2023. I welcome for this coming session on breast disease and overview by Dr. Shekhar Kulkarni, sir, from Pune. Good morning, sir.
Good morning.
Who is a famous consultant breast surgeon in Pune. He completed his training from Tata Memorial Hospital, which is a renowned hospital in oncology, and from QE Hospital, UK. He is pioneer in the field of breast surgery in Pune, Maharashtra. He had huge experience as a consulting surgeon for more than 23 years. He is also a board of study member at Maharashtra University of Health Sciences, Nasik. He also conducted more than 250 camps of breast screening awareness. He actively participates in cancer awareness program by different medias, which is unique in his personality. Like he gives a weekly radio talks, musical shows, and he is also the another shade of his personality. I would like to mention that he played a role of in multiple as a film actor in various Marathi and Hindi films also. He is a great stage performer also. Welcome, sir.
Thank you. Thank you for the kind words.
Yes, yes sir. Just a moment. Now I will invite our chairperson for this session. Firstly, I welcome Dr. Rajesh Kumar Gupta, sir, as a chairperson for this session. He is professor in Shalyatantra at Bhai Saheb Samant Ayurved College, Savantwadi. He is visiting professor at All India Institute of Ayurveda, Delhi. He is also a founder member and advisor for Ayurveda Proctology Association. Welcome, sir. Now I welcome our next chairperson for this session, respected great personality, Dr. Veena Patil ma'am, Professor, Head of the Department, Sri Prasuti Department at Government Ayurved College, Usmanabad. She is also Assistant Director, Aush at Pune. She had a huge experience of 30 years in academic as well as clinics. She awarded by Maharashtra government for her work in COVID and organ donation programs. She also awarded by Sayadri Sri Shakti Puraskar. Welcome, ma'am. Now I welcome our next chairperson for this session, Dr. Hemlata Jalgaon ma'am, Professor, Head of the Department at Sri Prasuti and Principal, Ashtanga Ayurved College, Pune. She worked in the field of gynecology for more than 28 years. She is also nominated as a Senate member at Maharashtra University of Health Sciences. She worked at different universities like Pune University, Mumbai University, Goa University, Parul University, Gujarat, and last but not the least, North Maharashtra University, Jalgaon. She awarded with Ayush Ratna Award in 2023 by State of Maharashtra. Our last chairperson for this session, I would like to welcome our Dr. Swati Gaikwad ma'am, Associate Professor at All India Institute of Ayurveda, Delhi. She specially worked in Garbha Samskara, Menorrhagia and women health. She had huge experience of the 19 years in field of gynecology. Welcome you all, respected mentors. Now I would like to, I will request Dr. Shekhar Kulkarni sir to continue this session. Thank you.
Good morning all. Actually, I sat through the whole lecture, which was before me, and I realized that I am the odd man out in this whole conference because I do not know anything about this. And I still have to learn a lot about breast cancer, it seems. And I'll definitely contact some Ayurvedic person to tell me all these things. It's a wonderful science, and I am really proud of our Ayurvedic tradition. I could not get a chance to learn that, but I'm sure it's a brilliant thing. In fact, I am currently working in the field of music therapy for last 15 years. And I think Ayurveda has a very big connection with that. So maybe I'll contact one of you to go further in this. Right. So coming to the overview of breast diseases. And now I think yesterday, Court Madam asked me to do some slides, but I was a little busy. And secondly, I think that most of the times when I attend a webinar, I use my phone camera and phone screen, and it becomes very difficult to read slides on the phone. So it's easy to hear somebody say something. So I'll keep my talk very brief, to the point. I will not bombard you with the details because, breast cancer is full of information. Almost every week we get new piece of information, and it is difficult to cope with all that bombardment. So what I'll do is that we will divide this talk into 3 basic scenarios in breast diseases. One is screening scenario, because October month is a breast screening awareness month, and everywhere there are screening camps going on. So what are the salient points in screening? What are the take-home messages is what I'll talk. I'll talk just the dictums. I will not talk about more information. So screening scenario, management symptomatic scenario, and third is follow scenario. So when we talk about screening, we must understand that screening is done not to detect more cancers. As it is generally said that you go into the community and find more cancers. The purpose of screening is not to diagnose more cancers, but to reduce the mortality. We must understand that if you're doing screening for some disease, it has to impact the mortality of the disease. So breast cancer, there are only 3 or 4 screen-worthy cancers, as we know. One is breast cancer, the second is cervical cancer in women, and in men, it is prostate cancer because they do PSA. In Western world, they're doing colonic cancer also as a screening cancer. But in our scenario, it is breast cancer and cervical cancer as far as women are concerned. I understand that there are so many gynecologists in the audience and in the participants. So maybe, and this is a women's oriented symposium. So we'll stick to breast cancer screening. The only proven method of breast cancer screening is mammography. Sonography is not a breast screening investigation. We must understand this. People generally send people for sonography, women for sonography to do screening, but sonography is not a screening modality. Mammography is a screening modality, and if there is something on the mammography, some doubtful area, that can be then re-seen by sonography to ascertain what it is. But per se, sonography is never a screening investigation. The reason is that actually sonography is very easy, it is cheap, It is available everywhere. Mammography, for that matter, is very difficult to get. In remote areas, there are no good mammography machines. There is X-ray involved, radiation involved. There is pain, so women are afraid of getting mammography done. But you know something? Sonography is very sensitive. It can pick up very small things. If you do a sonography of, say, 10 women were walking on the road, you will get 6 or 7 women with some findings. Some cyst somewhere, some dilatation, something and something. So these all are false positive findings. They only create anxiety. They only create false biopsies, unnecessary investigations, tensions, anxieties, and they yield nothing. They do not reduce the mortality of breast cancer. So sonography is never used as a screening modality. Another thing that we generally talk about is breast self-examination. We're very fond of saying the do breast self-examination. That the woman every month goes in the bathroom and examines her breast with her own hands. In many large randomized studies in the world, it has been shown that breast self-examination does not reduce the mortality of breast cancer. So it is not a screening modality. Now, in a poor country like ours, we cannot afford mammography for everyone. Actually, it is difficult because we are a very huge country. We cannot manage our simple things like diarrhea, malnutrition, malaria. We cannot even cope up with small things. So we cannot actually go on doing big things in screening like mammography of every woman. If I live in Pune, the population of Pune is almost 60 lakhs, out of which 30 lakhs are women, out of which 10 lakh are, say, women in the screening age group. If we have to do mammography of 10 lakh women every year, it is impossible for our society, our community to do that. So Tata Memorial Hospital came up with a good idea of trial with clinical examination by health workers. They did a huge trial and they found out that doing a clinical examination by a health worker in the community is a very good modality for breast screening. So worldwide, even if the mammography is considered the gold standard, in India, for our community, we can use clinical examination by trained health workers. So as far as screening scenario is concerned, the take-home message is that mammography done after the age of 40 every year for a woman is a standard procedure for breast screening. If the person, no, we are not talking about patients, we are talking about persons because it is screening. So if a woman has a strong family history of breast cancer, where you are suspecting a hereditary breast cancer, then the age of screening starts 5 years before the first index case in her family. So if her mother was diagnosed with breast cancer at 40, she starts the mammography screening at 35. But otherwise, for routine population, mammography every year after the age of 40 is a routine standard procedure for breast screening. If it is not possible, breast clinical examination is the standard. So this is a take-home message for screening. And another important take-home message is that USG, sonography of breast, is not a screening modality. Right. Now we come to the symptomatic breast scenario. Now symptoms, as you know, they can be divided into basically pain in the breast, lump in the breast, and discharge from the breast. So we can consider what are the take-home messages from these all scenarios. Let's take pain in the breast. It's a very common symptom. Many women come with pain in the breast. So first thing we must see whether this pain is cyclic or non-cyclic. When the pain is cyclic, it means that it is coming with the menstrual cycle. So it is related to hormonal imbalances and it can be treated with a hormonal intervention. Most of the times it can be treated with simple lifestyle modifications. And you in Ayurveda are very expert in managing lifestyles and diet and other things. So cyclic mastalgia can be mostly treated with lifestyle management. My previous speaker told many things about prevention of breast cancer, in which there was diet and there was sleep and there was exercise and all healthy habits. And I'm very happy that all those points were covered. Most of the cyclic mastalgias will be or can be treated with those lifestyle modifications. When we come to non-cyclic mastalgia, that is pain in the breast when there is no cyclic pattern to that pain, the most common thing is breast abscess, a cyst in the breast. And today, I do not know whether you have come across this condition called idiopathic granulomatous mastitis. You know, a woman, I'm going to stress this point a little more because if there are many gynecologists listening to this talk, they should keep an eye on this condition when a woman, a young woman in the age of 30 to 40, generally around 35, 36, comes to you with a chronic, acute on chronic abscess in the breast, which does not heal with any antibiotic, which keeps on bursting out small pockets of pus and then forms multiple sinuses. You do whatever you do, give antibiotic, you do IND, and it does not heal. So if you have come across such a condition, which is very common nowadays, in fact, I'm surprised to see after the corona epidemic, I'm seeing so many patients of this idiopathic granulomatous mastitis. We call it IgM. Granulomatous mastitis is a kind of inflammation in the breast where there are granuloma formation. The commonest cause of granuloma formation is tuberculosis, as we know. Tuberculosis is a tubercular granulomatous mastitis, and when the cause is not known, it is idiopathic granulomatous mastitis. So, in this condition, the only treatment is steroids. People come with many antibiotics and so many other things done previously, but the only thing that works is steroids. Now, the steroids need to be given for a very long time, like 3 months, 4 months, 5 months, and then you start getting complications of steroids. And so it becomes very difficult. If you stop steroids, the granulomatous mastitis starts growing. When you start steroids, you start getting complications of steroids. So I urge my Ayurvedic consultant friends to look into this matter, because we in modern medicine are really almost helpless in treating this condition. We sometimes do complete excision of that mass, granulomatous mastitis mass, and then it may sometimes treat this condition, but it leaves a very bad scar and a very bad cosmetic outcome, because almost half of the breast has to be removed at those times. So if anyone has any solution about this idiopathic granulomatous mastitis, you are most welcome. We will discuss it, and that will be a great help to the community, because almost every day I see a new patient of IgM and I feel helpless, and the patient becomes a very miserable patient after, say, 6-7 months. So non-cyclic mastalgia in the form of granular mastitis is important. Second symptom, a very common symptom, is lump in the breast. Either it can be a painful lump or a painless lump. And as the dictum goes, painless lump is more dangerous than a painful lump. Mostly painful lumps are cysts, because they are overnight appearance of fluid-filled cavities in the breast. When the fluid becomes more in pressure, the capsule gets tense and the patient starts getting pain. So a lump which occurs overnight, a painful lump, smooth lump, is mostly a cyst, breast cyst. Fibroadenomas, breast cancers, and other lumps are generally painless. So painful lumps are generally safe. So the dictum, the take-home message in any breast lump, when a patient with lump comes, it is always prudent, always wise to put a small needle in the breast, in the lump, and try to aspirate. So when you put a needle in the lump and aspirate something, if it is a solid lump, nothing will come out. If it is a cystic lump, then a fluid will come out. So we have to see, if the fluid comes out, there are 3 things that need to be observed. One is, what is the color of the fluid? If the fluid is hemorrhagic, blood stained, then it is a dangerous sign. Second thing to be observed is that once you completely aspirate the lump with the needle, and even after complete aspiration, if you get residual lump, even after complete aspiration, if you get a residual lump, then it's a dangerous sign. And third sign is that after the complete aspiration of the lump, if this lump reappears within 48 hours to the same size as before, then this lump may be a dangerous lump and it needs to come out. So what we observe is that if the fluid is hemorrhagic, if there is a residual lump after the aspiration, and if the lump reappears within 48 hours of complete aspiration, this lump needs to come out of the body because it may harbor cancer. But otherwise, you don't have to worry about the cyst. If it reoccurs in after 15 days, 20 days, only if it is painful, then you aspirate. Otherwise, leave it behind. Leave it behind. It will not cause any problem. If the lump was solid, then you can actually aspirate some cellular material from it. The fluid will not come, but cellular material might come, and you may be able to send that cellular material for FNAC, the cytology examination of the lump. And if it gives you some good results like presence of malignancy, then you can diagnose the patient and treat further. So the take-home message is that if there is a lump in the breast, it is always good to put a needle and see what happens. Right. We will come to cancer as a separate entity after this discussion of symptoms. Third symptom is discharge from the nipple. Now, discharge from the nipple can be of many colors, many types, and many durations, chronic, acute. What we need to remember is that the only discharge from the nipple that is important is a single duct nipple discharge with hemorrhagic discharge. That means a single duct, only blood or blood-tinged fluid coming from a single duct of the breast is important. Multiple duct discharge, bilateral duct discharge are not very important because mostly they are because of hormonal imbalances, duct ectasias, periductal mastitis, which are troublesome but not dangerous situations. But if the discharge is single duct, hemorrhagic, then we have to be very careful. We have to investigate this patient because the differential diagnoses are 1, multiple papillomatosis, 2, a single papilloma, 3rd, infection, and 4th is cancer. So we have to rule out this fourth reason before anything else, and for which no investigation is useful. Like if a single duct nipple discharge with hemorrhage, sometimes hemorrhage may not be even visible. So when a patient comes with single duct nipple discharge, say a serous colored discharge, the only investigation you can ask is microscopy to find out presence of RBCs. Even if you cannot see red color, there could be microscopic RBCs in the discharge. So ask the patient to send that discharge fluid for microscopic examination in the pathology laboratory. See if there are RBCs in that. One thing you must always remember that never send nipple discharge fluid for pathological examination to find out cancer. So because most of the times this fluid that comes out of the nipple is hypotonic solution. And if there are any epithelial cells fallen into this hypotonic solution, because the solution is hypotonic, the cells swell, they become bloated, and the nucleus becomes slightly distorted, and a pathologist may mistake those cells for malignant cells, when actually, as a matter of fact, they are not malignant cells. Well, here I'm not challenging or doubting competence of our pathology colleagues, but I'm just trying to say is that investigating a fluid for presence of malignant cells is a useless investigation, should not be done. If a patient comes with discharge, single duct nipple discharge, the first investigation you ask for is the presence of RBCs in the discharge. If there are RBCs in the discharge, either microscopic or macroscopic, that is visible to the eyes, then the only procedure you go ahead with is microdocectomy. You have to remove that duct along with some portion of alveoli and send it for histopathological examination and see if it harbors any malignancy. This procedure becomes diagnostic as well as therapeutic. So as far as nipple discharge is concerned, our take-home message is that only single duct discharge is important when it is hemorrhagic, and microdocectomy is the only investigation which will give you therapy and diagnosis. Right. Now we come to the main topic, that is cancer of the breast, for which we discussed. Now, as you know, it is very common in Pune, the latest incidence, which is called lifetime incidence of breast cancer, is 1 in 22 ladies, which is almost like an epidemic of breast cancer. In US and UK and in other Western countries and even developed countries like Australia, Japan, the incidence is very high. We have to be, our index of suspicion has to be very high, because now we are seeing even young patients, young women, 20 years, 22 years, 30 years, whom in say 10 years, 15 years back, we would have said it cannot be malignancy because malignancy occurs after the age of 40. That was the age-old wisdom we had. But now we cannot take any lump lightly, even in young patients. We have to have our index of suspicion very high, and we need to go through the proper protocol to either confirm or rule out malignancy, because it is inevitable. It is must that you must rule out. In fact, I sometimes say that you assume that it is cancer till it is proven not cancer. It is always safe. So now, breast cancer is a very huge topic. We will not be able to discuss it in say 10-15 minutes, but it goes through certain protocols, and we will just take home, have some take home messages for those protocols. So first step in any breast cancer scenario is detection. Either the patient finds a lump or the patient's husband palpates a lump. You know, sometimes even the massagist in the beauty parlor who gives facial massage can find small hidden lumps in the breast cancer. So I sometimes say that we already have this huge network of beauty parlors in cities. You know, a woman may not go to a doctor for monthly checkup, but she will definitely go to a beauty parlor to get something done. So if we teach our beauty parlor beauticians to palpate the breast cancer, and they are made aware of the breast cancer, they can form a very good network of finding breast cancer at an early stage. So first step is detection of breast cancer. When either it is detected by hand because of symptoms or because of a screening mammography. It is very less common in India, but in Western world, the maximum number of breast cancers detected are by mammographic screening. The patient is not feeling anything. She goes for mammographic screening every year. And once in those examinations, she finds a small microcalcification or a small lump. So this is the best time to treat, because this is a very early breast cancer. It can be almost completely cured. We generally do not talk about cancer in the terms of cure. We generally say disease-free interval and so much of overall survival. But when we diagnose it really early, then we can have a real chance of curing that breast cancer. So either detection by symptoms or detection by mammography. Once that lump is detected, then you have to diagnose the lump. Now the latest dictum is that instead of FNAC, you should do a gun biopsy, a true cut biopsy. A true cut biopsy is better investigation. Sometimes it can be done with the USG guided guidance, or sometimes you can do it freehand. But a true cut biopsy, a gun biopsy, can give you diagnosis, the grading of the tumor, and you can actually do immunohistochemistry, that is further investigations to know the hormone responsiveness of those cancer cells if they are present. So after detection, second comes diagnosis. The best way of diagnosing is true cut biopsy, but sometimes you may do open biopsy or an incisional biopsy or some other type of investigation. Sometimes even lumpectomy is done, the whole tumor is removed, sent for histopathology, and then we realize that it is breast cancer, and then we go ahead with the further stages of the management. Once it is diagnosed, the third step comes is staging. Just knowing that patient has a breast cancer does not mean anything. We have to know the stage of the disease, because your not only management, but your philosophy also changes. You know, when you start treating someone, you have to have a philosophy of treatment. Why are you treating this patient? Are you going to cure this patient, or are you just going to control this patient or the symptoms or the tumor, the disease, or are you going to just palliate the disease? So your philosophy, your aim and objective of the treatment should be absolutely clear when you start treating the patient. So when the patient is early breast cancer, your aim should be cure. When the patient comes with locally advanced breast cancer, that is cancer only in the loco-regional areas, but not spread to distant areas like lung, liver, bones, then your aim should be a good disease control and a long disease-free life. But if the patient, unfortunately, which happens in India more of the times, if comes at a later stage, then your philosophy, your aim and objective of the treatment remains just the palliation, just control of symptoms. You do not do any heroic things. Even if there is a small tumor in the breast and some lung metastasis and liver metastasis, you don't touch breast cancer because it is not going to be useful. You don't, by excising that tumor, you generally don't achieve anything. So in that case, just palliation of symptoms is your philosophy. So staging investigation. So third point after the diagnosis is staging. The commonest sites where breast cancer spreads is lung, liver, bones, and sometimes brain. Apart from these 4 sites, generally breast cancer does not go anywhere. It can, of course, it can go anywhere theoretically, but these are the 4 sites which need to be seen at the time of staging investigation. So the simple investigations, if you do sonography of the abdomen, you can see what has happened to the liver. If there are any liver metastases, you can find out on sonography. Simple X-ray chest will give you the status of the lungs. For bone metastasis, the commonest affected area is generally lower back. For bone metastasis, the ideal investigation is bone scan. But bone scan may not be available in all the cities and taluka places in small villages, in which case just the liver function test, SGOT, SGPT, alkaline phosphatase, serum calcium. So these biochemical markers also give you an indication whether the bones are involved or not. Along with, of course, symptoms. If there is relentless, intractable pain in the bones, you can assume that there is bone metastasis. So just doing simple investigations, which are also your fitness investigation, give you the idea about the spread of the disease. One
Sir, your sound is off. Sir, your sound is off.
Now?
Yeah, it's okay, sir. Yeah. Okay.
So I was talking, how did it happen? I did not even touch anything. Anyway, so the point is that for metastatic investigation, the investigation that nowadays people are using is PET-CT scan, which is a hybrid between PET scan and a CT scan. In all the guidelines and protocols of breast cancer staging, PET-CT scan is given as an optional investigation. It's not a must that you should do PET-CT scan. If the tumor is small, there are no lymph nodes in the axilla on your clinical examination, if the lung, liver, bones are normal, then there is no point in subjecting the patient to this radionuclide scan, which is costly, which is troublesome, and which causes a lot of anxiety, and it is very expensive. It has side effects also. So doing PET-CT scan for every patient is not mandatory. In fact, it is not advised. It is only an optional investigation. If you need to do something, need to find out something, then you go ahead with PET-CT scan. Of course, there are various shortcomings of PET-CT scan. As a small tumor less than 1 centimeter can sometimes be missed on PET-CT scan. So PET-CT scan comes as negative, but there are already metastases. So these are all shortcomings and fallacies of investigation. But as far as India is concerned, when there is a restraint or problem of finances, the simple investigations like sonography abdomen, X-ray chest, liver function tests, serum calcium, and a few baseline investigations are sufficient to give you the metastatic status of the patient. You don't have to go in for big investigations like CT scan, MRI, or PET-CT scan. If a situation warrants, you can go ahead. But otherwise, in a smaller status, this is a smaller states as cities and towns, it is adequate for staging. Once the patient is staged in stage 1, 2, 3, or 4, I'm sure all of you know how this staging is done, and it is already available everywhere on the net. So when it is early stage, when instead of staging the breast cancer in theoretical way, in TNM staging and other things, which is a very complicated and a very long way of doing it, the simple clinical way is to classify breast cancer into 3 categories. One is operable breast cancer, which is early breast cancer. Second is locally advanced breast cancer, when tumor is slightly bigger than, say, 5 centimeters. There are multiple nodes in the axilla, skin involved, pod raunch, or pectoral muscle involved. But only locally, no evidence of any distant metastasis. So that is locally advanced breast cancer. And third is metastatic disease, when the tumor has already spread to distant organs like lung, liver, or bones, or brain. So, as I said, if it is early breast cancer, your philosophy of treatment is cure. The treatment of choice mostly is surgery, followed by adjuvant chemotherapy, radiotherapy, and hormone therapy, immunotherapy. You know, there are so many modalities available. When it is locally advanced breast cancer, your philosophy of treatment is control of the disease and achieving good quality of life as long as possible. When the basic tumor, the treatment modality is preoperative or neoadjuvant chemotherapy, try to reduce the size of the tumor, that is downstage the tumor or downsize the tumor. Then maybe you can do operation to debulk the mass, and then followed by post-operative treatment like post-operative chemotherapy, radiotherapy, and so on and so forth. There are so many things available. And third classification clinically is metastatic disease, or the end-stage disease, late disease, when you don't cure the disease, don't try to control the disease, just try to control the symptoms and make patient happy as long as possible. If the patient with, say, 85 years old comes to you, just ask her to be at home with her children and loved ones and go to mandir, eat something, control her pain, control her vomiting, and let her die whenever she dies peacefully without actually interfering with her life. So these are the certain philosophical guidelines that we must adhere to. And after the treatment, now I will not go into the details of the treatment, because with advent of immunotherapy and nanotechnology, the radiation has improved such a lot that there are so less side effects, good effect, very precision. Now you have antibody drug conjugate, a different kind of drugs, extremely potent but extremely costly also. One dose costs about 2.57 lakhs rupees, and you have to give it for 1 year. So it is less likely that most of our patients will afford it. But the good news is that in India, in cities like Pune, Mumbai, and even smaller towns, all these treatments are mostly available. Our patients can take advantage of these high-tech modalities. The drugs like trastuzumab, which is given for HER2 positive patient, used to be 1 lakh rupees per dose per month, and that used to be needed to be taken for 2 years. So it was not possible for anyone to do. I mean, many people could not afford. Now that drug is just hardly 10,000 rupees per month. So most of the patients can afford it. So with the advent of new molecular engineering and reverse engineering, similar drugs, Indian companies coming up with new manufacturing, the cost of treatment is slowly getting under control, and patients can get benefit of that. But that's a different story altogether. We'll have to have a different session for treatment of breast cancer. But the dictum is that follow these guidelines about the philosophy. And the last thing in the breast cancer comes follow-up. Now, follow-up is important because the lifespan of the breast cancer patient has increased tremendously. Like now, you must have seen breast cancer follow-up patients for 20 years, 25 years. The survival is so good that patients have to be followed for 10, 15, 20 years. So it's a long-term follow-up. And we must understand certain guidelines for follow-up. If it was a pancreatic cancer or an ovarian cancer, the lifespan itself is so small that we do not really worry about the protocols of follow-up. But here in breast cancer, we have to follow it for 20 years, 25 years. So the dictum is that the first dictum, see, now the principle of follow-up is that you have to understand when the patient gets recurrence and you have to timely intervene into that patient. But the principle is that you don't have to chase the metastasis. You don't have to go actively in and look for metastasis, which means that when you are doing follow-up, you don't have to do metastatic investigations in an asymptomatic patient. If the patient is asymptomatic, following up with you for breast cancer, she has completed her adjuvant treatment, and if she is asymptomatic, you do not have to do every 6-monthly sonography or PET scan or CT scan, or for that matter, tumor markers. You know, the tumor markers CA125, CA15/3 are almost useless in the management of breast cancer. You don't have to do that. Do not give you any additional information. It will just only cause you more cost and anxiety to the patient. But doing these tumor markers, investigations with X-ray, sonography, hematology is useless in follow-up. And I'm not saying this. This is there in all the guidelines, including NCCN guidelines. We here see that people send their breast cancer follow-up patients for PET CT scan every 6 months. It's a huge waste of resource and time, and it's a useless thing. People argue with me that, but then how will you find metastasis early before even they present clinically? The answer to that is that even the patient comes, with symptoms of metastasis, and in another scenario, if you find out the metastasis before it causes symptoms, the ultimate life is same. Ultimate length of the survival length is same. Only that you find out the metastasis early, so that you label that patient as metastatic. Then you start treating. So an asymptomatic patient becomes symptomatic because you give chemotherapy to a normal patient. The patient becomes miserable and dies at the same time when she would have died otherwise. So the dictum is as, do not chase the metastasis. Metastasis whenever shows, you can go in and investigate. And the principle of metastatic disease is only palliation. So do not do any heroic things in metastatic disease. So this is the overall scope. When I say that is the follow-up is very long-term, you need to understand the psychological and physical rehabilitation of breast cancer patient. A mastectomy patient, when there is no breast on one side and a breast on the other side, becomes imbalanced because of the weight of the breast on the opposite side. So that causes backache after some time. So you have to give heavy silicone prosthesis on one side. Psychological rehabilitation, patients have to cope up with the idea of death, idea of impending death, or other psychological problems, sexual problems, family problems, and fear of their children, like whether it is a hereditary cancer or not. If it is hereditary cancer, will it go to my daughter and will she survive? So there are so many complications in psyche of a breast cancer patients that you need to address them in your rehabilitation protocol. So from screening to rehabilitation, it's a big spectrum of things to be done. I would like to stop here because we have already crossed the estimated time. And I thank organizers, Dr. Koth Madam, and the people from Ayush for giving me this opportunity. I'm open for question and answers if there are any. Otherwise, thank you so much.
Thank you so much, sir, for delivering a wonderful session, giving a very precise and clinically significant view for the breast diseases.
Thank you.
Yes, sir. Now I request Dr. Rajesh Gupta, sir, to put her comments on this section. Rajesh, sir? Yes.
Unmute.
Welcome, sir.
Unmute yourself.
Please unmute yourself, sir.
Hear me?
Yes, sir. Yes, sir. You're audible and visible, sir.
Okay, thank you.
Welcome, sir.
It's my pleasure to be at this session today and hear Dr. Shekhar Kulkarni summing up the breast disease. I have been operating for last 20 years with breast cancer, and I thoroughly agree with Dr. Kulkarni that the breast disease has to be made easier rather than more difficult. And I think he has explained in every possible easy manner to understand its disease, and the burden of the disease is increasing. And that's why it is the need of the hour that all the pathies should come together to screen this disease and see that the burden is lessened down. I think Ayurveda can add much more to all these things as far as the medicine part is concerned and preventive part is concerned. So definitely we can cooperate with Dr. Shekhar Kulkarni to understand his thoughts and our science to interact and come out with some solution. Thank you, sir.
Dr. Hemlata Jalgaon ma'am.
Yes, madam. Good morning.
Welcome, ma'am.
Good morning, everyone. So I can say about respected Dr. Kulkarni sir, today's lecture is feast for all of us, always. I heard so many times the lecture is always informative, and sir is doing a very nice practice over here. Sir may not be knowing me, but I am referring so many breast cancer patients to sir also, all the time. So definitely we'll meet you, sir. And sir has given a very elaborative lecture on it's in a very simple way, like there is what kind of diagnosis, there are 3 stages of diagnosis, how the management, what kind of management we should do, and how the follow-up has to be taken. It's a very simple way sir has explained everything, and which patient we should go, which patient and how we should treat, if there is a cure, if there is a control, or if there is a palliative treatment. And the one other thing is sir has accepted Ayurveda in a very positive manner. That is a very good thing, sir. Definitely we are going to help you about the prevention and pain management. And sir has I think sir has given more stress on the prevalence also. It is 1 in 22. The rate is quite increasing. So I am thankful to the GSC Jalgaon, especially Dr. Khoth madam and team, and Dr. Solanki, I think Dr. Solanki and team Shalya department. So you have taken a very good, you have selected a very good topic, very hard topic now for our gynecologists. And thanks to the respected director of Ayush and team once again for giving me an opportunity to be chair over here. Thank you, Khoth madam and everyone. Thank you once again.
Thank you, madam.
Thank you,
Shekhar Kulkarni sir. As always, you have given a very good lecture.
Thank you, ma'am. Thank you very much. I would like to invite Dr. Veena Patil, ma'am, to share her views for this session. Yes, welcome, ma'am. Ma'am, please unmute yourself, ma'am. Ma'am, you are not audible. No, ma'am. No, ma'am. You are not audible, ma'am.
Okay, can I take your leave now?
Sure.
1 minute.
Because already it's
Thank you
already
so much, sir.
11:30.
Hello.
Okay.
Sir, can I have a few words with you? I'm Dr. Swati Gaikwad. I'm working here in All India Institute, sir. Sir, as you...
Yeah, please, sure.
Am I audible now?
Yes,
Yeah,
sir.
Ma'am, ma'am, just a minute.
Hello. Yes, sir, as you were talking about IgM, I just wanted to have the curiosity that you have raised regarding these things. And it is one of the many things that are coming up after COVID. So in Ayurveda, we have a chapter that is termed as Vidhi Shonitadhyay. And that particular chapter explains about all the things like overeating of food, eating food which is pungent in nature or spicy in nature or salty in nature, induce certain things in body that leads to conditions. Because if you see, this particular thing is an inflammatory condition, and in these inflammatory conditions, if you approach the patient with fasting, purgation, and some purification of blood and bloodletting, it gives a very good it becomes like reoccurrence is also prevented. And sometimes even if you start with all these therapies, within a year or so, all the symptoms get regressed. So this is one of the very good thing that might be you would be able to appreciate and apply it in your routine practices. And these things are associated with stomatitis, rhinitis, and you can find that the patient will have odor in her mouth. So these are certain things where you can clinically diagnose whether it is because of Rakta Dushti or some other reasons. There are so many things in the body, like Vata, Pitta, Kapha doshas are disturbed, or sometimes the dhatus are disturbed. And in that condition, if along with these certain clinical signs and symptoms, we can approach the patient with a certain particular treatment that will really help in these conditions. I just wanted to share that thing. That's all. Thank you, sir. Thank you so much. It was a very wonderful lecture, and I really enjoyed and had a very good insight. Thank you, sir. Thank you so much. Good day, sir.
Thank you, ma'am. Thank you. Dr. Veena Patil, ma'am. Am I audible now? Yes, ma'am. Yes, ma'am.
Yes, sorry for technical problem.
No issues.
Good morning, everyone. First of all, I congratulate Director Dr. Raman sir and team Government Ayurved College Jalgaon for organizing this international webinar on occasion of Ayurved Awareness Campaign. And I am thank you for organizing committee for giving me the opportunity as a chairperson in this international webinar. Respected Dr. Shekhar Kulkarni sir covers all aspects of breast diseases in simple language. We all know that the breast disease means abnormality of tissues, breast tissues. And breast cancer is the most common cancer in women worldwide. Self-examination, sir told self-examination is necessary in every woman for early detection and diagnosis. It is essential for every individual to aware of their breast health and perform self-examination. Early detection significantly improves the chances of successful treatment. The session is very informative, and it is the feast of knowledge for all of us. Due to lack of time, I shortly conclude the session. That sir beautifully talk about the take-home messages. That is, they told about the screening, diagnosis, and one important message that after age of 40, every woman should undergo mammography. Sir nicely gave physical, sir nicely gave psychological advice to cancer patients at different stages of their different stages. Thank you, sir, and thank you, organizing committee, for giving me the this opportunity. Thank you very much.
Thank you, ma'am. Thank you very much, ma'am. Thank you very much, sir, for staying tuned with us. Thank you very much. Now we are moving towards inaugural ceremony of this international webinar, SOUSHRUTI 2023 from Government Ayurvedic College, Jalgaon. Now I'm inviting and proceeding for inaugural ceremony. I invite Dr. Sana Sheikh, Dr. Sonali Farate, and Dr. Sadhna Bafu. Thank you. Thank you.
काय नाही ते धूळ काढले ना गेटाची याची आपल्या पायऱ्याची तेच काढू लागले गेटापासून त्या आईने सरळ ते ब्लड ते सांडलं होतं पायऱ्यापासून आणि ते आई ना एवढं मोठं
हो चालेल चालेल. येतोय ना चक्कर मारतो. हो चालेल. हो चालेल.
पडो तुम्ही. या.
Good morning, myself, Dr. Sonali Parale, Assistant Professor.
Madam, direct.
त्यांना आवाज येते का? इकडच्यांना आवाज येतो.
Am I audible? Good morning, myself Dr. Sonali Parate, Assistant Professor in Department of Prasutitantra and Streeroga at Government Ayurved College, Jalgaon, Maharashtra.
Sir,
Welcome.
हे बंद करा. हे माईक बंद करा. तो बंद करा. तुम्ही लावला. आता बोला ना. तो बंद केला.
Good morning.
तुमच्या इनको मॅडम ते सर. नाही माईक बंद करी. इथला येतो. याच्यामध्ये ऑडिओ याच्यामध्ये आवाज. या कॅमेऱ्याचा आवाज येतो.
Sorry for technical issues. Good morning to all of you. Myself Dr. Sonali Parate, Assistant Professor in Department of Prasutitantra and Streeroga at Government Ayurved College, Jalgaon, Maharashtra. Warm welcome to all of you in this inaugural function of International Webinar of SOUSHRUTI-2023. Along with me, I invite Dr. Sana Sheikh, Assistant Professor, Department of Shalyatantra at Government Ayurved College, Jalgaon, to conduct this session.
दोन नंबर
Anorectal का कुछ है सर?
मॅडमांना दाखवायचे त्यांच्याकडे Ayush Maharashtra, Ministry of Medical Education and the Department of Health has initiated Ayush awareness campaign. Under this campaign, Government Ayurved College Jalgaon has organized its international webinar SOUSHRUTI-2023. Along with us, now I would like to invite Dr. Sarma Madam. She is an associate professor in Sangeeta Department and Government Ayurved College, Jalgaon. We also have already highlighted Ayush Maharashtra State, Inspector Dr. Mohammed Sir, and Inspector Dr. Mohammed Sir, Honorable Vice Chancellor of Dept Ayurved. Please welcome sir. Also, online Dr. Mohammed Sir, Honorable Vice Chancellor, Maharashtra University of Maharashtra. Now, I would like to invite Honorable Government Ayurvedic College, Jalgaon, Dr. Anujit Sir and others. Also, I invite Professor Dr. Nur Solomon Sir. Then I would like to invite Professor Dr. Kurat Madam and others. Then I request to put Dr. Datta Sir on dais. He is a professor in the Department of Shalyatantra at SOUSHRUTI College, Nashik. And today he is the observer for this webinar from Maharashtra University of Health Science, Nashik. No auspicious ceremony is likely without the blessings of Lord Humanity. So I would like to request all dignitaries
ऐकायला जाते इतकं नाही हो ते इनॉग्रेशन फंक्शन आहे म्हणून सर काइंडली मॅनेज म्हणा सम टेक्निकल इश्यू कंटिन्यू
Now I request our first year student, Ms. Aisha Bhutto and Vaishnavi Khanna for Anorectal Ceremony.
My colleague, Professor Dr. Dr. Kumar, who is an observer from Maharashtra University of Health Sciences, my colleagues, professors, associate professors, and assistant professors, dear students, and all the staff of Government Ayurvedic College, Jalgaon, and all the delegates who are online registered for this international webinar, speakers, the chairpersons of the sessions of this webinar. Dear friends, Government of Maharashtra, Ayush Directorate and Medical Education Department of Government of Maharashtra has initiated a campaign, Ayush campaign, and under this campaign, we are initiated various activities. Dr. Jalgaon, who is nodal officer of this campaign program, will be talking more about this in this program. I will be talking more about this international webinar we have organized through Jalgaon. Dear friends, this is second webinar being organized within a span of few months by Government Ayurvedic College Jalgaon. The first very successful webinar was organized on Yoga International Day, and this is the second webinar which we made and attended on the international level. Why we call it international is one of the speaker was from America. She is a very much Indian Ayurveda graduate and postgraduate practicing Ayurveda in United States of America, and we had invited her as a speaker to talk on the breast cancer treatment with the help of Ayurveda. The next speaker from Kerala, Dr. Vinod Krishnan, we talked about the latest treatment modality emerging out of the Ayurvedic sciences and knowledge, that is Marma therapy. Marma therapy for pain management, Marma therapy for prevention of breast cancer, and Marma therapy as adjuvant therapy for the treatment of breast cancer. So such galaxy of speakers are talking in this today's webinar. We are having 2 more speakers left after the inaugural ceremony. They will be talking on this, and this talk is definitely going to talk especially the students, the postgraduate students, undergraduate students, and research scholars who have joined online and through the physical presence also in this webinar. It gives me immense pleasure to be part of this webinar, to make this webinar very successful. So many people contributed to make this webinar successful. Dear friends, such seminars, CMEs and webinars, they help not only in updating the knowledge of already the doctors who are practicing the medicine, but the budding and emerging youngsters to practice the field of medicine, particularly Ayurveda. And they get an inspiration that what are wonders hidden in Ayurvedic sciences. It is said that herbal medicine is the next buzzword internationally, and it is an emerging field for the treatment of various elements, be it the lifestyle diseases, be it malignancy, etc. So we intend to keep it up activities through our institute. So I feel really proud to be part of such kind of program organized by GSC Jalgaon. Thank you very much.
organization for future of Integrative. I highly recommend, sir. I also recommend President Integrative, Dr. Rani sir, Director of Maharashtra State. Sir, you are the leader and member of our team. These are English pleasure and honor to have you with us. Your guidance and vision are motivate us to discuss the good to learn. Because Israel across environment and realize us. Our vision steps to make this ceremony successful and thankful. Whenever Dr. sir, whenever Dr. sir, whenever Dr. sir, whenever Dr. sir, whenever Dr. Shalyatantra, I am welcoming you. Whenever Dr. sir, So I will going to congratulate all the organizers for attending this international and wish you all the best for upcoming college years. This is I am committing my introductory speech. Thank you so much. Jai Hind, Jai Ayurved.
Thank you, madam. We have online presence of dignitaries, so I request Dr. V. Mave sir, Registrar, Maharashtra Council of Indian Medicine, to make addresses.
Hello. हाँ. Dean sir. Hello. Dr. Abhijit Ahire sir.
सर ऑडिबल सर.
माझा आवाज येतो?
यस सर, यस सर.
येतो ना? ओके ओके, थँक्यू. शासकीय आयुर्वेद महाविद्यालय जळगाव, माननीय अधिष्ठाता डॉक्टर अभिजित अहिरे सर, तसेच माननीय डॉक्टर विनोद सोलंकी सर, प्राध्यापक शल्यतंत्र विभाग, माननीय डॉक्टर खोत मॅडम, विभाग प्रमुख प्रसूतितंत्र विभाग, तसेच आपल्या महाराष्ट्र शासनाचे माननीय आयुष संचालक डॉक्टर रामन घुंगराळेकर सर, आज शासकीय आयुर्वेद महाविद्यालय जळगाव येथे इंटरनॅशनल वेबिनार ऑन ब्रेस्ट कॅन्सर अँड आयुर्वेद सौसृष्टी 2023 हे वेबिनार आयोजित केलेले आहे. आणि खरोखरच मला अत्यंत आनंद होतो का महाराष्ट्र काउन्सिल ऑफ इंडियन मेडिसिन नी ह्या वेबिनारला ॲक्रेडिटेशन दिलेलं आहे. उद्देश हाच आहे का आयुर्वेदाचा प्रचार आणि प्रसार हा विद्यार्थ्यापासून तर सर्व ग्रामीण भागापर्यंत पोहोचणे हा त्यामागचा उद्देश असतो. आणि खरोखरच आपल्या भारतामध्ये हिल इंडिया आणि हिल बाय इंडिया हा जो उपक्रम चालू आहे, आयुष्यमान भारत डिजिटल मिशन ABDM, त्या बाबतीत एक असा भाग आहे. आणि खरोखरच मला माहिती आहे का, मला वाटतं याच्यानंतर आपले महाराष्ट्र राज्याचे आयुष संचालक माननीय डॉक्टर रामन घुंगराळेकर सर, हे मला वाटते ते सुद्धा आपलं मनोगत व्यक्त करेल. मला माहिती आहे का आजच्या धकधकच्या जीवनामध्ये आयुर्वेद असं एकमेव शास्त्र असं आहे का ते सर्वांना शारीरिक आणि मानसिक स्वास्थ्य ते देऊ शकतं, आणि ही काळाची गरज आहे. मला माहिती आहे आपलं हे जे काउन्सिल आहे, महाराष्ट्र काउन्सिल ऑफ इंडियन मेडिसिन, मला अत्यंत असा आनंद होतो, कारण या काउन्सिलचा जे मी प्रबंधक आहे, मला वाटतं हे केवळ आपल्या धन्वंतरी जे आयुर्वेदाची दैवत आहे, त्यामुळेच मला असं वाटतं शासनाने हे माझ्याकडे आयुर्वेदाचं जे प्रबंधक पदाची जबाबदारी दिलेली आहे. आणि खरोखरच शासकीय आयुर्वेद महाविद्यालय जळगाव यांची पहिली बॅच माझ्या माहितीप्रमाणे आता ऑक्टोबर नोव्हेंबरला त्यांची परीक्षा होईल आणि ती बॅच आता बाहेर पडेल. मला वाटतं इंटेक कॅपॅसिटी 60 आहे आणि पूर्ण प्रेझेंट असलेले 60ही विद्यार्थी अधिष्ठातापासून तर सर्व प्राध्यापक, अध्यापक, सर्व विद्यार्थी ह्या इंटरनॅशनल वेबिनारच्या माध्यमातून मी आपणांना अशा अनेक शुभेच्छा देतो आणि धन्यवाद पण देतो. आणि या महाराष्ट्र काउन्सिल ऑफ इंडियन मेडिसिनचे जेवढे की आपल्या महाराष्ट्र राज्याचे जे BMS डॉक्टर्स आहे, आपल्याला माहित असेल माननीय अधिष्ठाता सर आणि सर्व सन्माननीय प्राध्यापकगण, आपल्या महाराष्ट्रामध्ये भारतामध्ये एकमेव असं महाराष्ट्र काउन्सिल ऑफ इंडियन मेडिसिन आहे की ही काउन्सिल ही डिजिटल काउन्सिल आहे, ऑनलाईन. मला वाटतं ही जेव्हा पहिली बॅच बाहेर पडेल आपल्या माध्यमातून मी आपला विनंती करतो माननीय अधिष्ठाता सरांना, जेव्हा हे विद्यार्थी बाहेर पडेल ते मला वाटते 60 की 100 इंटेक कॅपॅसिटी आहे, तेव्हा त्या जळगावमध्ये प्रोव्हिजनल रजिस्ट्रेशन द्यायचं काम हे काउन्सिल करणार आहे आणि परमनंट रजिस्ट्रेशन पण देणार आहे. आणि सर्वप्रथम मला बोलण्याची ही जी संधी दिलेली आहे त्याबद्दल मी माननीय अधिष्ठाता सर, माननीय आयुष संचालक यांचा धन्यवाद देतो. आणि आपल्या ह्या इंटरनॅशनल वेबिनार ब्रेस्ट कॅन्सर अँड आयुर्वेद सौसृष्टी 2023 माननीय आयुष संचालक हे उद्घाटन करणार आहे आणि मी इथेच थांबणार आहे. थँक्यू. जय हिंद, जय महाराष्ट्र.
Thank you, sir. Thank you so much for the affiliation of Maharashtra Council of Indian Medicine to this webinar. Now, I request Dr. William Hawai, sir, in Faculty of Ayurveda, Maharashtra University of Health Sciences.
Good morning to all of you. Respected dignitaries, Honorable Hassanji Mushrif sir, Minister Medical Education, Mumbai, Honorable Dr. Ramanji Gungralkar sir, Directorate of Aush, Honorable Dr. Milind Nikum sir, Pro Vice Chancellor, MHS Nasik, Honorable Dr. Dilip G. Wange sir, Registrar MCISM Mumbai, Honorable Dr. Sudhada G. Kadam, Dean AIIA Goa, respected all eminent speakers, Organizing Secretary of International Webinar SOUSHRUTI-2023, all respected faculties of Government Ayurved College Jalgaon, and all participants of this webinar. My heartiest congratulations to the organizing team for selecting this valuable topic of webinar. Perennial diseases reduce the quality of life of women. Hemorrhoids and anal fissures occur in about 40% of pregnant women and women after delivery. Integrated approach using amalgamation of modern diagnostic and Ayurveda therapeutics is the need of across the globe. A fact that Acharya Sushruta is regarded as a father of surgery by whole of the surgical fraternity is not new to us. The detailed description of Arsha, Bhagandara, Parikartika and other anorectal issues have been mentioned in our samhitas. So now it is in our hands to disseminate the knowledge to the world through such conference, so that it can be opportunity to practice and use to offer the solution to the womankind and thereby to the society. I would like to thank the organizing committee of this prestigious international webinar for honoring me as a guest for this event. Thank you so much. Jai Hind, Jai Maharashtra, Jai MHS.
Now I would like to invite here Dr. Rajesh sir, who is the Nodal Officer of Ayush and Ayurvedic Management Maharashtra State. Welcome you, sir. And your students and participants. This webinar is arranged under the government of Maharashtra, where the Ayush has organized. This Ayush Jalgaon Abhiyan. I am very much thankful to Dr. Raman Muralkar sir, Dr. Ayush, for giving me this opportunity as a nodal officer at Government Ayurvedic. Under this campaign, we have arranged various medical programs shifted by the student and always lectured by the our staff at different places in Jalgaon. This will be an ongoing process and it will be great teamwork and our college program. And for to be a part of this team, thank you very much. Thank you, sir. Dear friends, this international webinar is led by the Minister of Medical Education Department, Maharashtra State, Sri Prasutitantra-Streeroga, sir. Because of his busy schedule, we could not allow his normal presence and he sends his blessings and wishes for great success in this international webinar. I now call Dr. Prasutitantra sir, in charge of our institute, to say a few words about this webinar. As you all know, we have gathered for an intellectual webinar regarding integrative approach in diagnosis and medical disorders. Ayurvedic development वैशिष्ट्य एक सप्ताह अवश्य चले अब हर एक और पेशेंट सप्ताह देखते हैं 15 दिन में 4 सप्ताह देखना कुछ पूरा करते हैं six, 7 months. हर 15 दिन सप्ताह जा रहा है एक भी जरूर हमारा so that program is also successful and the study of this is good because the regular regular. It is right to say only the analysis will actually be possible. So I assure you, in all our competitors, this webinar will be highly results and great success. We have given assignments and listed on present context project responses, the basic results, I extend the compliment as well as gratitude to our distinguished guests from those visits and support that has made this webinar possible. Especially, I would like to thank the Honorable Minister who has graced us with their message. I would like to thank Ayush. He also delivered this message because of what he might do. I would like to thank Prince Sir, who also gave this message and gave us commentaries. I would like to thank NIMA-National Sir, Faculty of Ayurveda. I would like to thank Ramesh Sir, who has blessed always, and his blessings are always with us. I would also like to thank all India Madam Shalyatantra, It is a privilege to stand here and I am assured all of you that this webinar will reach a benchmark. We have already heard three specialist speakers who have talked about breast cancer and other diseases. This webinar will help many of us to intellectual and most importantly, I would like to highlight the international webinar has helped in the promotion of Ayurveda. The moment of international Ayurveda initiative has been lighted up several of our minds and inspired us to look for Ayurveda future with the sense of greater desire and aspiration. The entire webinar is highlighting integrative approach in pregnancy and anorectal disorder, which will give us a striking outcome by Aush and promotion of Ayurveda and the presence of the we have come together today not just for webinar, but for celebrating the pursuit of greater purpose. So once again, I want to thank everyone who made this webinar possible and to our guests for their presence and support. Thank you one and all. Thank you. Thank you very much, Mr. Sir. For the guiding force for the purpose of this webinar, with all other activities. Dear friends, now we are coming to the keynote in the inaugural ceremony, and to a very important task that is vote of thanks. So now I invite Dr. Yunus.
Thank you, Professor. Dear friends, Dr. His speech has already thanked Dr. and I am here to perform again same thing. In this webinar, we had planned an online presence of the Honorable Minister but because of this we could not, but he sent his best wishes and blessings to us. Same with Director of Ayush, Dr. Dr. Mukul Patel, who is Vice Chancellor of Ayurvedic University. He started abroad 2 years back, but he sent his well wishes and blessings to us. Same with Dr. Mukul, who was the dean of this institute for some years. Now he is the Vice Chancellor of Ayurvedic University, Maharashtra University of Health Sciences in Nashik. Dr. just now he talked to us and thankful to him for his online presence. My dear friend Jalgaon, who is the Registrar of Maharashtra Council of Indian Medicine, who was kind enough to grant affiliation of this international webinar. We are ever indebted to him. Dr. Shalyatantra, Dean of All India Institute of Ayurveda, Goa campus. She was online present and we are thankful to her. Eminent speaker, Dr. Vinod Krishnan, Dr. Shekhar Kulkarni, Dr. Sushila Sahi, Dr. Jyoti Venkandar, Dr. Aruna Bhatti from USA, and soon we will be hearing the speakers are Dr. Aman Gireli and Dr. Swati Munike. I am indebted and thankful to them. Dear friends, my department colleague Dr. Ramesh Jadhav and Dr. Sana Sheikh, my other colleague are co-hosts of this international webinar, Dr. Professor Preventive Madam and Dr. Sonali Parate of Streeroga and Prasutitantra department. I am thankful to them. They stood rock solid behind this program and put every effort since more than a month to make this happen. Colleagues of Government Ayurvedic College Jalgaon, all the professor, associate professor, assistant professor, they were working hard with me to make this happen, this event happen. But worth mentioning are Dr. Sandeep Suse and Dr. Chetan Patil, who are working tirelessly yesterday night, they were with me in this hall working this for internet and facility and audio impact. Worth mentioning Dr. Sandeep Suse, he started yesterday night at 3 o'clock back in Jalgaon, and today morning, brushing his eyes, he was present with us and still without thinking he is working. All the office staff of Government Ayurvedic College Jalgaon supported throughout this month-long preparations. But worth mentioning, Santosh Tenderkar and Rohit Sonkatte. I told Santosh, जलगांव electricity is notorious and that they light जाती है. Research का 1 मिनट में लाइट नहीं जाएगी. We have a backup generator for you. Suddenly that it's internet. There is sudden internet disconnection. But he said we will provide you that tool and you proved your point, Santosh. Thank you, Rohit and Santosh, for uninterrupted electricity and internet connection for that. I am thankful to my dear Dr. Datta Kumar, who is observer from University of Health Sciences, Maharashtra. Thank you, Datta, and staying with us and reporting this moment to the university. Last year, NIMA had always stood with us and supporting us for such various programs. For last webinar also and for this webinar also, and particularly my dear friend Dr. Girish Naga of NIMA Aurangabad, he has supported me and us for providing uninterrupted Zoom platform to relay this program for this. And if at all I am forgetting names mentioned in this conference, then please forgive me. Thank you very much, one and all. Thank you.
Thank you, sir. Thank you so much. Thank you, everyone, and all online deliveries. So here, Organised ceremony is over, and we are going to start next session. Stay tuned with us. Thank you.
Yeah, within few minutes we are starting another presentation with another awareness speaker. So in 2 minutes and we will be back with you another expert. Thank you. Yes.
Hello, good afternoon, dear friends. We are beginning with the next session of today's international webinar. And for this session, we have got a very learned speaker, Dr. Jyoti McDumber. Ma'am, she is Associate Professor at Podar Medical College in Rog Nidan Department. Today, she will be talking on the breast cancer topic because her PhD is completed on the breast cancer itself. She has received many awards. I will name a few. There is a long list. She was awarded Social Health Award in 2017, Hirkani Ratna Award, very prestigious award, Dr. APJ Abdul Kalam Award in 2019. Her research paper received many more awards at various platforms. She was guest speaker and chairperson and panelist at different forums. We are very lucky to have Dr. Jyoti McDumber today to talk on this topic. And along with that, we have got very learned chairpersons for this session. My dear friend, Dr. Rajendra Sonekar, he is a professor and head of department at Government Ayurved College, Nanded, and he is PhD guide, a very good surgeon, learned speaker at various forums. We are really lucky to have him as a chairperson of this session. Dr. Neeta Kedar Madam, she too is professor and head of department at Government Ayurved College, Nagpur. Dr. Shubhangi Badole, she is associate professor at Kerala Medical Trust Medical College, Mumbai. She has completed her graduation and post-graduation from R.A. Podar Medical College, Mumbai. She is an expert on Agni Karma and various Anushalya Karma treatment modalities. Welcome, Dr. Shubhangi Badole. And lastly, Dr. Dhana Lilke, Associate Professor from Government Ayurved College, Usmanabad. She too will be presiding as a chairperson of this session. So I invite Dr. Jyoti McDumber to begin her presentation.
Thank you, sir. Sir, am I audible?
You are audible and visible. Please go ahead.
Yes, sir. I'm sharing my screen. Yes, sir. First of all, I would like to thank to all the organizing members of this webinar, especially Dr. Solanki sir, who have invited me in this webinar to talk on the topic about breast cancer. So thank you very much, sir. So let us begin with the presentation. The title of my topic is Ayurveda Approach in Breast Cancer, Scope and Limitations. So, sir, 1 minute, I'm doing my slideshow. Yes. Now, what is breast cancer? Basically, as we all know, that breast cancer is the most common malignancy among the women worldwide. The tumor is malignant, that is cancer. If it can grow, that is invade in the surrounding tissues or spread metastatically to distant areas of the body, it is uncontrolled growth of cells, and it is the second most leading cause of death, second most common cancer. The incidence increases with the age, and all the women are at risk. So this is the reference from American Cancer Society. As we all know that breast cancer is the leading cause of death. In India as well as in worldwide, today we are seeing that many of the patients, many of the females are suffering from breast cancer. I can say that in many of the families, one patient or one patient is died because of the breast cancer or any of the cancer. Now, what statistics says? This is the statistics in India regarding breast cancer. Breast cancer ranks #1 cancer among Indian females with age-adjusted rate as high as 25.8 per 1 lakh women, and mortality rate is 12.7 per 1 lakh women. This data reports from various latest national cancer registries were compared for incidence and mortality rates. So increasing incidence of breast cancer in younger age group, rising number of cases in breast cancer in India. As we all know that breast cancer is rising, but which are the causes for that? We all know that in females, shyness is one of the cause. Due to the breast tumor, or if the lady is having breast tumor, basically in the house, she does not talk with anyone, so that the tumor begins to rise. And when it becomes third or fourth grade carcinoma, then she comes to us. And I think that is the very late situation. Now we'll see the risk factors that can cause breast cancer. Now factors that cannot be prevented, that is gender. As we all know, being a female is one of the cause regarding breast cancer. Aging, as the age of the person ages, that is after the age of 40, after the age of 35, the risk of breast cancer is very much high. Genetic risk factors. If the patient is having history of breast cancer in her family, then she can be at higher risk. Then family history, as earlier I said, personal history means if the patient is having any history of non-bearing child or any history of menopause, then at that time also she can lead to the breast cancer. Then menstrual cycle, if the patient is having irregular menses or early menopause, that can also cause the breast cancer. And of course, estrogen, that is hormonal imbalances, can cause the breast cancer. Now, lifestyle risk. Lifestyle risk can be prevented. Means oral contraceptive pills, then non-having children, hormone replacement therapy, non-breastfeeding, alcohol use, obesity, high-fat diet, physical inactivity, and smoking. These are all the lifestyle risks which can be prevented regarding breast cancer. Now, I will not go into the details of what is the anatomy, physiology, and etc. and etc. Directly, we come towards the general principles to understand the patients in Ayurveda. Now, which are the general principles to understand a patient in Ayurveda? What may be the principles to understand while treating breast cancer through Ayurveda? First is Prakriti Parikshan. As we all know, Prakriti Parikshan. So I will not go into the details of that. Analyze the patient in dosha, dusha, desha, bala, kala, agni, vaya, tattva, sakni, ahar, and in this manner, then dusham, desham, balam, kalam, analam, prakritim, vaya, sattvam, satnyam, tatahara, avasthascha, prutakvida. So analyze all these factors while diagnosing the patient for Ayurvedic Nidan of breast cancer. So Ayurvedic diagnosis is must and the treatment should not be focused on the cancer. So this is the reference from Charak Vimanstan 8 Adhyay. Now, the first basic thing, that is breast cancer mentioned in Ayurveda literature. So this is the question in front of all of us. But the answer is no. Breast cancer is not mentioned. I think any of the cancer, not only breast cancer, but the answer is no. No any cancer is mentioned in the Ayurveda literature. But from the assessment of clinical signs and symptoms of Stanarbuda, means of tumor, we can categorize this Stanarbuda in Vataja, Pittaja, Tannipatika, Mansaja, Medoja, and Raktaja, etc. And on the basis of evaluation of clinical signs and symptoms, findings in mammography, fine needle aspiration cytology, biopsy, histopathology, BRCA1 and BRCA2 reports, and imaging, we can diagnose the cancer, and we can judge and we can see this cancer from Ayurvedic point of view. So clinical judgment and pathogenesis can be established from Ayurvedic point of view. Now, breast cancer with other dimensions and different inputs from other conditions. Now, how we can understand or how we can treat the breast cancer through Ayurveda approach. First, Rasavah Srotas Dushti Hetu. Secondly, Raktavah Srotas Dushti Hetu. Then, Kushta Vyadhi, Prameha Vyadhi, Rajekshma Vyadhi, and Ganani. Of course, this is my opinion. I don't think that all should be agree with this opinion. But while studying the Ayurveda approach, while studying breast cancer in Ayurveda, so these are only my opinions how we can think while treating the cancer of breast. So from the all above conditions in Samprapti of Kushta also, we'll see later in Dhatugata Avastha, likewise in breast cancer also. While studying Chikitsa Sutra of Prameha, there is a Santarpan Chikitsa given. Studying when Rajachma, Bala and Purusha Rakshana treatment is also considered. So such type of treatment can also be considered while treating the patients of breast cancer. Lastly, due to the conventional treatment of Agni Mandya is there, so Agni Deepana Chikitsa can be considered. So Agni is also very, very important. So again, I'm saying that this is my opinion. So everyone should not be agree regarding these opinions, but we can think while treating the cancer through Ayurveda approach. Now, general pathogenesis, that is samprapti of breast cancer from Ayurvedic perspective. Dosha, as we all know, Vata, Pitta and Kapha, all these three doshas are involved in this breast cancer. Doshas, of course, Rasa, Rakta, Mansa, Meda, Majja, Shukra, Oja, Agni and Dhatvagni. Vikrit Srotas, Mansava Srotas and Rakta, Rasava Srotas. So, this is the very main thing which I am going to say now, that is cancer is a Vikriti Vishama Samavaya type of combination showing Santarpana at physical level and at early stage, and later, if not treated properly, Apatarpana at physical as well as on psychological level. So what is meant by Vikriti Vishama Samavaya? So if the symptoms of a disease are dissimilar to the symptoms of doshas causing the disease, it is called as Vikruti Vishama Samavaya. Hence, the disease is not in accordance to its cause, that is related doshas. That is called as Vikruti Vishama Samavaya type of combination. Now, Rasava Srotas Dushti, we all know these shlokas, Guru Shitam Ati Snigdam Ati Matram Samashnata, Rasavahini Dushyanti, Chintanam Chati Chintanam. This is the Rasava Srotas Dushti. We all know this. Pushtha. Now, Atish Lakshana, Kharas Parsha, Sveda, Sveda Vivarna, Sadaha Kandu. This is the Kushtha Lakshana. Here, Kushtha importance I have taken only and only for the Dhatu Gatavastha. When we see the cancer patients, especially breast cancer, and I think all the cancer patients, Dhatu Gatavastha is there according to the Ayurveda. So, if the patient comes towards us in 3rd and 4th grade carcinoma, at that time we have seen this Dhatu Gatavastha totally in all these patients. Now, Rajekshma Chikitsa. While treating the patients of breast cancer, Bala of the patient should be taken into the consideration by its dosha predominance as like Rajekshma. We have seen in the treatment of Rajekshma ki Bala Rakshayeta. Sarva Tridosha so Yakshma, Dosha Nam to Balabalam, Pariksha Vastikam Vaidam, Shoshinam Samupachare. यहाँ पे ऐसा दिया है कि बल का रक्षण हमें करना चाहिए while treating the Rajekshma patient. And I have taken that reference that while treating the patient of breast cancer, bala of the patient is very, very important. You should take into the consideration. Then Prameha, this is the shloka of Prameha. Directly, we come towards Prameha Chikitsa. Stulaha Pramehi Balvani Eka Paridurbalascha Tam Ruhanam Tatra Krushasya Tansodhanam Dosha Baladikasya. So while treating the patients of cancer, Bruhan Chikitsa should be taken into the consideration as like Prameha. Now, what is mean by Santarpana Chikitsa? One type of this Santarpana is a one type of treatment among all. If one does not maintain the proper protocol of Santarpana Ahara, that is diet and Vihara, then it vitiates Kapha, Mansa and Meda, which cause the various nutritious diseases or lifestyle diseases. So, Santarpana Chikitsa, this is also very, very important in the disease. Now, about Grahani. This reference I have taken only and only for Agni Chikitsa. The reference of Grahani is given only for Agni Chikitsa, because while considering the cancer patients, Agni Mandya is there in all the cancer patients, not only in the breast cancer, but in all the patients. So while treating the Grahani, Agni Chikitsa is very, very important. So we can take into the consideration Grahani Chikitsas. Now, Ayurvedic view principles regarding breast cancer, regarding the treatment of breast cancer in all. So, Vata, that is Dhatuksha and Margavarodha. So, Bruhana and Srotorodhana is the need while treating the patient. Pitta, Shamana needs due to the aggravation of Ushna Tikshna Guna of Pitta. Kapha, Shodhana, reduce, that is Guru Pichila, Mrutsa Guna and protects Snigdha Shlakshna Guna. Agni, of course, Agni Deepana to maintain status of body and Agni. Dhatvagni, Vardhana to build and maintain the capacity of digestion. Rasa, as this is the prime dhatu, so to produce qualitative rasa dhatu, portion is important. So rasa should be considered while treating the breast cancer. Rakta, this is the second earlier important dhatu. So rasa rakta prasadana is the prime thinking. Mansa, removal of Vikruta Mansa and portion of Prakruta Mansa is very, very important. Shukra, Poshana, as it's the second last dhatu in forming. And of course, Oja. Oja Vardhana is very, very important dhatu. So if one can consider these all the things while treating the patients of breast cancer, the disease will become Sukhasadhya. So these are the prime points while should we think while treating the patients of breast cancer. Now, principles of Ayurvedic treatment for breast cancer. First principle, that is Santarpana. As I earlier discussed about Santarpana, then Shodhana oblique Shamana, that is Pachana Chikitsa, then Vyadhi Pratyanika Chikitsa, then Dosha Pratyanika Chikitsa, Agni or Dhatvagni Deepana Chikitsa, relieving side effects of chemotherapy, Rasayan, and Lagu Mandashita Balya medicine should be chosen. So these all the principles for Ayurvedic treatment should taken into the consideration while treating the breast cancer. Now, which are the aims and objectives for Ayurvedic treatment in breast cancer? Of course, we all know that cancer, this word is not given in our literature. Even under that regimen, we have the acharyas are not mentioned that this is the typical chikitsa for cancer. They have not given. So, aims and objectives for Ayurveda treatment in breast cancer are relieve the pain, extend the life, try to cure, management of sequel, regression of stanarbuda and metastasis, minimize side effects of conventional treatment, improve quality of life, prevent recurrence if possible, and it is of course cost-effective treatment and patients' compliance. So these are all the aims and objectives for Ayurveda treatments in breast cancer. Now, which are the scope and limitations? Of course, for any of the treatment, there are scope and limitations. So, golden points of modern medicines regarding treatment. First of all, confirmatory and perfect diagnosis. These are the golden points of modern treatment. Best tumor and cancerous growth removal by surgery. Of course, we all know. Then chemotherapy and radiotherapy for self-regression. Then periodic monitoring by imaging, lab investigation, and tumor markers, and standard and well documentation. In modern science, we all know the well documentation is there. If they are treating the cancer, then the documentation is very, very proper. We are also treating the cancer, but I think there is a lacuna in that documentation. So, scope and limitations regarding that. Now, weakness and drawbacks of modern medicines. First of all, side effects of chemotherapy and radiotherapy. Then quality of life of patients can be hampered. Cost beyond limits for some patients. Limitations to prevent recurrence and fails to cure the disease as a whole. So these are the weaknesses and drawbacks of modern medicine. We all know that when the patient comes to us after taking the modern treatment, at that time we have seen that the patient is having many of the side effects. Patient is having nausea, anorexia, then appetite loser, then many of the patients are having diarrhea. These all the side effects the patient is having. Quality of life of patients can be hampered. We all know that due to the anorexia, due to the side effects of chemo and radiotherapy, the quality of life of patient can be hampered. And of course, cost beyond limits of for some patients. Now, why to think about Ayurvedic treatments? We all know that patient comes to us very late, very lately patient comes to us. After taking all the treatments, then patient comes to us. So which are the golden highlights? Our treatment is comparatively cost effective, of course, affordable to health and wealth. It works on the body as well as mind. Rasayana and Panchakarma therapy for strength and increase the immunity of breast cancer patients, and non-hazardous medicines with very less adverse side effects. So these are the golden highlights of our treatment principles. Now, weaknesses of Ayurvedic medicines regarding breast cancer. Of course, limitations in diagnosis and prognosis. We all know that only and only through Ayurveda we cannot diagnose the disease. With the help of the modern regimen or modern treatment, we can diagnose the disease. There is no any key for the diagnosis of the cancer in Ayurveda. So we must take the help of modern medicine for the diagnosis. Then breast tumor, breast cancer control might be difficult only and only with the Ayurvedic medicines. Emergencies in breast cancer patients shows limitations to handle and lack of standard, well-established and documented data of clinical results. So these are all the weaknesses of Ayurvedic medicines. As per my opinion, if any emergency can be happen, we cannot handle that emergency as far as possible in that situation. So these are all the weaknesses as per my opinion. Now, which are the facts? Breast tumor or breast cancer is not the disease basically. As per my opinion, breast cancer is not the disease. Breast tumor is a symptom. Tendency to form a tumor is an actual disease as per my opinion. Tendency to form a disease, to form a tumor is an actual disease. Now, modern science is more concerned with breast tumor and breast cancer. And Ayurveda is more concerned with the tendency of breast tumor and breast cancer. So with the mixed union of these therapies, the disease can be controlled safely. So this is actual fact as per my opinion. Now, what is the truth? Both these sciences have potential as well as limitations. Means modern science as well as Ayurveda, both the sciences have potential as well as limitations. But the effective fusion of both conventional treatment and Ayurveda medicines, we can offer very good life to the patient, qualitative as well as quantitative life to the patient, and we can add years to the life and life to the years of the patient. This is last but not least special quote that cancer is just a small word. It is not a sentence. So let us stop cancer tsunami by giving Ayurveda and leaving Ayurveda. So सर्वे अपि सुखिनः सन्तु, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु, न कश्चित् दुःखम् आपनुयात्. So here I just want to conclude in my topic or in my presentation that we, sir, I have the time. How much time left?
Just 30 seconds.
Okay. So I'll conclude. The moral of the story or moral of this presentation that we cannot treat only and only through Ayurveda. We cannot treat any cancer through and through only Ayurveda, but with the help of modern science, we can give very good life to the patient. We can add life to the patient, but only and only through Ayurveda, we cannot diagnose the patient. We should take help of modern technology. We should we can take help of modern technologies, modern radio imaging techniques, modern treatment. We can take help from that. And then only we can treat and we can give life to the patients. So this is the moral of the presentation. So thank you, sir. Thank you very much for giving me this opportunity.
Thank you, ma'am. Thank you so much to give your knowledge with us. Now, I would like to invite Dr. Rajendra Solekar, sir, to give his brief comment on it.
Madam, you can take your slides off.
Yes, yes.
Dr. Jyoti, Madam, has delivered very nice lecture on approach, Ayurvedic approach for breast cancer and its limitation. She highlights the risk factor of the breast cancer. It is due to the lifestyle disorder, Ayurvedic types, breast cancer of the Ayurvedic type, Vatas, Pitas, Kaphas, Mansas, Medas, and Raktas. And he explained the Ayurvedic management with Shodhana, Shamana, Rakta Vistravana, and Pitta Stamana, and Agni Dipan Chikitsa. No doubt, Ayurveda has a potential to minimize the side effect of the chemotherapy and radiation, a conventional therapy. The side effect of the conventional therapy is constipation, rectal bleeding, vomiting, nausea, vomiting, and burning sensation all over the body, discoloration of the hair and nails. These will be minimized with the help of polyherbal management along with the conventional therapy. And it is a very good for the lifestyle of the post conventional therapy of the patients. Newer treatment guideline emerging every year in the intention to minimize the associated adverse effect of the conventional method of treatment. These formulation may normalize the function of multiple T-regulated protein found in the breast cancer cell. I will say that this treatment of the polyherbal drugs along with the Ras Aushadhi, along with the Panchakarma, will definitely benefit the cancer patients, definitely benefit the cancer patient life. Recently, a vaccine on the breast cancer, first phase trial has been conducted in the University of Washington, and this trial is a very good outcome, and it's needs 2 or 3 phase trial. It may be required 4 to 5 years to have a anti-cancer vaccine for breast cancer, and it will be the new revolution for the cancer patient. There is a potential in the Ayurveda that a young researcher can find out such a polyherbal formulation to suppress the growth of cancer tissue, and I think that it is a definite in the Ayurvedic text. Thank you. I thank to the Director of Ayush, Dr. Raman Ghungrade sir, Dean of the Government Ayurved College, Jalgaon, Dr. Ahire, the Organizing Secretary, Dr. Yunis Solanki, and Dr. Jyoti Madam for very nicely presentation on the breast cancer approach. Thank you very much.
Thank you, sir.
Thank you so much. Now I invite Dr. Geeta Kedar ma'am to give a quick comment.
Hello.
Yeah, Dr. Neeta Kedar.
Yes, ma'am. Yes, sir. Thank you, sir, for inviting me as to chair the session. Thank you so much.
I would like to say that Dr. Jyoti ma'am has elaborated Ayurvedic aspect very well, along with the basic principles of management and the pathophysiology of breast cancer. Nowadays, the breast cancer, the prevalence of breast cancer is much more in worldwide, and our medical education department has already started the mission of awareness of breast cancer since last year, and OPDs of breast cancer for every health care system. And the important risk factor of breast cancer is early menarche and late menopause, along with the hormonal treatment, past family history, and potential risk. These are the potential important risk factors of breast cancer. And so the early diagnosis is very important in the management of breast cancer. As we all say that prevention is better than cure. So early diagnosis is very important in the management of breast cancer, and it is cheaper than cure. So I would like to say thank you so much again to respected Director Dr. Raman Ghungarekar sir, the organizing, the Dean Dr. Ahire sir, and the organizing committee Dr. Solanki sir and Dr. Khote ma'am. Thank you so much.
Thank you, ma'am. Now I invite Dr. Shubhangi Badole. Now I invite Dr. Shubhangi Badole ma'am to give her views.
Good afternoon all. Am I audible?
Yeah, audible, visible.
Yeah, thank you, sir. Thank you. Firstly, I will thank organizer of today's international webinar. Myself, Dr. Solanki sir, Dr. Khote madam, and their wise team. It's a very good collaborative work. And thank you for giving the opportunity to chair this session. Firstly, I will congratulate the speaker, the brilliant speaker, for her excellent presentation on breast cancer and as an integrated approach through Ayurveda management. Firstly, sir, her views on Anukta Valley, like in Sanarbu, we have a Arbut chapters, but specific symptomatology or etipathology is not explained according to the organs. And Madam has done a good job on this. Her references for Santarpanjanya treatment, that is Santarpan Chikitsa, like Prameha, Brahani, Rajik Sharma, was a good highlight for this, and good references for Santarpan in diseases like in the palliative treatment period. She elaborates the Ayurvedic limitations for the treatment and management of these diseases. Her clue that we may treat cancer, but her clue about we can treat nicely the tendency of cancer, breast cancer. That is our achievement, or that is the area we can work very nicely through Ayurvedic treatment. And her suggestion for collaboration work that we always do with modern pathies for better result, and work in hands in hand. Because as always said that we have 5 fingers in hand and each finger has its own role. Same way allopathy, homeopathy, Ayurveda, everyone should work in hands in hand, and it is always seen in all the treatments as we see. And regarding my views of, I can add little, that we need a good Ayurvedic protocol for the management of these upcoming fatal diseases like breast cancer, as that is the need of current era. And it may have 3 steps. One, that is education of the patient, that is cell breast examination first, education of our students, medical students, all medical staff, to how to examine basically the breast can, how to examine base level breast cancers, and how to approach the next steps. Then for preventive protocol, we should think about the prevention of breast cancers, and we should spread it to the all the our community, so how to prevent the breast cancer. And for treatment protocol, that is a major part. Maybe it will take 5, 6 years or 10 years, but we will be there somewhere for the cancer as Ayurveda. Thank you all. Thank you, the team. Thank you, Solanki sir. Thank you.
Thank you, ma'am. Now I invite
Thank you, everyone.
Analike, ma'am, to give her views. Dr. Dhanalike, ma'am.
Please unmute yourself, Dr. Dhana. Unmute. आवाज येत नाही.
Okay, okay.
Yeah,
Good afternoon, one and all.
Good afternoon.
First of all, I would like to congratulate the organizers for selecting very important topic like Ayurvedic approach for cancer management. And I equally congratulate Dr. Jyoti Mekdambar ma'am for giving such a nice insight and justice to the topic. Because as we all know, at present, breast cancer is one of the most frequently diagnosed malignancies worldwide, accounting for 23% of female cancers. Even though the mortality rate and recurrence rate is decreased significantly due to improved screening, early diagnosis, and availability of advanced treatment options, but still 25 to 30% of patients develop disease recurrence and die from the disease dissemination. So, I also feel integrated approach for breast cancer management is the need of hour. And by this, if we can contribute in any way for this purpose, it will be great help to the womankind for our Ayurveda. Today, Dr. Jyoti Mekdambar ma'am has very aptly mentioned about the benefits of Ayurvedic principles like Prakriti Parikshan, Dosha Dushya Sankalpada, Ayurvedic diagnosis, and Samprapti from Ayurvedic point of view. She also described different principles of Ayurvedic Chikitsa and also drawbacks of modern treatment and scope of Ayurveda for the management of breast cancer. Thank you, ma'am.
Thank you.
Lastly, I would like to thank Honorable Director, sir, respected Dean, Government Ayurvedic College, Jalgaon, and whole organizing committee, Dr. Solanki, sir, Dr. Khoth, ma'am, and whole team of Government Ayurvedic College, Jalgaon, for giving me the opportunity to be present as a chairperson for this wonderful, informative, and scientific session. Thank you, sir.
Thank you.
Thank you, sir.
Thank you, ma'am.
Yes, thank you. Thank you, everyone. Thank you, everyone. Thank you.
Dr. Sonekar, sir. Thank you, Dr. Neeta Kedar, ma'am, and Dr. Shubhangi, ma'am, and Dr. Dhanalike, ma'am. Now we move to next speaker, and to conduct it, I would like to invite Dr. Sonali Parakh. She is an assistant professor in the Department of Prasutitantra-Streeroga at Government Ayurvedic College, Jalgaon.
Thank you, madam. Now I invite and welcome our next honorable guest speaker, Professor and Dr. Swati Mohite, madam. She is professor and head of Department of Prasutitantra-Streeroga at Bharati Ayurved College and Hospital, Pune. She is having huge experience as a clinician for last 28 years, along with academic experience of 28 years. She awarded with Dhanvantari Award in 2014. Also, Sanman Puraskar by Pune City Doctors Cell in 2018. She has many more national and international research articles and papers in her credit. She was also worked as a subject expert at Central Council for Indian Medicine. She also played a role of principal investigator in Indian Council of Medical Research Projects. She is specially active in many social programs like Akanksha Cancer Breast Cervix Awareness Program. Dear friends, Again, for this session, we have great personalities with views for the subject. Firstly, I invite and welcome Dr. Suhas Herlekar sir. He is past professor and head of Department of Streeroga and Prasutitantra at Ayurved College of Pune. He is currently working as a director of Suhas Herlekar Gynecology Education Foundation. He is also honorary gynecologist at St. Tarachand Hospital, Pune. Now I welcome Dr. Anita Bombade Madam. She is professor and head of Department of Prasutitantra-Streeroga at Government Ayurved College, Nagpur. She is having huge academic experience with 5 international papers in journal and 15 national papers in her credit. She also awarded with Best Ayurvedic Gynecologist Award in 2023 and Shikshan Sanman Patra Award in 2018. Now I invite our third chairperson and welcome Dr. Neeta Maisekar Madam, Director of Northeastern Institute of Ayurveda and Homeopathy, Meghalaya. She is having very vast teaching experience of about 31 years. It is very difficult to conclude her achievements in few words, but some are like she awarded with Lifetime Achievement Award in 2020 at Dehradun. Also, Achanta Lakshmipati Gold Medal by Dr. BRKR Ayurved College, Hyderabad. She also contributed for e-book on female infertility in January 2021. She also served as a member of Board of Studies at Maharashtra University of Health Sciences, Nasik. Now I invite and welcome our fourth chairperson, Dr. Seema Mehere Madam, Professor and Head of Department of Streeroga and Prasutitantra at YMT Ayurved College and Hospital, Kharghar, New Mumbai. Madam has a vast experience of PG Guide and PhD Guide. She has been a member of Research Advisory Committee and Institutional Ethical Committee of Sayan Ayurved Mahavidyalaya, Mumbai. She has delivered lectures of a guest speaker at many webinars. Now I request the speaker of this session to please deliver her lecture.
Am I audible?
Yes, ma'am, audible.
Yes, thank you. So I will share my PPTs. Can you see the PPTs?
Yes, ma'am.
Yes. And my voice is quite okay?
Yes, ma'am.
Yes, okay. So thank you. Thank you for giving me this opportunity to share my views regarding the integrated approach in pregnancy. I would like to thank both madam also and the organizing team of your college, ma'am. So thanks a lot. Now I will start my lecture. So I have given a topic that integrated approach in pregnancy. Now this is according to, just a minute, I will remove this. This is according to the Government of India policy. The decision to integrate Ayurveda into modern medicine comes from the center's aim at having a one nation and one health system policy by integrating various systems of medicines, including allopathy, Ayurveda, Siddha, Unani in medical practice, education, public health and research for providing holistic care to the patients of India. This is initiation taken by the Government of India. Now I cannot move the slide. Yeah. So what is integrated approach? Integrated approach is similar as Buckminster Fuller, who is American architect, wisely quoted, and he said that you never change things by fighting the existing reality. To change something, build a new model that makes the existing model absolute. So this is the task of not only Ayurved people, but this is the task for all pathies to come together and develop an absolute model for treatment of the patient. Now, why pregnancy? What is pregnancy? pregnancy, you can see my slides. It is a slide of life. What do you mean by life? We are actually giving a life when the baby is in the uterus, in the womb. So we have a concept that 9 months investment is for the investment of 9 months will remain for the it will take the family will take the benefits for 90 years, the nation will take the benefits of 90 years. So pregnancy is so important. Now, why pregnancy is also important? The quote, the Dr. Bakker's idea has spread it now, the subject of investigation by researchers all over the world. The quote and saying of recent years, child is the father of man, hold good today, as it is seen that the nutritional status of fetus, infant and childhood is associated with a lot of adulthood diseases, that is diabetes, hypertension, cardiovascular disease, preeclampsia, IUGR, metabolic syndromes, and many others. So it is very important that whether you are practicing Ayurveda, allopathy, any pathy you are practicing, you are supposed to concentrate on that pregnancy, because the pregnancy, that fetus, the roadmap of that fetus, or the adult diseases of the adult diseases which are going to be have to that fetus is defined in the womb itself. So pregnancy is very important because of origin of adult diseases, they lies in the fetal life. So fetal nutrition, fetal growth, intrauterine growth retardation, and all has to be acknowledged or treated as soon as possible, is must to avoid the adult diseases.
Excuse me, madam.
Yes.
Can we share the slides?
We are not. Slides are
Yeah, slides are there.
Your slides are not moving.
Your slides are not moving, madam. If you
But I can see the slides. I am changing the slides and I can see the slides.
not moving here.
No, it's not moving. Yeah.
Okay. Again, I will do it. What happened now? It is changed totally.
Changing?
I have received. No, it is not working now. Someone enter the meeting info and all that is coming.
Madam, please wait.
Our doctor is working. Can you see the slide?
What happened? Shall I join again?
Yeah, madam. Yeah. Madam, please tell the slide number. Your slide number.
Wait. My slide is now. Are you sharing my slides or I am sharing my slides?
Please continue. Please continue, madam. Please
continue sharing.
You continue the sharing.
Yes. Is it okay? Can
no.
you see what is integrated approach?
Right.
Yeah. Yes. First slide we can.
This is the sixth slide.
No. Madam, please maximize it.
I have already done.
But not visible, madam.
So what to do? Tell me.
But actually slides are visible but not moving here.
Can you see the slides now?
No.
I have started from first slide. Can you see?
Yes.
Very first slide?
Yes, ma'am.
Yes. Yeah.
Can you see the second slide? GOI policy?
No.
Then I am able to see, but you are not able to. So what to do?
Sir. Madam, please, you stop the slide sharing. We will share.
How will you share?
Yes, madam. Yeah, I can. Madam, visible. Slide number 6 is visible. Yeah. So, yeah. Yes. Madam, visible.
Madam, we are sharing your slides.
You are sharing the slide.
Yes.
No, but my slides, they are little bit different. So, okay, we will continue. No problem.
Yeah, okay.
Okay, madam. Thank you.
Now GOI policy, and this is PDF, this is not slides.
Please continue.
Yeah, I can continue, but take the next slide. Scroll downwards. Scroll downwards. Yes, scroll. Yes, go down. Next slide. Yeah, pregnancy is a creation of life. Now, what is integrated approach? That slide was there, correct? Now, can you see it? Yes. What is integrated approach? Integrated approach, it is an integrative approach, is the idea of integrating or combining aspect of several different schools of thoughts to promote the wellness. It is an approach to medical care that combines conventional medicine with complementary medicine and alternative medicine, that is CAM, practices that have shown through science to be safe and effective. This approach often stresses the patient's preferences, and it attempts to address the mental, physical, and spiritual aspect of health. Scroll next. Again, what is integrated approach related to Ayurved science? Ayurved is an indigenous ethnic medical system in popular practice in the Indian subcontinent, laying emphasis on self-discipline and modest living with high human values. The system strongly advocates the unique set of principles and guidelines on diet and exercise in daily healthy living. A classical Ayurvedic system was probably driven by insight, intuition, and astute observation of human behavior and nature. The soil is more important than the seed. That is the concept underlies several Ayurvedic treatment strategies. Now, and Ayurved principles therapeutic aim is to harmoniously restore that balance. Next. Scroll, please. Now here I am going to do the SWOT analysis of the integrated approach. The SWOT analysis means what? The strength of the integrated approach, the weakness of the integrated approach, what is the opportunity when you treat the patient with integrated approach, and what are the solutions? Next. So what are the strengths? Strength means it can provide comprehensive treatment that addresses the patient's complex symptoms, thus improving the possibility of good recovery. So this is very important. This is the strength of treating the patient with integrated approach, that it can provide a comprehensive treatment. So when you combine the modern science and Ayurved science, the patient gets good results. So many times we observe that patients is having recurrent UTI, and Cital, we are giving Cital, we are giving antibiotic, but still the patient is showing the same picture. So in that case, if we add Shadangodak with all that, then we get best results. So it is the strength that patient, the possibility of good recovery is there. That is the strength of integrated approach, and help to cope with the side effects of orthodox medicines. This is also very important. So it is very true, when there are side effects of medicines, if we combine Ayurvedic medicines with modern mainline medicine, or that is called as orthodox medicine OM, then the side effects can be overcome with the use of Ayurved medicine. Next. Now, what are the weaknesses? So weaknesses are lack of planning and coordination. So there should be a very good coordination, not only between Ayurved fraternity, but there should be very good coordination between modern science practitioners and Ayurved practitioners, so that we can build up a very good, constructive treatment for the patient. So this is the weakness, that there is lack of planning and coordination, development and adherence to guidelines, and unavailability of trained health professionals. That is also one of the weakness to start an integrative approach of treatment. Next. Now, what are the opportunity of integrative approach? The opportunities are very wide, that it may be cost effective for the patients. It will help for the better outcome, will prevent the damage of the organ by strengthening it. This is very important. So when we use drugs like Shatavari, which are bullying in nature, which strengthens the uterus very well, and that will prevent the damage of the organ by strengthening it. So history of repeated habitual abortions, previous 2 cesarean sections. So the weakness of the organ can be overcome by combine the Ayurvedic medicines with modern medicines, so that will prevent the damage of the organ by strengthening it. Next. So what are the solutions? Solutions is the dialogue between experts of orthodox medicine and traditional medicine, and government grants for such kind of research for integrated management is also very important. That if we get a government support to develop further integrative management, so that is also very important, and that is the solution. Next. Please scroll. Yes. So how to find out the solution? So there should be some guidelines to find out the solution. What are the patient's symptoms and need? That is to be found out. Who can address the patient's need? Means whether Ayurved practitioner or allopathy practitioner, who can address the patient's need? That is very important. That if there is a uncontrolled hypertension, as Ayurved gynecologist, I should not be adamant that I am going to give some Ayurvedic medicines to control the hypertension. So that there should be a mutual understanding, and it should be found that who will address the patient's need, what interventions can lead to a good outcome. That is also very important, that where to intervene and when to intervene. So that is the solution. And the last, what are the goals of each intervention? So if you want to improvement in the birth outcome, your goal is different. You want to prevent the intrauterine growth retardation or improve the placental insufficiency. What are your goals when you are treating a patient? That should be defined. Next. Now we have to decide some goals. We have to plan accordingly, and you have to take the action. Next. So what is the goal? What is the goal of Ayurved, integrating Ayurved and modern science? The first goal is to paripurnatvaya, that is proper growth of fetus and mother, correct? Then anupaghataya, that is non-complicated pregnancy. And the last one is sukhaprasavaya. I will not call it as a normal delivery. I will call it uneventful delivery, because whether it is section, whether it is normal delivery, it should be uneventful. Means there should be no PPH, there should be well contract, there should not be atonic uterus. So these should be the goals, that sukhaprasavaya means whether it is normal delivery, whether it is cesarean section, whether it is venous delivery or forceps delivery, it should be uneventful. Uneventful related to the fetus and related to the mother. Next. Now how we should plan? So planning should be preservation of healthy progeny. This is the basic concept of Ayurveda, that is swasthasya swasthya rakshanam, that is preservation of healthy progeny. The second very important planning, we are supposed to do that, management of the complications. Third is the sustenance of the pregnancy. So sustenance is also a challenge nowadays, because we are getting a patients having elderly pregnancy, and most of the time because of inadequate hormonal supply and all, there is lot of time we are facing the problem of sustenance that is to be addressed. So we have to plan when we are selecting integrated management. We have to plan how Ayurved medicines and modern medicines, they will helpful in sustenance. I would like to give you one example. That many times it is happening that there are history of 4 abortions, 5 abortions, 3 abortions, 2 abortions, and during that period, patient undergoes the treatment for doctors advise her progesterone, sometimes HCG injections and all, and still the abortions are there. Now As an Ayurved practitioner, I have to think that what should I do, or what should I add with the HCG or progesterone, or what should is it possible to avoid these hormones and add Ayurvedic medicines to sustain the pregnancy? This is also a challenge in front of us, and to enhance the normal delivery. Next. Now we are supposed to prepare a treatment plan. So treatment plan should be specific, measurable, attainable, relevant, and timed. So this is very important, that as a gynecologist, as an obstetrician, we get only a period of 9 months to treat every abnormality during pregnancy. It is not possible beyond 9 months we can treat. If anemia is there at 7th month, you have only 3 months in your hand to correct the anemia. If PIH at 8th month, you have only 1 month to correct the PIH. If GDM is there, you have to only few days to correct the GDM. So it should be timed. And as an obstetrician, you all understand that we get only 9 months to correct everything and to take her till 40 weeks uneventful without any problem. So it should be timed. Next. Now, what do you mean by specific? Control a health problem, lessen its symptoms, or clear it up. So patient is having nausea and vomiting. You have to control the symptoms. Otherwise, she will land into hyperemesis gravidarum. Her ketone bodies may get increased, and then the patient may become critical. So you have to see whether you are using combined medicine, you are using all absolutely Ayurvedic medicine or allopathy medicine. You have to concentrate that it should be specific, it should control the health problem. It should be measurable. See, if I am saying that I am treating the IUGR, I am treating the patient of IUGR, and if your UHG is not showing that EF estimated fetal weight is increasing, then it is of no use. So it should be always measurable. So we cannot claim that only fundal height is increasing. We are not doing sonography and fundal height is increasing. No, in sonography, we are supposed to prove that yes, the previous estimated fetal weight was 1 kg. Now the estimated fetal weight is 1.4 kg, 1.5 kg with a certain duration of interval. So it should be always measurable. Sometimes we tend to view Ayurvedic medicines for anemia, accepted. But you have to show in the reports after every 45 days that hemoglobin levels are increasing by doing hemoglobin levels. So it should be always measurable. Then attainable. Attainable means I am giving some medicine for correction of anemia. So whether you are going to attain it or not, that is very important, because many times patient comes to us, no ma'am, we are taking medicines from some Amway, some medicines. Check whether it contains iron. Check whether it is in adequate amount or not. You are giving tappediloha. Check it whether that tappediloha is supplying adequate amount of iron or not. I don't have any objection to give tappediloha, mandurvas, man, anything. But whether by giving your medicine, are you going to attain it or not? That is to be observed when you are prescribing any medicine. Now it should be relevant. Sometimes clinically relevant means what? Clinically relevant means medically necessary and resulting in the development, maintenance, and restoration to the maximum extent practicable of the functioning of an individual. This is very important. Make it that it is relevant. I would like to point out one example here, which we all are doing. Many times patient comes to our OPD and everything is normal, naturally conceived patient, no PIH, no GDM, no history of PIH, no history of GDM, no history of repeated habitual abortions, normal 24 age patient, conceived normally, all reports normal. But we start Masonic path. If you go through the references, we find that Masanumasic Vat, the reference is there in regarding to the Yonigata Raktasrav, where Masanumasic Vat is to be given. So it should be relevant. I would definitely encourage that if there is subchorionic bleed, if there is retroplacental clot, so in that case, if we advise it, then that is okay. No need to wait till you see the Yonigata Raktasrav. But nowadays, because of advanced techniques, we come across the patient with subchorionic bleed, sometimes with retroplacental, small retroplacental bleed. So in that case, it is relevant. But starting even at 19 years of age patient, no any history, normal, in fertile age, and we start Masanumasic Vat. So it should be relevant. So, and see, if we are saying that Ayurveda is medicine, the thumb rule is that every medicine has side effects. So we cannot claim that Ayurvedic medicines doesn't have any side effects. And always be aware that whatever medicine you are using during pregnancy, study its Rasavirya Vipak. Try to find out whether the Rasavirya Vipak is correct or not. Sometimes I have seen the patients where for the correction of anemia, Arogyavardhini has been prescribed continuously for 3 months and 4 months as a source of iron. But see, Arogyavardhini is Bhedan and Lekhan. It will definitely affect the, it will definitely land into Ayurved and oligohydramnios. And I have seen many patients that as a, okay, that is in your mind, it is relevant. It is an iron source. Okay, accepted. But see, it's Rasavirya Vipak, whether it is indicated during pregnancy or not. It is indicated, okay, for mother. Then what about fetus? So Lekhan action will be on fetus also. So you have to see when you are prescribing any medicine during pregnancy, it should be studied very thoroughly. Any basma you are giving, it should be studied very thoroughly. That what are its Rasavirya Vipak, what is its action, whether it is Bedan, Lekhan, whether it is Bruhan. So all things should be studied, and you should find out the, when you are integrating the medicine, you are integrating the treatment line of treatment, it should be always relevant. Related to pregnancy, it is, you have to study it very correctly. Then it is timed. I already tell that an obstetrician will get the duration of only 9 months to manage a condition. Next. Now it is time to take the action. Now I am going to share my clinical experience of few examples of my clinical experience of managing the pregnancy, various aspects of pregnancy with integrated approach. Actually, in this slide, I have not put some case papers. Otherwise, I have some case papers, photos that I will show you that how we are managing with integrated approach. So actually, case paper will be more clear than whatever I am saying you. Next. Now it is right time to take the action. Now, what is my clinical experience? So preservation of healthy progeny or healthy pregnancy. What is to be done? Use of combination of 3 Ayurvedic formulations can be used. This is my opinion. You may use, you may not be used. But this is my opinion. And it is having a reference of Garbhidi Paricharya that Madhurgana Aushadhi can be used during pregnancy. So Shatavari, that is the role of, this is one of the research paper which is saying that in a high-risk pregnancy, it is used Madhur Rasa drug during pregnancy, and Shatavari is widely used during pregnancy. But one more thing, there are a lot of researches, and I have done one research that Shatavari 1 in Shatavari is a tocolytic in nature. So if you want to use the Shatavari, stop it at 36 to 38 weeks so that there will be no further tocolytic action to so that the patient will not land into normal contraction and all. So this knowledge we must understand. So 5 gram of Shatavari contains 1 gram, I think 1 microgram of Shatavari 1. So Shatavari, if you are giving up to 5 gram during pregnancy, use it as a tocolytic. If you are giving less, then it is okay. Now, second thing, Yashti Madhu is also, I am using in my day-to-day practice. And the researchers are saying many people are having objection regarding Yashti Madhu. Correct? So there are some research papers saying that Yashti Madhu is having teratogenic effect on the fetus. But similarly, researchers are saying that if you use 250 gram Glycyrrhiza glabra or licorice in 1 week, then it has teratogenic effect. How much we are using? We are using 60 mg, 125 mg, 250 mg maximum. For 7 days, it will be not more than 1 gram or 2 gram. So even if when you are using, we are supposed to study to say how I am using and why I am using and what is the teratogenic dose. So that we must study and why before starting using this. Then Amalaki, I am using these 3 herbs frequently during pregnancy for the preservation of healthy pregnancy, not in any abnormal condition, for the preservation. Because nowadays we are seeing that there is a lot of pollution, the pregnancy is late age pregnancy and all. So these are the 3 drugs, three herbs which can be used. They are very good in managing the oxidative stress. And we all know that pregnancy is a oxidative stress condition. It is a natural oxidative stress. But now to other environmental factors, family factors, infertility stress factors and all, we are supposed to manage that natural oxidative stress during the pregnancy, and all these 3, especially Shatavari and Yashti Madhu, they have on that those 2 herbs. Lot of research has been done and in the management of oxidative stress. Now it is a micronutrient absorption. It improves. If you go through the researches regarding Amalaki, it is hematopoietic. It has hematopoietic action. So it will improve the micronutrient absorption. It will prevent prevention of various pregnancy-induced complications. It will improve the breast milk secretions. The approach is like that: after delivery, if there is Kanyakshay or less breast milk secretion, people start treating it. This is not the Ayurveda's concept. Ayurveda's concept is that the stanna preparation should be there. Breast should be prepared for the breast milk secretion. After starting the function, if you want to treat it, then most of the time we fail and pay. The baby the neonate gets shifted on the top field. So it will it will improve the breast milk secretion after delivery. Improvement in the birth weight is also observed when you give these 3 kinds of these 2 or 3 combinations during pregnancy. I have a research paper published on this, that use of Shatavari and Yashti Madhu. You can go through the research gate of my account and you will find all these research papers, that how malnourished mother, we have improved the birth weight of the fetus by using these formulations. Next. Now, what is the preventive aspect? So this is one of the research we have done long ago. Now we are using all these things, and many people have done research on this. One of my students, she did the research work on this almost 18-20 years back. The prevention of PIH by using Gokshur Siddha Gruta in the pregnant woman with history of PIH in previous pregnancy. Now the researchers, they are saying that this is not the Ayurvedic concept, but you have to, when you are talking with the modern science people, you must have their concept in your mind. Always remember that we will be questioned not by Ayurvedic people, but we will be questioned by modern science people, why you are doing this. So for that, you should be very prepared that there are many researches saying that mild diuretic, when you start mild diuretic, it will prevent the hypertension. So what is Gokshur? Gokshur is very mild diuretic. Okay, we know that it is Bruhan, Balya and all things. It is mentioned in Garbhini Paricharya in the 20 to 24 weeks. That is our explanations. Modern science people will not accept your explanations. We have to give their example to them. So this is then maternal lipid profile. And why Gruta? Why Gruta? There is lot of research paper has been done in the maternal lipid profile. So maternal lipid profile in pregnancy and embryonic size, a population-based prospective cohort study. Go through all these both researches, and you will find that maternal lipid profile is very important even for the neurogenic growth of the fetus. So this is the lipid profile. What are grutas? Ghrutas are the lipids. So what we are doing? We are supplying with the lipids. So go through these researches, you will find when you will talk with modern science people, we can answer like this. Next. Now, preventive management. The efficacy of Shatavari and Yashtimadu in prevention of IUGR with PIH women in established treatment. So patient is on oral antihypertensive drugs and the development of IUGR and oligohydramnias. Use Shatavari Yashtimadu. Use Garbhapal, use Madhumalini Vasanta, and with antihypertensive drugs, start our medicines, you will definitely get very good outcome, birth outcome, and even you will find, even you can use it with Ecosprin. But I don't use Ecosprin. I start Madhumalini Vasanta, Shatavari and Yashtimadu, even if there is a placental insufficiency. Okay, so this is my decision with antihypertensive drugs. But you can start with Ecosprin also. But this is my 30 years practice is showing that if you start Ecosprin, the same outcome is there. If you start Madhumalini Vasanta, the same outcome is there. So this is very important that you have to take your own decision, but be confident. Take the help of research papers, which are saying that the both have same action. Okay, next. Now, even efficacy of Shatavari as a tocolytic in pregnant women with premature contraction and history of preterm delivery. So, if the patient is having history of preterm delivery, I avoid using, tocolytic drugs, or even some people they use, antihypertensive drugs for the prevention of preterm labor. But I am comfortable with Shatavari, using Shatavari, but those should be around 4 to 5 grams in 24 hours. That will prevent the premature contractions. So if you give 125 mg of Shatavari, it will be not useful for the prevention of premature labor. Because if I am using Shatavari, you will start using Shatavari. But dose is very important. The active component of Shatavari is Shatavari 1, which is almost 1 milligram in 5 gram of Shatavari churna. We are not extracting the Shatavari 1. So take care of that. Next. Now, like sustenance, very important thing. Laghumalini Vasanta for implantation during first trimester. We get the patient of having history of 3 first trimester abortions. First trimester fetal loss. Correct? Now we think now they have already given, progesterone, HCG, in second and third time, because she had history of first abortion. So modern science people, they give second time, third time, all has been given in second pregnancy, third pregnancy for the prevention of missed abortion. Still second time given, still third happened, third time given, still third happened. Now we have to be very alert. Array, those medicines are not working. Now what to do? What to think? Now, what is my interpretation of how I started using Laghumalini Vasanta? There is a lot of research has been done that role of zinc in the implantation of the embryo. Go through the research papers. There are many research papers that role of zinc. Then, when we are using Laghumalini Vasanta in first trimester for the prevention of, first trimester abortion, if modern science people is saying that you are not giving progesterone, you are not giving a HCG, then what you are giving? And your researchers are saying that zinc is very important in not only hormones, but zinc is very important for acceptance and sustenance of the pregnancy. So what we are using? We are using zinc. That is Laghumalini Vasanta. Okay, so we have done research on this also, that endometrial preparation, that is luteal phase defect and Laghumalini Vasanta. And the patients who are having history of more than 3 missed abortions use Laghumalini Vasanta in those patients. We did research on this also. Now, even in Garbhapal Ras, so many times we start Garbhapal Ras in each and every patient. Each and every patient. That should also not be done, because Garbhapal Ras is having lot of basmas. I'm not, worrying about basmas, but wrong indication is always can cause problems. So Garbhapal Ras, if patient is having, in polycystic ovarian disease patient, there are almost 35 to 40% chances of first trimester fetal loss if the patient conceived after treating the PCOD. Correct. So if you want to prevent that 35 to 40% first trimester fetal loss, as soon as patient gets conceived at 6 to 8 weeks or 9 weeks having history of PCOD, start Garbhapalras till 28 weeks. The pregnancy loss will not be there. So do your observation. This is my observation. I have not published any research paper on that, but few research papers are there. You can study. You also can publish the research papers. Now, again, Masanuvasic Vatvati in pregnant women with specifically subchorionic bleed, with retroplacental bleeding. No need to wait. How Yoga Ratnakar commented that Yonigata Raktastrav means outside you can see the Yonigata Raktastrav. Nowadays, because of availability of sonography, no need to wait till the bleeding comes out of vagina. You get the report that subchorionic bleed is there. There is collection in the subchorionic. There is retroplacental bleeding. Start immediately. If you find that subchorionic bleed at 9 weeks, start second Dvitiyamas Kadavati. You get the patient of retroplacental collection at 6 months. Start your 6 months Kadavati. So we can plan according to that, because that is a treatment. That is not a normal. Otherwise, Granthakara would have not been mentioned the Garbhini Paricharya. If it is to be treated with Garbhapal Ras, Masanumasic Kadavati, then they may have mentioned in Garbhini Paricharya only ki Masanumasic Kwath should be prescribed in Garbhini Paricharya. So many Granthakaras have mentioned Garbhini Paricharya, but only twice they have mentioned 2 herbs. One is Prusniparni and one is Gokshur. Only twice they have mentioned herbs which are not your dietary components. Gokshur is never a dietary component. Prusniparni is never a dietary component, but they have mentioned in 5th month and in 6th month only 2 herbs. Now you have to correlate that with the present knowledge that the onset of PIH is, if it is from the 5th month, then it is called as pregnancy-induced hypertension. If diabetes starts from 6 months, then it is called as gestational diabetes. So we are doing Dept between 24 to 28 weeks, correct? So for the prevention of those kinds of, metabolic disorders, you can start that as a prevention, not after having the hypertension. Okay. So this is my concept, and which is very based on the references, Grantokta reference, Samhita reference, what we have. So Masanumasic Vath, next. Please scroll. Now, management of pregnancy-induced complications. We have done a research on Prusniparni, where GDM is there, where the Dept is showing BSL up to 200, and that research paper is published. You will get that research paper on internet also, that up to 200, if the Dept is showing blood sugar level up to 200, we have managed the patient only on Prusniparni. And every after 15 days, we did the blood sugar level fasting and PP, and even we kept the follow-up of that patient 6 weeks, which is a routine protocol after delivery, to see whether the GDM is continued or not, the diabetes is continued or not. So you also can start using this Prusniparni in your day-to-day practice. The dose was 1 gram, 3 gram in 24 hours. So you can arrange this as per your convenience. Now, again, one patient, just few months back, we were having a patient with hyperemesis gravidarum, and almost four times outside our hospital, and 2 times outside our hospital, and 2 times in our hospital, because of dehydration, her ketone bodies were increased. Now what to do? All antiemetics, she was on all antiemetics. Repeatedly, she has been taken IV MSET, IV PAN, and everything, but the emesis was there. Simply, now after completing this, I will show those case papers also. They are very interesting. So I have started Amalaki machine. And you will not believe me, this you will find this as an exaggeration also, that within 2 days, her hyperemesis became normal. We prepared that Amalaki machine in our ward and the patient was normal. Then Shadangodak in recurrent UTI in pregnancy. This is also one of the things which we all follow. In first trimester, UTI is very common. In the last trimester, urinary tract infection is very common because of, positioning of the bladder and all. Now, many times we give Cital, we give antibiotics, but still patient is symptomatic and sometimes the pus cells never go to 3 to 4. It remains 8 to 10, 12 to 15. Abundant ka aata hai 30 to 40. But sometimes it never goes beyond 18 to 15. Then what we used to do, we stop all antibiotics, even Cital. We shift that patient on Shadangodak. And we have prepared here a formulation which is contains Shadangodak only, but we named it as a Sujal. The name we have given as Sujal. And that Sujal powder we used to give to patient. And after giving 3 days, similarly, whatever Ayurvedic medicines we are supposed to prescribe, you have to follow the modern science protocol. Even if after giving antibiotics for urinary tract infections, after 4 days, we do urine routine microscopic or after 6 doses. Similarly, I apply same rule for my Sujal also, for my Shadangodak also, that after taking Shadangodak, or we call it as Sujal, it is Shadangodak, for 3 days, we repeat the sonography, urine routine microscopic after 3 days, and we find that whether that pus cells goes beyond 2 to 3 or not. Correct? So whenever we all, even I, even if I am using Ayurvedic medicine or integrated medicine for the patient, I always bind myself for the investigation parameters what are decided by the modern science people. So that is very important. Okay, next. Now, what potential Ayurveda have? Actually, I have modified the slide, but old slide I will cover my points regarding the potentials here. So what are the potentials? In our hospital, where you might know, might not know, but many people knows that in which, scenario we are working, we are having Ayurveda hospital where there is a 800-bedded hospital near to my hospital and 12-floored building near to my hospital. But still in our hospital, around 80 to 100, 150 delivery we are conducting. So we are having a lot of challenge. So how to treat the patient? So there is one case, that is missed here, that we are giving Amagarbha Basti for the treatment of intrauterine growth retardation. And when modern science people, their guiding department, when our patient goes there, they used to ask him, ma'am, what you are doing there? Why the patients of intrauterine growth retardation are coming to your hospital? What you have? Whatever IV alamine we are giving, whatever oral we are giving, whatever Argipreg we are giving, what you have? Why patients are coming to you? And when patient goes back there, they used to say, "Nahi, hamara baby ka weight bahut acha tha." Then few years back they called me that, ma'am, what you are doing to treat the IUGR? Then I told them that, see, as a modern science people, you are using 2 routes of administration of proteins. And as an Ayurved gynecologist, I am using 3 routes. And Ayurved practitioner, I am using 3rd route of administration of protein. What is the 3rd route of administration of protein? That is per rectal administration of protein. And there are many researches supporting that per rectal epithelial has very good capacity of absorption of protein. If stomach is not good working for the absorption of protein, there are very research. Now they forgot that research. Their only research, but now we are using their research. So per rectal absorption of protein is very good compared to the stomach, compared to the IV. And we have a lot of patients on Amagarbha Basti here. Just few days back, I had a patient from Daund, near some 200-kilometer place from Pune, and that patient came to me, and what her husband told me, ma'am, तुम्ही अंड्याचं काहीतरी करता ना बाळाचं वजन वाढवायला, 23 weeks pregnancy, 6 AFI, severe IUGR and oligohydramnios, and we want त्या अंड्याची ट्रीटमेंट आम्हाला पाहिजे. You know, this is actually, I think this is credit for our hospital. And now we have started that. Let us hope. Even I have treated many patients with this. There was a patient her name was Daivale. That patient also we treated very well, and her fetal weight was, her IUGR started from 28 weeks of pregnancy. She went till 34 weeks of pregnancy, and the fetal weight was 2.3. Actually, this is achievement. So what we are doing, this is the potential of Ayurveda. We are not using our Granthokta reference in our day-to-day practice. So we should start using these, references in our day-to-day practice. Next. Now, what challenges we are facing? The immense challenge of this approach is that the effectiveness of treatment and hence its success might depend on the expertise of the medical professional. This is very important, very, very important. Uttarvasti given by gynecologist, Ayurvedic gynecologist, and Uttarvasti given by other person who is not gynecologist, you will get different results. You know how to approach cervix, you know to how much infant feeding should be put inside, what should be the position, how you are supposed to hold the cervix and everything. So Uttarvasti results when given by Ayurvedic gynecologist and Uttarvasti results when given by non-gynecologist, it will always differ. So it is very important that whatever practices are granted legally to you, those practices only should be practiced by you. I am not Panchakarma expert. I will not definitely give Panchakarma in my hospital. Definitely will not. If something happens, few days back there was a case in our hospital while giving Swedan, that patient died because of heart attack. If as a gynecologist I am performing this in my hospital, then it may have created a medico-legal problem. I am gynecologist and I am giving Panchakarma. That is absolutely wrong. Why you are doing specialization? So your specialization, so it is very important. The success might depend on the expertise of the medical professional. The last weakness of integrative therapy is a wide range of treatments, making it difficult to assess patient success. So we have to minimize it. We have to think that how we can minimize the treatment and how we can target the treatment, how we can target the patient, how we can target the complaints. And if you can concentrate on those target points, you will be a very, the patient will get success. Next. The current acute healthcare model has not proven effective in dealing with prevention and management of chronic conditions. Now we have to come inside and we have to address all these things in chronic conditions. The objective is to increase therapeutic efficacy and efficiency while tailoring it to the patient's personal need. Next. And I will conclude my presentation that integrated approach means what? There are 3 points. Prevent harm, promote the positiveness, and manage the illness. So this is nothing but an integrative approach. Last. Next. Now these are few references from where I have prepared my PPT. Yes, thank you. Next. Thank you. And if you have any questions, you can ask.
Thank you very much, madam. Madam has highlighted.
If time permits, I would like to show few case papers, if time permits. Otherwise, it is okay.
Excuse me, madam.
Excuse me, madam. Time is limited, please.
Okay, no problem.
Please.
Yes, it's okay, ma'am.
Yeah.
Anyone can call me anytime and you can ask me the question, the papers, how we are treating the paper. That is also not the problem. Yeah. Yes, thank you.
Thank you so much, madam, for sharing such a wonderful and knowledgeable session with us. Madam has highlighted government grants and funds of research and also shared many useful clinical experiences. This session will definitely enhance practical integrated approach for both faculties and students also. Thank you, ma'am. Now, I would like to request our chairperson, Dr. Neeta Maisekar, madam, to please share her views about this session.
Namaskar, good afternoon. Just give me a minute, please. Just a minute.
Okay, ma'am.
So good afternoon. I should be congratulating the organizers. It's so a happy moment to see my friend present there so dynamically, Dr. Swati Mohite. I'm thankful to Jalgaon GAC, Dr. Khoth madam and her team. I will not take your time by mentioning each and everyone. I have another meeting now, but definitely I'm sorry I could join only. There was some issue here and I could join when Dr. Swati was mentioning about Gokshura Ghritam. Before that, I think I will not be able to comment, but definitely I would like to say I'm so happy that Ayurveda goes through some stalwarts like my friend there doing all so many good things, which we all have been practicing in practice too, but mentioning in such a rightful manner, and that's a hats off to her. So here, all these days we were all Ayush ke achhe din to zarur aa gaye. We should be thankful to our Prime Minister there and Ayush Ministry for this, what I should say, status of Ayurveda, what we have got. It is the other way around now. We all have been, I see Seema Madam, Namaskar, senior person there. And so that is how I should mention this, that we have been using this. It is the other way around now. The days have come when people ask evidence-based thing. Do we need evidence? Ours is Apta Bachan. We are already validated. We are validated. It's about to show it to the world what she has done in Amagarbha process, the way she has tried the protein. Okay, so I would like to share that I'm in love with Ghritam, and this attribute goes to my guru, Subramanyam Shastri Garu from Hyderabad. When we used to be in PG first year, I would like to share this anecdote, where he wrote a book on Triphala Ghrit. So in those days, hum bolte the, "Arey kya hota hai? Is Ghrit se kya hoga?" So he would all try in neurological cases. He had a 100-page book which he insisted for us to read. Then, sir, what happens with this? What they give so much B complex, oil-based injections. So he would say the myelin sheath growth, the rejuvenator factor is Triphala. Ayurveda क्लिष्ट है, Ayurveda easy है. मैं हर एक लेक्चर में बोलती हूँ, क्योंकि त्रिफला देने से मोशन तो हो जाएगा, आधा काम ठीक हो जाता है, अग्नि आम मल स्रोतस, अपान वायु निकल जाएगा तो क्लियर हो जाएगा. लेकिन जब घृत का उसको साथ मिलता है, तब घृत always improves, the lipids are there in all hormones, and this will improve the nervous system. और हमारे पास कितना इजी भाषा में कहा, वायु के 20 जो गुण द्रव्य गुण में हम पढ़ते हैं, पदार्थ विज्ञान में पढ़ते हैं कि 20 गुण के ऑपोजिट चिकित्सा हो जाए. वायु रुक्ष है, उसके ऑपोजिट स्निग्ध उसको मिल जाए साथ. तो त्रिफला घृत acts well, best used to say. The same thing she did here. And here I would like to say, let the world understand labhopayo hi shastanam, because rasastanyam tato artam. We know कि रस धातु को ही इंप्रूव करना है. लघु मालिनी ले लीजिए, घृत ले लीजिए, गोक्षुर ले लीजिए, जो भी है रस धातु. अब गोक्षुर का उनके हिसाब से देखने की जगह, what I feel in PIH, clade is more. We all know that 4th, 5th month, what she has mentioned, Prishniparni and Gokshur should be used there. Second trimester, when the weight increases, there is immense pressure on the inferior vena cava, and there is edema starts. Alpa Shofa is normal, but the edema starts when the metabolites clog. And this clade has to be cleared from the Shrotas through Gokshura only, because Gokshur is Vatavaha Nadi Balyakar. Let them learn into our language. It enhances the ability of the nervous system to throw out. The system becomes weak because the mother has two things to adjust, and that is how the nervous system has some pressure to throw out the clay, even if it is cleared. So that throwing out Vatavaha, because Rasayan में आम्लकी बताया गया है, शिलाजीत है, विडंग है, गोक्षुर है, कृष्णपर्णी है, बला है, लेकिन हमने गोक्षुर को ही क्यों यूज किया? क्योंकि उनको ये पता है कि यहाँ पर क्लेद हरण चाहिए. So that is what I want to add. And as she said, शतावरी हाईएस्ट मात्रा में, हम सभी को पता है कि प्रोजेस्ट्रोजेनिक इफेक्ट की वजह से रिलैक्सेशन होता है प्रेगनेंसी में, देयरफॉर कॉन्स्टिपेशन तो होना ही है. पर शतावरी का एक्सट्रैक्ट नहीं बताया उस जमाने में भी, वहां पर भी अर्क बनते थे, लेकिन क्यों नहीं बताया? फाइबर जाना जरूरी है ना शरीर में. शतावरी यष्टि मधु में एम्पल अमाउंट ऑफ फाइबर है, और वह फाइबर अंदर जाएगा तो क्लेद वहन और वातवह नाड़ी को, दोनों ही रसायन है, यष्टि मधु और शतावरी, तो फाइबर मिलेगा तो अपने आप से मोशन फ्री रहेगा, और नथिंग लाइक दैट. Then if you see injection Prolapse depot, it is all sticky, oily, oil based, hormone based. Same thing we are giving in Ghrutam, which is easy to digest, which is Medhya. Medhya is replication of the gene expression. So that is how it helps. My another favorite drug what she has mentioned is Laghu Malini Vasant. Yes, ये रस धातु को शुद्ध करता है, तो अन्य धातु ठीक हो जाएगी, तो ओव्यूलेशन ठीक होगा ही होगा. Garbhapal ras, as Dr. Swati has mentioned, Garbhapal cannot be given to all cases, as she has said. Okay, judicious use of Garbhapal ras is definitely given. जैसे रज प्रवर्तिनी, मेंसेस नहीं आ रहा, तुरंत रज प्रवर्तिनी दे देंगे, सभी को नहीं होगा. वहां आपको यदि न्यूट्रिशनल फैक्टर है, एनीमिक फैक्टर है, ये सब एड्रेस करना होगा. तो हार्मोनल फैक्टर जहां है, तो इस प्रकार से गर्भपाल रस जुडिशियसली जहां यूज करना है वही. और नेक्स्ट इज मासानुमासिक काढ़ा. तो हमारा हमेशा डिबेट चलता था, हर किसी को गर्भिणी होते ही देना जरूरी है कि नॉट एट ऑल. वहां पर क्लियरली सुश्रुत संहिता में मेंशन किया है कब देना है और किसको देना है. तो अभी जैसे इन्होंने मेंशन किया है कि सब कोरियानिक ब्लीड जब देखते हो आप, या पास्ट हिस्ट्री रही होगी कि जहां there is a separation due to nutritional, there are many factors, whatever that is to be decided. Then GDM factor, that was news to me, very thankful to Swati madam. I will also try hereafter. I'm happy to know that the dosage already you have decided 3 grams, hereafter I'll be trying. So when earlier wherever I worked, I used to stop lebetalol and I used to put पेशेंट्स ऑन पीआईएच का एक काढ़ा बना लिया था. जैसे आपने बहुत अच्छे से षडंगोदक बोला है, हमने षडंगोदक में और 2 ड्रग्स डाल दिए थे, सारीवा, बिकॉज धातुगत क्लेद वो हरण करता है, इस कारण हमने सारीवा भी डाल दिया था वहां पर, सुंठी भी, वही तो षडंगोदक में है ही. मुस्ता इज ऑल्सो अनदर इम्पोर्टेंट ड्रग जो हम यूज करते थे उसमें, और उसमें यष्टि शतावरी ये भी डाल देते हैं पीआईएच. देन पीपल से दोज हु डू इंटीग्रेटेड प्रैक्टिस, you cannot undermine anyone. Mind you friends, I respect everyone, so this is justified. When you feel humiliated, then you get one foot back and say, नहीं हमको ये समझा जाएगा कि she doesn't know. So that was the fact I faced, कि she doesn't know how to use labetalol, that is how she is putting on the kada. Got it? But no, I was undeterred by the sentences. I continued with and my PGs are praman. To this Yukti Praman that I would write down then later to stop this gossip, labetalol SOS. But we would give this kada, and definitely we serve to many PIH cases. We stop PIH rather initially if we start. So that was wonderful about Sujal. क्या नाम दिया है स्वाति जी ने. Then IUGR का जो है, that is really very, very fantastic. Absorption, as she says, per rectum, the rectal plexus are rich in arterial. 60 ml of oil you give orally, lipid, any lipid for that matter. The patient ka agni important hai hamare liye. Agni, when it is not digesting, the root is rectum. and that is how यथा पिंडे तथा ब्रह्मांडे जो हम बोलते हैं. You see the birds. ग्रीस में एक बड़ा बर्ड का है कि जहां वो अपने आप से सैंधव लवण लेकर के बस्ती करता है खुद को. So that is another thing. Uttar Basti, yes, I agree to her words that a gynecologist and non-gynecologist. I'll tell you how. Everybody is a BMS. Those who have developed the taste for this, yes, they can do it. But mostly what happens in Uttar Basti, the Prakruti, everybody would like to say Phala Sarpi in Vandhyatva. ऐसा नहीं है. वंध्यत्व वहां किस कारण से है? पित्त प्रकृति है, अधिक वात है. तो आपको कभी यष्टि मधु यूज करना है, कभी दाड़ीमादी घृत यूज करना है, कभी कैर तेलम यूज करना है, यष्टि मधु का घृत नहीं करना है, तो कभी फलसर्पी करना है. तो जो भी है आपकी चॉइस इस प्रकार से. आई थिंक आई एम एक्सीडिंग टाइम. Thank you so much for that chance and interacting and to see all lovely gynecologists of today. Thank you so much.
Thank you, ma'am.
I will request all the chairpersons to be very brief because we are running short of time. Excuse me for these comments, but
yes,
we will have to end up a little quickly. Thank you.
Right. Right. Thank you so much.
Thank you so much.
Yes,
Now I request our next chairperson, Dr. Suhas Herlekar sir, to please share his views on this session.
Dr. Suhas. Okay.
तर तुम्हाला अनम्यूट करा.
केलं. काय स्लाइड कोणाच्या वेगळ्या झाल्यात? Hello. So due to short of time, I will summarize the session basically. As per the, I first of all thank you. Am I audible?
Yes, sir, audible.
Yes, sir, audible.
Yes, okay. So good afternoon, and outset I am thankful to the organizers for giving me this opportunity, and also congratulate the Swati for giving a nice presentation on the approach to the integrated approach to the pregnancy. I will summarize something because some points, all the points are covered by the Swati. Antenatal care needs integrated approach. Not a single path is sufficient to have a good fetal outcome and less maternal mortality. As per the modern medicine, consider inclusion of modern technology and medicines, we are really able to make mortality rate less. Nowadays, there is one more faculty introduced in the care of the mother and the fetus, that is a fetal medicine, due to which we are able to diagnose the fetal genetic and structural anomaly in antenatal period with the help of markers and advanced sonography techniques. We also correct some structural anomalies in the antenatal period. Also, we also diagnose the pregnancy-induced diseases like PIH in early stage of pregnancy and treat accordingly and able to minimize the maternal mortality rate. Garbha Sanskar, antenatal exercise, Ayurvedic Masonwa management enhances the health of the pregnancy. So friends, use all the modalities and the pathies to care the pregnancy period and terminate in a natural birth. Good antenatal care is good fetal outcome, less maternal mortality. Thank you. Thank you for the organizers.
Thank you, sir.
Thank you, sir. Now I request our next chairperson, Dr. Seema Mehre madam, to please say few words on this session. Dr. Seema Mehre madam, please unmute yourself.
Okay, thank you. Thank you very much. Because of lack of time, I will not take up. I just congratulate everyone. And nice seeing you on this platform, madam, Mohite madam. We have met a long time back. And just I will mention one point which I liked in ma'am's lecture. I'm sure even the students will enjoy that. That Anupagata, the thing which is mentioned in Garbhini Uddishta, madam has just said it in another way, that is uneventful. Then there are so many other things which I will not repeat because of lack of time. But the only thing is, thank you GAC Jalgaon, Bhageshri Khot ma'am, and the organizers for this wonderful webinar. And hote khara खूप सारे points, but they were mostly covered by Herlekar sir and Maisekar ma'am. So Tripura Growth and Now my sir also mentioned fetal medicine. So anorectal route of protein. So many things. I actually have taken out a note, but it's okay. Congratulations once again, and thank you, ma'am, so much.
Thank you, ma'am.
Thank you, madam. Now I would like to request our next chairperson, Dr. Anita Bombarde, madam, to please say a few words about this section. Dr. Anita Bombarde, madam, please unmute yourself.
Hello, thank you, madam. Good afternoon, everyone. वेळेचं बंधन असल्यामुळे मी काही जास्त बोलत नाही, पण स्वाती मॅडमचं लेक्चर खूप छान होतं. इन्फॉर्मेशन होतं छान आणि इन्साइट पण होतं. आय एम डीपली हॉनर्ड टू बी here today as the chairperson for the important discussion on the Ayurvedic integrated approach in pregnancy. I hope you found our guest speaker presentation is the integrated approach in pregnancy informative and insight. Our guest speaker delivered a nice presentation, has highlighted key aspects in pregnancy care, including personalized diet and nutrition, lifestyle practice, herbal remedies, prenatal care. In conclusion, I would like to express my gratitude our guest speaker, their invaluable contribution, and to all of you for your active participation in the discussion. Together, we can contribute to explore and promote the Ayurvedic integrated approach in pregnancy. Ultimate result, a healthy and happier pregnancy of women around the world. Thank you. Specially thanks Director of Aush sir, Dean Dr. Ahere sir, Jalgaon, and specially thank both madam and Solanki sir and Swati madam, Nita madam, and Mehere madam. Thank you very much.
Thank you. Thank you all.
Thank you, everyone, and thank you, madam. Now I invite Dr. Sana Sheikh to please conduct next session. Thank you.
Sorry. Share करो. Selected है sir. पहले share जा रहा है. Hello. Hello. Dr. Solanki sir, am I audible, sir?
Yeah, Dr. Amar, you are audible and visible, and we are about to begin the session. Dr. Sana is taking the session forward.
One thing I would like to request, I could not scroll the slides. Maybe they have not given the command like co-host or something like. Slides are visible. I cannot move to the next slide because they have not given the permission. Post contact.
Yeah, okay, Dr. Dr. Amar, once you start talking about it, my technical team says that we will scroll for you.
Okay.
It will be all right. So, Dr. Sana here.
Now we have a next speaker, Dr. Amar Prakash Dwivedi sir, for the session. Along with we have a chairperson, Dr. Ukhadkar sir. He is a professor and head of the department in the Department of Shalyatantra at RA Medical College, Worli, Mumbai. He is an executive MBA graduate from Karnataka State Open University and is also O-level computer literate. Dr. Ukhadkar has over 20 research papers published in international journals to his credit. He was an ex-chairman of Shalyatantra and allied board at MUHS Nashik from 2017 to 2022. Also, he was a member of Board of Examination from 2012 to 2017. He was also the principal investigator in clinical trials allotted by the Ayush director in Maharashtra state. Dr. Ukhadkar has authored more than 6 books and textbooks, and currently he is a member of D.Y. Patil University Board of Study. Next, we have Dr. Seema Giri Madam. She is an associate professor and head of the department of Shalyatantra at Government Ayurved College, Osmanabad. Next, we have Dr. Vidya Jangle Madam. She is an assistant professor in the department of Shalyatantra at R.A. Podar Medical College in Worli, Mumbai. Next, we have chairperson Dr. Girish Daga sir. He has completed his fellowship in proctology from MUHS Nashik and has been practicing as a proctologist at Daga Piles Hospital in Sambhajinagar for the last 22 years. He is a renowned and experienced proctologist who is actively associated with various organizations such as NIMA and the Proctology Association. So in this session, we have Dr. Amar Prakash Dwivedi sir. He completed his undergraduate and postgraduate studies at R.A. Podar Medical College, Worli, Mumbai. He is a professor and head of the department of Shalyatantra, as well as vice principal at Dr. D.Y. Patil School of Ayurveda in Nerul, New Bombay, Mumbai. He holds a PhD and his novel drug delivery system for Shar Sutra has been awarded a patent by the Government of India. He has numerous research papers published to his credit and is a renowned practicing surgeon in Thane. He has been invited as a guest speaker at various national and international events and has participated as a panelist and Ayurveda expert at reputed organizations. Now he will educate us on the preventive aspect of anorectal diseases. So I would like to invite Dr. Amar Prakash sir for his presentation.
Om Dhanvantare Namah. Tasmai Sri Guruve Namah. Om Namo Venkateshaya. I am very much thankful to the organizing committee of Government Ayurved College, Jalgaon, Maharashtra, for inviting me in this international webinar, SOUSHRUTI-2023. And as per the communication and the email, I have been given this topic, integrative approach in anorectal disease, but I will definitely cover the preventive aspect also. So with the blessings of my teachers, one of them is here, Dr. Solanki sir and Dr. Ukhalkar sir. I would like to continue with my presentation, sir, with your kind permission. Let me know if I can move to the next slide, because here it is not possible.
Just try to move it.
Screen is visible, I guess. Na,
yeah,
sir?
Your first slide is visible, Dr. Amar, but it's not moving. You maximize the screen.
Yes, it is in the slideshow mode only.
Slideshow mode. इकडे येतात दोन्हीपैकी एक तुम्ही काय बोलताय ते येऊन सांगा.
In fact, you can operate from there also. I have shared the PPT.
तुम्हाला PPT आलाय? काय करू, स्लाइड शो बंद करून चालू करायला लावू त्यांना? You stop sharing the screen, Dr. Amar. They are sharing now.
Yes, sir. Sharing, stop sharing.
They are trying to operate. Meanwhile, as Dr. Amar, you mentioned It's really a pleasure because we form a good forum, like experienced and much senior person like Dr. Ukhalkar, Dr. Girish Daga, myself, Dr. Amar, you two are there. So it's a really pleasure having this presentation. So yeah, we are sharing the screen. Let's go ahead.
Yes, yes, we'll continue because we are already constraints of time. So I have been given intimation that I need to conclude within 30-35 minutes. I will try my best so that I'll cover most of the anorectal conditions with the integrated management. Next slide, please.
Limited over and maximum.
Yes, yes, yes. So in this slide, there are various conditions mentioned. Am I audible, sir? Clear?
Audible, visible.
Thank you, sir. Thank you. So here I would be focusing on hemorrhoids, anal fissure, abscess, anal fistula, penile sinus, rectal prolapse, and anal cancer. These diseases we will be discussed in brief, and the integrative management will be discussed. Next slide. So for the orientation purpose, we should know about the basics of proctology anatomy. We all know that rectum and anal canal are the last part of the GI tract, and out of them, rectum is the proximal part of around 14 centimeter, and distally the anal canal is around 4 centimeter. Most important applied part is about this dentate line, which is an imaginary line of the mucosal folds. And significance of this line, we all know that anything above the dentate line is less sensitive, and that part is lined by columnar epithelium, whereas the structure, the pathology beyond this, below the anal canal, are highly sensitive due to somatic nerve supply, and the anatomically it is lined by the modified squamous epithelium. Next slide. So this is also very important part in perspective of hemorrhoid. We should know about the hemorrhoidal plexus, which is a physiological structure of large vascular spaces and arteriovenous shunts. I mean, both the rectal artery and veins and the arteriovenous communicating capillaries all together, they are called as corpus cavernosum recti, CCR, and they are located above the dentate line. We all know about two groups of hemorrhoidal plexus. One is internal hemorrhoidal plexus and external hemorrhoidal plexus. So the external and external hemorrhoid are, named as per the origination. If they are originated from the internal hemorrhoidal plexus, they are called internal hemorrhoids. About the blood supply, we all know that this SRA, that is superior rectal artery, contributes exclusively to this hemorrhoidal plexus, and along with the middle and inferior rectal artery. If you see the landmark or the surface anatomy, the position of these vessels are at 3, 7, and 11, that is left lateral, right posterior, and right anterior, and that is why we see the primary hemorrhoids at these located places. Next slide. We will start with the first and major disease of anorectal area, and that is hemorrhoid. Next. We all know about the definition. Here in this slide, I have placed two images you can see. One is the diagrammatic presentation, which is showing internal and external hemorrhoid. That is purely diagrammatic. The other side is just to make understand what type of pathogenesis takes place. This is the image of an varicose vein patient. So similar pathology, if it happens in the anal canal, here it is covered with the mucosal folds, and that is called as hemorrhoid. That is just for understanding purpose. Definition, we all know. When we were studying in 90s, that time the textbook was defining hemorrhoid as the dilatation and protrusion of hemorrhoidal veins is called hemorrhoid. But now with the advancement with the anatomy and the histopathological studies, now they have described hemorrhoid as masses or clumps of tissues within the anal canal, which contains blood vessels and surrounding supportive tissue. And the similar thing, the definition is mentioned in Ayurvedic text. We correlate with Arsha, and while describing the samprapti of Arsha, Sushruta says that if an unself-possessed person indulges into continuous unsalutary lifestyle and food habit, then in his constituent, there will be vitiation of Vata, which will make vitiate the Agni. Then after Agni Dusti takes place, the other these dhatus, Rakta and Mouns, they will be vitiated. They will locate into the anal canal. Especially they will be involving the Pradhana Dhamni. This word is very important. This you can correlate with superior rectal artery and hemorrhoidal plexus. That part is vitiated, and then their functions are disturbed, and thereafter there will be a swelling or protrusion, and for that condition Sushruta has named as Arsha. Next. This is about the pathogenesis. We all know that it is basically dilatation of CCR, and the causes are either defect in the regulation of arteriovenous shunts, increase in the arterial blood flow, or decrease in the venous drainage. So these are the three main factors which result into the dilatation of CCR. Prevalence rate, if we see, around 30 to 50% of the population suffers from this condition. Because of the erect posture, the human beings are having this hemorrhoid. If you see the gender ratio, male are more prone to get hemorrhoid than female, and the ratio is 2:1. Next. These are the etiological factor. We can skip this slide. We all know that the basic thing you have to remember is that any factor, any activity or diet factor, anything which increases the intra-abdominal pressure will result into the portal hypertension. Then there will be overfilling of the hemorrhoidal vessels or overfilling of the hemorrhoidal plexus, which will result into congestion. And then if longer time this pathology continues, then there will be dilatation of that anal cushion. So this thing we have to remember, that increase in the intra-abdominal pressure due to straining or weightlifting or coughing or effortfully micturating, all that thing causes overfilling of the hemorrhoidal vessels, resulting into hemorrhoid formation. If we see the degree of the piles, we all are well aware 4 stages of piles. In grade 1 there will be there will be no obvious pedicle seen, but there will be spontaneous bleeding. Grade 2 will be the prolapse will spontaneously reduce. The patient will say that he notices some mass-like growth coming out during defecation, and that growth reduces by itself. That is grade 2. Grade 3 requires manual reduction, and grade 4 is the true prolapse, which is irreducible. Next. External hemorrhoid clinical manifestations, very easy to understand, as it is because of the bleeding or damage of the arteriovenous shunts. The patient will present with perianal hematoma like condition with severe with the history of severe straining while defecation, and there will be bleeding PR, and the onset will be sudden. So that is external hemorrhoid, and it originates or takes place below the dentate line. Whereas internal hemorrhoid, again, it may be spontaneous, painless bleeding, because as we have discussed, the structure above the dentate line are less sensitive, so there will be less pain compared to external hemorrhoid, and the protrusion can be noted down as per the degree of the prolapse or stage of the hemorrhoid. Next. Clinical manifestation we have discussed. Coming to the palliative management of external hemorrhoid. First, as we have seen that external hemorrhoid, the presentation is very much similar to perianal hematoma. So accordingly, we give treatment like analgesic, anti-inflammatory, local anesthetic agent for pain relieving. Then the sitz bath is advocated, and certain laxatives are given. Most of the perianal hematoma acute cases resolve with this line of treatment, but if it is not resolved, then that bleeding will turn into a clot or fibrosis, and that clot is to be surgically removed by taking small niche on the perianal hematoma, and the wound thereafter heals on its own. Next. This is about the internal hemorrhoid. We all know that in grade 1 and grade 2, most important is educating patient to have good fiber rich diet, balance, easy to digest diet. That is very important, and he should have a healthy lifestyle as well. But if the symptoms do not resolve with the conservative management or dietary modification, then there are certain office-going procedures or minimally invasive procedures that we will see in the next slide. And for the local treatment and for palliative treatment in modern medicine, they are having wonderful preparations like derivative of flavonoids. The brand name available is Deflon, which is having anti-inflammatory, and it inhibits the vascular damage that is happening at the level of arteriovenous shunts. Then they have got a very good combination under the name of troxyrutin and calcium dobesilate, which increases the strength of the blood capillaries. So these are the palliative treatment for internal hemorrhoid. Next. So at the gross, we can categorize the management of internal hemorrhoid into surgical and non-surgical management. In non-surgical management, there are office-going procedures like sclerotherapy, rubber band ligation, infrared coagulation, laser treatment, and hemorrhoidal artery ligation. All these management part comes under office-going procedure or daycare procedure, whereas the other category is the purely surgical intervention under the name of hemorrhoidectomy. Next. These are the principles of treatment of minimally invasive procedures. We should know that sclerotherapy, we inject the sclerosant into the submucosa, which decreases the vascularity and increases the fibrosis, which fixes the mucosa to the muscle, and it prevents the prolapse. That we should know. Infrared coagulation, what you are going to achieve is it coagulates the tissue protein, and then it causes actually burn to the submucosa, which evokes inflammatory reaction and fibrosis. Laser procedure nowadays very much popular in patients also, and in the society. Even the doctors are going for this. And what is done in laser treatment is it is also an heat therapy only. The laser beams are put on the hemorrhoidal plexus, and the arterial flow feeding the hemorrhoidal plexus is stopped. So whatever vascular congestion was there, overfilling was there in the superior rectal because of superior rectal artery, that we are going to obliterate with the help of Doppler guided laser coagulation. Rubber band ligation, we all know that it actually strangulates the pile pedicle, and this is followed by the sloughing of the pile pedicle. Next. Well, the surgical treatment, as we have discussed, the name of the procedure is hemorrhoidal tissue excision. Actually, we do the transfixation of hemorrhoidal pile pedicle, and after that, we excise the component of hemorrhoid. It is again of two types, open hemorrhoidectomy and closed hemorrhoidectomy. It is still a choice of treatment in conventional surgery. Next. Then there is advancement in next. There is advancement in this hemorrhoidectomy with the MIPH, that is minimally invasive procedure for hemorrhoid. We also call it as a stapled anupexis. This is, partly transfixation of the ligation of the circumferential vessels, followed by the resection of the improper prolapse mucosa. That part is known as stapled anupexis, which is very much popular. Next. Coming to Ayurvedic management of Arsha now. We all know Sushruta has given fourfold therapy: Aushadhi Chikitsa, Kshara Karma, Agni Karma, and Shastra Karma. Aushadhi Chikitsa we'll discuss in the next slide. Kshara Karma, we all know it is, Kshara Karma is something. Pratisarnik Kshar means Kshara in the form of paste when it is applied in the mucosa, that is called Kshara Karma, and wonderful description of this Kshara Karma is mentioned in Sushrut Samhita. Agni Karma is, giving heat burn therapy. Now here, practically we can correlate Kshara Karma with sclerotherapy, because the principle is same, whereas Agni Karma can be correlated with this laser technique or the infrared coagulation. The principles are same and the outcome will also be same. Shastra Karma is very important part mentioned in Sushrut Samhita. The Shastra Karma description, what we get into Sushrut Samhita, is exactly same as what the modern people are doing into conventional hemorrhoidectomy. So I would definitely say that the modern people have taken the procedure technique from the Ayurvedic text. Next. Coming to the conservative line of treatment, here the medicine comes second. You should understand the principles of treatment. You need to select one drug from Dipan and Pachan category. One Vatanulomak drug should be taken, one Malasarak drug, one Raktastambhak drug if bleeding is more, and there are certain local preparations. So accordingly, as per the availability and as per the prakriti of patient and the exact clinical manifestation, you can select any of these drugs: Dipan Pachan, Vatanuloman, Malasarak, Raktastambhan, and local preparations, which will be definitely helpful in the management of grade 1 and grade 2 hemorrhoid, and even early grade 3 also. Then Sushruta has specially mentioned certain kalpas like Suran Pindi, Kankayan Vati, Arsha Kuthar Ras. These are practiced by our anorectal practitioners. Sushruta has also mentioned certain local pest like Snuhi Haridra paste can be applied tropically, or this Kashi Sadi Taila, Pippali Tail. These are having good results in grade 1 to grade 3 internal hemorrhoid. Next. Shara Karma piles we have already discussed. It has been wonderfully described in Ayurvedic text, and people are using it more in South India. They are using Shara Karma for internal hemorrhoid grade 3, and procedure we all know that this paste is applied over the mucosa, then it is cleansed with the help of lime water, and then after cleaning the this lime water actually neutralizes the alkaline effect of Shara, and thereafter Yasti Madhu Ghrit is again applied over the anal canal. So this is how Shara Karma is done. Again, I would say this action principle is very much similar to sclerotherapy. Thank you. Next slide. Next slide. Coming to the next and very common and very painful condition in anorectal disease, that is fissure in ano. Next slide. We know what fissure in ano is. It is simply a crack or ulcer or longitudinal crack in the anal canal, lower anal canal. And cardinal signs also, we know that patient will be in deep agony, deep pain. Patient will say that while passing stool, he is having severe burning pain, cutting pain, or the pain is very sharp, and it's actually the patient fears to go for defecation because of this pain, and there will be severe sphincter spasm as well. So that is the clinical manifestation. Next slide. Fissure, again, chronic. We can differentiate between acute fissure, which has got onset up to 6 weeks, and after 6 weeks, definitely there will be small tag formation externally, and then it is considered as chronic fissure. There are classical triad for chronic fissure: presence of anal papilla, presence of wound or ulcer, along with sentinel tag. All these 3 symptoms, if you see in a patient, it is labeled as chronic fissure. Here, gender-wise ratio, if you see, it is more common in female than men. Location-wise, most of the fissures are seen at 6 o'clock posterior, but we are, getting patient having fissure on anterior aspect also. Mostly in females, it is seen on anterior side. The most important part you should understand as a practitioner, that if you find fissures other than these conventional locations, like other than 6 and 12 o'clock, if you see multiple fissures, then you should always think about some underlying pathologies such as Crohn's disease, ulcerative colitis, tuberculosis, HIV, malignancy, diabetes, and leprosy. Next slide. Etiological factors, anatomical cause, we all know it is the part is having poor musculature, and acute angulation also causes ulceration in the anal area. Then trauma can be a cause, anal infection can be a cause, constipation can be a cause. And then secondary causes, we all know, as we have already discussed, that there are certain underlying pathologies which may result into fissure. Next slide. Management of fissure, again, non-surgical management and surgical management. In non-surgical management, you have to encourage patient to have more fiber diet. He must take some stool softeners, generous water intake, and sitz bath, and local application of certain good drugs. There are beautiful drugs, nitroglycerin ointment is available, which causes neurogenic relaxation of the internal sphincter. Then nifedipine, we all know it is a vasodilator used in cardiac condition. Both the dilatism, nitroglycerin, and nifedipine, they are used in cardiac pathologies also. Here it is prepared for local ointment in management of fissure. The nifedipine causes mechanical contraction of the muscle. It reduces the mechanical contraction, so there will be sphincter relaxation. And then there is a wonderful drug under name Botox. Botox is botulinum toxide. This actually causes chemical sphincterolysis, so the sphincter will be released. So these are the drugs used in management of fissure. But if my clinical experience is the fissure is chronic and it is having external tag as well as an anal papilla, and the ulcer bed is fibrosed, then it do not heal completely, and there will be definite recurrence of symptoms. So in those cases, we can opt for surgical treatment, and the most effective treatment surgical procedure is lateral internal sphincterectomy, which causes we divides the internal sphincter very close to anus, and which ultimately releases the sphincter, and then it increases the blood circulation to the anal fissure, and which helps in healing of the wound also, and pain is immediately relieved as soon as we do lateral sphincterectomy. Next slide. Similar condition in Ayurveda, we can correlate with Parikartika. We all know that Parikartika is not mentioned as a separate disease in Sushrut or any Brihattare, but we get detailed description about this condition in Kashyap Samhita in Garbhini Vyapat chapter. Here you have to understand that Parikartika in Sushrut he has mentioned as Basti Netra Vyapat, where generally we see, the person who are indulged into unsalutary lifestyle. Again, the causes are very much similar to that of Arsha. The unsalutary lifestyle, food habits, no adhyasan, then, vega dharan, or what we say suppression of urge leading to constipation, ratri jagran, divasap, all these things, vitiate the doshas, ultimately vitiate the agni. Then there will be constipation, and followed by the ulceration in the anal canal. There are certain conditions which are called as upadra, which may result into fissure, like jwara vyapat, vata jatisar again can cause to parikartika, garbhini vyapat, basti netra vyapat can result into, and then vaman virechan vyapat. So all these conditions, clinically I see that patient who are taking steroids, NSAIDs, antibiotics, that also vitiate agni. So Ushna Tikshna Aushad concept is there. So these things also vitiate agni, and which result into constipation and leading to fissure formation. Next slide. Conservative management of fissure. Again, the line of principle of treatment is very much similar to Arsha. We need to give Deepan Pachan drug, Vatanulomak, then we can give Malasarak Chikitsa. Again, specifically in my practice, I have seen that if we give Yasti Madhu Tel Matra Basti or Yasti Madhu Ghrita local application, it helps in subacute condition, up to subacute condition, definitely this is very effective, the Matra Basti with Yasti Madhu oil. There are other preparations also like Shatadhauta Grit or Yavadi Grut or Rakta Chandan Siddha Grut. These preparations are having, they promote the wound healing as well, and they relieve the burning pain also. So these things can be definitely practiced along with the internal medication. Next is about role of Shara in fissure. I do not recommend, because I don't believe that this is a good treatment using Shara in fissure. But in India, there are few proctologists, they are applying Shara in the fissure bed also. I have seen cases where they are actually ligating Shara Sutra from the posterior aspect of fissure, and they ligate, they say that this Shara Sutra will cut through and ultimately sphincter will be released, and the non-healing ulcer will also get healed because of the sloughing of the granulation tissue. But I don't practice, or I will not recommend use of Shara in fissure management. Next slide. Coming to the next condition, anorectal abscess. Next. There are different types of anorectal abscesses like ischiorectal, perianal, intersphincteric, supralevator abscesses. Sign and symptoms, we all know about the Vranashot and Vidradi. There will be pain, fever, swelling, tenderness, and induration in the perianal region. Next. Management, the classical management, if the patient is coming with the Rippen stage or when abscess is completely formed, in that case, there is no use of any medicine. You can directly go for incision and drainage, where specific cruciate incision is taken and the flaps are cut through. So there will be, this is done for promoting healing from bottom to top. And while doing this, you break the pus pockets inside and complete pus is drained out, and that it requires vigorous dressing, and the wound heals in due course of time. But most of the perianal abscesses, they result into complication which is known as fistula in Ayurvedic perspective. Again, you can treat this condition as Vranashot, Pakwa Vranashot. Again, Patan Karma is done. But then there is one option with the Ayurvedic people, they can do minimally invasive Patan Karma, means minimally invasive incision and drainage with the help of certain medicated paste, which is mentioned in the slide, Vatapatradi lep or simple Daru Haridra lep, or Daru Haridra plus onion mixed paste you can done, and this lepa will help in getting the abscess burst on its own, and the pus will be drained. So this is the line of treatment for wound healing. Definitely there are wonderful options in Ayurveda like Panchavalkal, then Triphala, Yashtimadhu Kwat, these, or Yashtimadhu oil, Jatyadi Tel. These things can be used for healing of the post-drainage abscess. Next condition, as we have discussed, it is mostly linked with abscess. So the fistula in next. We know the definition. We will not go into detail. Fistula in we all know it is an abnormal tract having two openings, external opening in the perianal skin and internal opening in the crypts at the anal canal. So that is how fistula is described in modern science. Next. Ayurvedic concepts and pathogenesis is little bit different. Sushruta says that a person indulging into unsalutary lifestyle and food habits, his vata get aggravated, localized in the anal canal, it vitiates the local mausa and rakta dhatu, giving rise to a boil, and if that boil is not treated properly, it will suppurate and burst and result into a discharging tract called as Bhagandar. Next. If you see, this is wonderful thing to share with you all, that we get a wonderful description, comprehensive description of Bhagandar in Charak Samhita also. Only thing is, there is no chapter like Bhagandar Chikitsa. In the chapter 12, Swayathu Chikitsa Adhyay, he has mentioned the complication of Ekanga Shof or the Vrana Shoth, and while describing that, Sushruta says that that abscess will turn into fistula. The reference is chapter 12. And then causes mentioned in Charak Samhita is like Krimi Bhakshan. Now, this Krimi Bhakshan can be correlated with any pyogenic infection, which is the common cause in the true fistula. Then he also mentioned the chances of trauma resulting into fistula. Then he has mentioned one of the causes as pravahan. Pravahan is the strainful frequent defecation. This can be correlated with colitis or IBS or dysentery or Crohn's disease. These people, you know, they are more prone to develop fistula. Next. This is very interesting. In Ashtanga Hridaya, other than these conventional etiological factor, Vagbhat has mentioned two distinct causes. One is maturing of sinful act of the previous life. We can say Purva Janma Krut Paap ke wajah se fistula hota hai. But I cannot, you know, there is no logic in Purva Janma Krut Paap, but we can consider those conditions as fistula of unknown origin. And there is another distinct cause mentioned in Vagbhat is abusing ascetics. Abusing ascetics is nothing but Guru Ninda. So, you know, when I take lecture, I always warn the student, if you are not attending the lecture, you are doing some mischievous, then if you insult your Guru, definitely you will develop the fistula in ano. And the reference is given by Vagbhat itself. Next slide. Modern causes, we all know, they have categorized into non-specific cause where it is due to cryptoglandular infection, complication of anorectal abscess, or previous pyogenic infection. So if fistula is formed because of any of these non-specific causes, they are considered as true fistula. Whereas if the cause is other than this, they are specific, like tuberculosis, ulcerative colitis, Crohn's disease, cancer, foreign body intrusion, or, you know, patient with other pelvic inflammatory conditions or obstetrical operations or something. So all they are considered as the secondary fistula. Next. Classification, we will not go into detail. We all know Milligan-Morgan, which is based on the, you know, structure, subcutaneous, submucosal, low anal, high anal, and anorectal. Whereas Parkes classification is based on the involvement of sphincter, intersphincteric, transsphincteric, suprasphincteric, and extrasphincteric. Next. Ayurvedic classification is, you know, based on causative vitiated dosha, consistency of discharge, the smell, the number of opening, or the anatomical appearance. And Sushruta has, you know, divided as a Shataponak, Ushtagriv, Parisravi, Shambhukavarta, and Unmargi. These are different types or classifications of Bhagandar. Next. Charak, again, he has classified as per involvement of predominant of doshas, whereas Vagbhat has added 3 new types or 3 new classifications as Parikshepi Bhagandar, Ruju Bhagandar, and Arsho Bhagandar. Most important thing, all the Granthakaras have mentioned that Bhagandar management is Kashta Sadhya only, means it is difficult to treat, whereas there are certain type of Bhagandar like Shambhukavarta or Unmargi, they are, you know, Asadhya, means there will be bound to reoccur. That is the message you have to take. Next. Next. Next slide. Well, examination of fistula, that also we know it starts from the inspection, then you do the proctoscopy, then the cardinal test here is the probing test where you insert tip of the malleable probe from the external opening and you allow the probe to follow the track, and then you can have your other tip of the index finger in the anal canal, and there you can actually assess the internal opening. That is the basic examination of fistula. Then if there are complicated high anal fistulas where you require fistulography or MRI to assess the exact depth, direction, and probable ramification of fistula. Next. Most important, in the chronic fistula or recurrent fistula, you have to advise pus culture and antibiotic sensitivity to decide appropriate antibiotic to control the pyogenic infection. Next. Treatment alternatives, well, we all know the conventional surgical procedure is fistulectomy, and if it is high anal complex fistula, then the modern people, they even go with the ceton ligation and fistulectomy. Then there are recent advanced surgical techniques like lift, waft, and laser. Lift, we all know that it is ligation of internal sphincter of the fistula tract, where the internal opening is ligated, and they say that once the internal opening is closed, then the remaining tract will collapse automatically. Waft is video assessed anal fistula treatment, where actually you can imagine a Agni Karma or cauterization of the fistula tract under the guidance of a camera, that is waft. And laser is the recent, where you actually burn with the help of laser beam. But unfortunately, all of them have got the recurrence rate. So no treatment is complete and perfect, 100% assured treatment is not available. And then we have our own wonderful treatment, Sharasutra therapy, which is described in all Ayurvedic texts. And there are certain modification in this Sharasutra therapy, like IFTEC. IFTEC is interception of fistula tract and ligation of Sharasutra. And there is, you can do partial fistulectomy with Sharasutra ligation at the, same as the fistulectomy with ceton ligation is done. Same thing, the ceton material can be your Sharasutra. So this is the treatment alternative of fistula. Next, we will go little fast because I have to conclude soon. Next slide, next slide, next slide. You can skip 4 or 5 slides now. Next slide. We all Ayurvedic people know how Sharasutra is ligated. We should know about the mode of action of Sharasutra. It causes, running sore. The studies suggest that it has got certain antibacterial and anti-inflammatory action as well. It causes true debridement and lysis of the tract. Most important to understand is why it is having less recurrence rate, because the causative factors, the residual anal glands which are into the folds of crypts, they are destroyed with the help of Sharasutra, and then there is no raw big wound as done in the fistulectomy. This causes simultaneous cutting and gradual healing of the tract. So this is the mode of action of Sharasutra. You can explain. Next slide. Next slide, next slide. Next disease is pilonidal sinus. You can say this is younger brother of fistula, because here only difference is the site of the disease, and it is not having 2 openings adjacent in the hollow structure. That is the only difference. Otherwise, pilonidal sinus is also very much similar to fistula. Now, we all know that in pilonidal sinus, this occurs at the, under the skin between the buttocks, which is called as natal cleft. Next. Next. Well, pathology, previous slide. Pathology, we all know there are theories. In fact, they are the hypothetic outcomes, like it can be hereditary, it can be due to increased testosterone level, it is more seen in more hairy people. The main basic cause is the multiple repeated friction and infection. We all know that this condition is also known as Jeep disease, because those Jeep drivers in the Second World War, they used to travel from one continent to the other continent, long drive, resulting into friction in the sacrococcygeal region. And in those patients, they have noticed that this disease is very common. That is why they have named as a Jeep disease. Next slide. Management, again, it depends on the, if it is asymptomatic, then, it requires only meticulous depilation and maintaining the local hygiene. But if the symptoms are like abscess, then you have to treat on the similar line. You have to give antibiotic, anti-inflammatory, analgesic drugs. And in the subacute phase, you can always give phenol injection, which is an sclerosing agent, which actually obliterate the sinus. Next. Then there are surgical techniques like incision and drainage of the sinus, then, secondary closure. Bascom cleft lip procedure is very common, which is also known as Z-plasty. And very recently and very effective treatment is surgical technique is Limburg flap operation. But unfortunately, with all this advancement in the surgical technique, there are definite recurrence of pilonidal sinus. Next. Well, this disease we can correlate with Nadi Vrana because Sushrut has mentioned 5 types of Nadi Vrana. Out of them, one is Shalyaj Nadi Vrana. Shalyaj means Nadi Vrana where there will be foreign body. Now, in the pilonidal sinus, there is a foreign body. The hairs are embedded into the sinus. So we can correlate pilonidal sinus with Shalyaj type of Nadi Vrana. And the management, again, in the acute phase, if the patient is coming with abscess, you have to do incision and drainage. Whereas if patient is asymptomatic, chronic or subacute, you can always go for the Shar Sutra treatment. There is a clear-cut indication of use of Shar Sutra in sinus management. Next. This is how we do the Shar Sutra treatment. You need to open the area from where the pus is coming. Then you have to, most important, remove all the hair which is embedded in the sinus. Then you have to flush the sinus, and thereafter you need to ligate Shar Sutra into the sinus. Most of the time you have to artificially create an anterior opening, and from where you facilitate the ligation of the thread. Next disease is next disease is rectal prolapse. Rectal prolapse is correlated with Guda Browns. Next slide. We all know that this is, 2 types, partial prolapse or complete prolapse. In the partial prolapse, there will be only, the part of the mucosa will be prolapsed, whereas in complete prolapse, it is a different scenario. The causes are mentioned here. We can definitely skip these causes. Next slide. Well, partial prolapse is common in young infants, and the length of the prolapse will be not more than 3 centimeter, and the clinical features will be while straining, they will find some prolapse coming out but it will be circumferential prolapse, not as a single prolapse as we see in the pile pedicle. Treatment in partial prolapse is digital repositioning. Then there are certain mucosal injections that is similar to that of sclerosing injection, which induces inflammation and fibrosis. And in adults, you can actually inject this injection as well as excision of the prolapsed mucosa. Next. For complete prolapse, it is called as prosidentia, and it is more common in females, and it is due to weakened levator ani and supportive pelvic tissue. The descent will be more than 3.5 centimeters, and diagnosis is done with the help of clinical examination and defecogram. The treatment is rectopexy. Next. Well, Ayurvedic treatment of Guda Bhransa, definitely you can give certain Balya drugs, and it is mentioned in the textbook that Changeri Gruta or Mushaktal can be taken internally. Mushaktal, generally we do Mushaktal Pichu, that is, it is used for local application. But in the original text of Sushrut, it is mentioned to be taken internally as well. And you can always give Vatanolomak drugs. So this is treatment, and then you can always advise patient to have yogic exercises to strengthen the levator muscle. And one of my friend, Dr. Hemant in NIA, he is doing Shara Karma in early prolapse, he apply Pratisarni Shar into the mucosa, and he say that it induces the fibrosis and it fixes the mucosa. But I have not used it. But there are people even in South India, they are using this Shara Karma for incomplete prolapse or partial prolapse. Next. The last condition which is relevant to today's topic is the anal carcinoma. Next. Anal carcinoma, fortunately, it is very uncommon condition. Only 2% people will develop anal carcinoma, commonly seen in the late 50s. Prevalence rate increases with the immunocompromised patient. Clinical features will be rectal bleeding. Then, there will be specific touch to bleed tendency. If you do PR, you can see that your whole index finger will be wrung with the blood stains, and at the pain will be there, then the altered bowel habit and weight loss. Pathogenesis, as per as it is understood, it is adenocarcinomas, and it arises from the anal clefts, and it may spread up to the anal verge. The most diagnostic investigation is circulating tumor DNA. This is specific to anal canal carcinoma. ctDNA 9 and CEA, that is carcinoembryonic antigen. And then again, if you have the facility, you can go for PET scan. So these are the diagnostic tools which helps to confirm that patient is having anal carcinoma. And most of the cases, the carcinoma is type squamous cell carcinoma, and adenocarcinomas comparatively less. Next slide. Anal carcin management, modern part, we all know they are very sensitive to chemotherapy. So most of the condition, early diagnosed cases will definitely respond to chemotherapy or the combination of local oxygen with radiation therapy. Most common drug used are mitomycin and fluorouracil at the repeated doses, and followed by the radiation therapy. They call it as a sandwich therapy. And then again, there is a surgical approach of radical excision of the growth along with the lymphatic excision. That is the surgical option. Next. Ayurvedic concept, perspective is similar. Two structures are diseases are mentioned. One is Granthi and one is Arbud. Granthi you can correlate with normal malignant tumor, whereas Arbud can be correlated with the malignant tumor. And further, Sushrut has also mentioned Raktaj Arbud and Mansar Arbud. So Mansar Arbud is very much close to the anal canal cancer. Next. Treatment part. Next slide. Treatment, well, again, fourfold therapy, Aushadhi Chikitsa. There are wonderful drugs, very effective in early detection of carcinoma. Single drugs are ashwagandha, triphala, gugul, turmeric. Turmeric, lot of clinical studies going on to develop its carcinogenic effect, anti-cancer effect, sorry. Then ginger, garlic, saffron, pepper. Then there are polyhalbar preparations like guduchi, sattva, ashwagandha, rest, kumari, aso, Chitrakadi Vati. There are certain rasa aushadhis. They are effective in certain conditions. Shara Karma, again, you can correlate with similar sclerosing agent. Agni Karma, again, it is radiotherapy, you can say. And the resection part or excision of the growth can be included in this Shastra Chikitsa. Next. So, what are the measures to prevent cancer? I will not go into detail. These are the common do's and don'ts mentioned, that one should have a healthy lifestyle, healthy diet, more of the oxidant producing food items like fruits and vegetables. Physical exercise is very much important. You need to have a healthy weight. Tobacco consumption should be stopped. And I have noticed that, people who are having using these plastic vessels in their day-to-day, maybe as a container, they are using plastic bottles for drinking water and all. Those things should be avoided. One should take HP vaccine. Viveka Dharan should be avoided. One should avoid constipation. And to prevent cancer, there are Shodhan Chikitsa mentioned as a Sadavritta measure, like seasonal Panchakarma detoxification procedure should be done. Then there is Rasayan Chikitsa, and there are specific dietary regimen to pacify Agni, and then these things are definitely helpful in prevention of cancer. And even if patient is having radio or chemotherapy, if you give Ayurvedic medicine, definitely these complications of those interventions can be minimized with the help of Ayurvedic line of treatment. Next. Now coming to the prevention of Guda Vikar. Next slide. This is supposed to be the last slide, sir. I am trying to conclude it in time. So, Guda Vikar preventive aspect, it is, you can think about the prodromal features mentioned in Sushrut Samhita. Sushrut में अर्श में जो पूर्व रूप बताए गए हैं, उसमें जो causes है, आयुर्वेद concept says that you have to, जिसके वजह से जो होता है वो avoid करना है. The causative factor is to be avoided, like there are, you have to have an good diet. You should have an proper Agni to digest it. You should avoid Viruddhasana. Like nowadays, in the era of Hari and Vari and Curry, there is no fixed time for meal. Then there is frequent eating habits. People are having this unnatural food types like pizzas and all, excessive bakery products. Those products made of maida, they are heavy to digest, more oily beverages, NSAIDs and steroids. Then in activity part, you can say overindulgence in the sexual activity, or straining, overstraining, exhausting. Then you can avoid squatting postures, avoid sitting on rough surfaces for longer time. Then suppression of urge, prolonged long distance traveling. Then one should promote using Indian toilet over the Western toilets. That is also very important part, because if you see, if you use this Western toilet, there is no pressure in your anterior abdominal wall, and which is there with the Indian toileting technique, where actually you sit in a squatting posture and your thighs will be creating pressure in the anterior abdominal wall, which help in easy evacuation. So that thing should be promoted. Then one should maintain local hygiene, so that there should not be any infection causing pyogenic abscess or any other condition. Next. So most important part of prevention of Guda Vikar is you need to be aware from these quacks in the society. You have seen many such small tent-like thing in your society, somewhere in the remote area. You will, next slide, you will see these quacks, they don't have any institutional training about understanding the pathology of the condition or diagnosis, and then they don't have any expertise in the management of that condition, but they are using is as a Ayurvedic expert of proctology. So one should have, one should mostly avoid going to these people. So that is also a preventive aspect of Guda Vikar, that you should not approach such quacks in the society. So with this, next slide, I would conclude my presentation, sir. I have tried to cover entire proctology, right from the fissure, piles, fistula, abscess, pilonidal sinus, cancer, and rectal prolapse. With the integrated approach, the modern established treatment we have discussed, and probable treatment and effective treatment, time-tested treatment in Ayurveda, that also I have tried to mention here. And with this, I would like to thank the organizing committee, especially my guru, Dr. Yunus Solanki ji, all the chairpersons, including Dr. Ukhalkar sir, the other faculty at Jalgaon Government Ayurved College, and my dear beloved brotherly friend, Dr. Abhijit Ahere, who gave me the opportunity to share my thoughts in front of this learned audience. So thank you, sir. Thank you very much.
Very nice, sir. It was a very comprehensive presentation integrating various treatment modalities. Thank you so much, sir. Now, I invite Dr. Ukhadkar, sir, to give his expert comment.
Good afternoon, everyone. First of all, I am very thankful to Honorable Directorate of Aush, Dr. Raman Gungraikar, sir, the in charge in Government Ayurved College, Jalgaon, Dr. Abhijit Ahireji, the organizers of this webinar, Dr. Yunus Solanki ji and Dr. Khot Madam, and their all team members for giving me this opportunity. Dr. Amar Dwivedi is well known and an eminent personality in proctology. He has covered all the integrative aspects in anorectal disorders. He has covered from anatomy to pathological conditions and their management very nicely. It was very informative and updated in all aspects. All the anorectal pathological conditions are covered in this presentation. The basic concept of Ayurveda is prevention is better than cure. And the first line of treatment, the basic principle of treatment is the Hetu Parimarjan, that all are covered by this in this presentation. Also, the integrative management part of this animal conditions is also covered very nicely. I would like to thank Dr. Amar Dwivedi for this informative presentation. And not taking that much time, I again very thankful to all the organizing team. Thank you very much. Hello.
Yes,
Hello.
sir. Hello. Yes, sir.
Hello.
So much, sir.
Am I audible?
Thank you so much, sir, for your valuable time. Now, I would like to invite Dr. Seema Giri ma'am to share her views.
Am I audible?
Yes.
Good afternoon, all. Firstly, I congratulate Department of Shalyatantra and Department of Streeroga Prasuti, Government Ayurved College, Jalgaon, for organizing such a nice and wonderful international webinar, SOUSHRUTI, on integrated approach in pregnancy and anorectal disorders. I also congratulate to Dr. Amar Prakash Dwivedi sir for giving informative and knowledgeable presentation on integrative aspect of anorectal disease. According to Ayurveda, says that ekam shastram adhyano na vidya shastra nishayam tasmat bahushrutaha shastram vijaniya chikitsakaha. As sir explained, not only Ayurvedic management but also told modern and advanced technique in the management of all anorectal diseases like fissure, hemorrhoid, fistula, pilonidal sinus, anorectal abscess, prolapse, and CA. Overall proctology in only 30 minutes cover. Sir told various conditions like hemorrhoids, fissure, fistula, basic anatomy of anal canal, how dentate line takes important role in surgeries, pathogenesis of hemorrhoids, degrees of hemorrhoids, etiology, and management of external hemorrhoid and also internal hemorrhoids. Non-surgical management and both surgical management. And advanced surgical procedures like MIBH, HAL, which are much popular, they are also explained. Diagnostic techniques, and also fistula in Ayurvedic management, conservative management, and similarly all other diseases like fissure, fistula, abscess explained in details in 30 minutes only. Thanks to Honorable Director of Ayush, respected Dr. Raman Gungraikar sir, in charge Dean Dr. Abhijit Ahire sir, Shalya Department HOD Dr. Yunus Solanki sir, Prasutitantra HOD, respected Dr. Bhageshri Koth Madam, and all organizing committee for giving me this opportunity and for being a part of this international webinar as a chairman of this session. Thank you so much.
Actually, sir, I have prepared for 1 hour presentation sharing most of my clinical experiences in the management. But as you said, I was informed that one day is converted into 2020. So I tried to compile everything very fast. So कुछ पॉइंट रह गया होगा सर. सो आई एम रियली सॉरी दैट कुछ चीजें मैं नहीं बता पाया, अच्छे से नहीं बोल पाया. But still, you have all accommodated me. Thank you so much, sir.
I am sorry for that. But kya kare, when you are organizing such an event and compressing the multi-talented speakers in a 1 day time period, we always run short of time compressed, and inaugural function took little time. That's why we had to, and we have already simultaneously started paper presentation session, because again we had to finish it by 5:30, and there is a observer from the University of Health Sciences sitting here. So we have to performance, so, and whom can I bank on more reliably than Amar Dwivedi, who I know that he will finish the match within 10 hours, hitting 4s and 6s. So, and that was adhikar se, isliye.
I will just have 2 words that इस presentation में जो अच्छाइयाँ हैं वो सब आप लोगों की है, जो कमियां है वो मेरी है. इतना आप सिर्फ मान लीजिएगा. That's it.
Thank you, sir. And thank you, Seema ma'am. Now I invite Dr. Vidya Jangle ma'am to give her expert comment.
Hello, am I audible?
Yes, Dr. Vidya, please go ahead.
Good afternoon, all. First of all, I congratulate Dr. Amar Prakash Dwivedi sir for such a wonderful and very informative presentation. In today's era, sir said, "Hari Vari Kari," that anorectal disease are spreading so fast. So to avoid this anorectal disease, the prevention is more important. Sir has explained palliative management, diet and lifestyle modification very well. Sir has explained office going procedure like RBL, sclerotherapy, IR3, laser therapy very well. And also sir has explained 4-fold therapy of Ayurveda, that is Aushadhi Kshar, Agni, Shastra, and the correlation between Ayurvedic and modern science therapy is very well. So the presentation is very informative and very knowledgeable. Thank you for that, sir. I would like to thank Honorable Dr. Raman Gungralekar, sir, Director of Aush. Also, I would like to thank to respected Dr. Abhijit Ahire, sir, Dean of GSC Jalgaon. And I would like to thankful to my mentor, my guru, Dr. Solanki, sir, for giving me this opportunity to co-chair this session, and also thankful to whole organizing team of Shalyatantra Department of Government Ayurved College, Jalgaon. Thank you so much.
Thank you, ma'am. Thank you so much. Now I invite Dr. Girish Daga sir to share his views.
Good afternoon.
Good afternoon.
I will congratulate Jalgaon Government Ayurved College for such a successful integrated international conference. And I will
खाली बघते वाटत होतं.
Dr. Vidya, yeah, please go ahead, Dr. Girish.
I got honored to be a chairperson for this webinar, for this session. I wish my regards to my guru, Dr. Solanki sir. Also, I wish my greetings to today's speaker, Dr. Amar sir, and all the present chairpersons. Really, I appreciate the organizing team that you have selected such a wonderful or a good topic to be an integrated approach in anorectal diseases. And I think you all will convince that Amar sir has given justice in his very short period. He had covered all the in the short period also he had covered little anatomy, he had covered the pathology of all the anorectal diseases. He had compared the modern different modalities of the treatment with the Ayurvedic treatment. I can say with my experience, as I think a lot of students are observing this today's session, that while examining the patient, as Amar sir had told us that hardly 2% patients are there of carcinoma, rectal carcinoma. So it's our moral duty that we should not miss this 2% patient. So I will suggest every student that please examine all the proctological diseases in lithotomy position only, take proper history, correlate every answer of his patient with the pathology of different diseases, and in proper light source, in proper position, examine the patient and don't miss any anorectal small pathology. While you will in the practice, you will come face a lot of symptoms are so much similar to the different diseases. So while taking the history, you should be very much cautious, and you can create a picture of the disease while taking a history only, and when you will examine the patient, you can correlate that your assumption with the actually pathology, and that time you plan the treatment. When you finalize the diagnosis, I will insist all the proctology, all the students, that write down the name of the disease what you have planned on the prescription paper, and with that correlate your diseases with the dosha, with the prakriti of that patient, because you can see that fissure with a kaphaj prakriti, the treatment line of treatment will be different, and fissure with the vataj prakriti line of treatment will be different, and the pathology of the fissure will be different in the kaphaj prakriti and as well as in the vataj or pittaj prakriti. So I will again congratulate Amar sir that you have given a wonderful, a very precise lecture, to the point lecture. You have covered all the diseases, hemorrhoid, fissure, pilonidal sinus, as well as fistula. So again, I congratulate to you and thank to the organizer for being me a part of this webinar. जाते जाते अमर सर जैसा बोले, गुरु को आप लोग वंदन नहीं करोगे तो इट इज अ कॉज ऑफ फिस्टुला. सो सभी गुरुओं को अगेन मैं प्रणाम करता हूँ. धन्यवाद. थैंक यू.
Thank you, Dr. Girish Daga. Dr. Girish Daga is a practicing proctologist in Sambhajinagar and a very old friend and a compliance for us. Let me at this juncture tell you that NIMA and particularly Dr. Girish Daga is always helpful to Government Ayurved College Jalgaon for making available the Zoom platform for very lengthful of time. And for that, I won't say thanks to Girish personally, but thank you, Nima, from GSC Jalgaon. I have to thank you about that. Thank you very much. And his comments aptly signifies his position as a practicing proctologist in that area. Only a good practitioner can point out such minute observations during that. Anyway, Dr. Amar, I was telling you that Maharashtra University of Health Sciences has sent an observer on us. Can you recognize our old friend, Dr. Datta Kumawat?
Oh, Namaskar.
Namaskar. So Dr. Datta Kumawat is a professor.
We had worked in the same unit, sir, for 2 years.
इसीलिए वही सरप्राइज देना था मुझे लास्ट में. So he is an observer on behalf of.
And Sayaji were together in the same batch.
Yes. कुछ तो बोलो.
Yes, sir. Sayaji और.
So मैं लास्ट का सरप्राइज रखा तुम्हारे लिए कि देखो ऑब्जर्वर बोल के यूनिवर्सिटी.
Very nice to see him. Yeah.
Dr. Datta Kumawat is attached to SMDT at Ayurved College Igatpuri, and he is a practicing proctologist at Shrirampur in nearby area. That was a surprise for me too.
Yes, it is a pleasant surprise, sir.
दुनिया बहुत छोटी है बोलते हैं ना.
Yes.
Anyway,
सयाजी तो मिलते रहते हैं, बट दत्ता से काफी दिनों से, मतलब 15-20 साल हो गए मिले.
हाँ, सालों से नहीं मिला. So that's why ऑडियो विजुअल मुलाकात हो गई.
और ये गुरु बंधु भी है हमारे जोशी सर के विद्यार्थी.
So anyway, I will say to Dr. Sana, who is assistant professor at Government Ayurved College Jalgaon in Shalyatantra department, to conclude this session.
Thank you, sir. Thank you, Amar Prakash, sir. Thank you, Dr. Upkarkar, sir. Dr. Seema Giri ma'am, Dr. Vidya Janle ma'am, and Dr. Girish Dada sir to their valuable time. Now we are coming to an end of scientific session. We have already started research paper presentation few minutes ago. So those who are not joined yet, please join their concerned links. Thank you.
So thank you very much. Officially अपना वेबिनार फिनिश हो चुका है, लेकिन काफी पुराने साथी मिले हैं. So we can chat for a minute or two. Even it was a pleasure talking to Girish also. Girish Daga से भी काफी दिनों बाद मुलाकात हो गई मेरी. Thank you very much. और अमर अपन तो बॉम्बे में मिलते हैं. 18th you are there.
All pleasure is mine, sir. You have given me this opportunity. I mean, धन्यवाद sir. और कुछ नहीं. Only thank you.
Thank you, thank you. मिलते हैं फिर से. और ये बोलो ना,
Yes, sir.
It was a pleasant surprise for us.
Yes, definitely. Thank you so much, sir. So may I leave, sir?
Yeah.
Because you know we are having upcoming a 6 days CME and we a lot of things are going on there.
You can invite Dr. Datta also for that.
Yes.
भेज देना तुम्हारा brochure.
Yes. I'll send definitely.
Yeah. Thank you,
sir. Thank you, madam.
See you later. Thank you very much. Thank you all.
Thank you all.
बरं तुम्हाला हे मिळालं?
हो, हे सगळं आहे.
आता हे जे अनिलला सांगा, मी त्याला ब्रोशर हे केलंय.
हे काढले त्याचे प्रिंट काढ.
ब्रोशरचं पण ते नाव चेंज केलं का? हा, जो बस फर्स्ट क्लास.
त्याने हे पण पाठवा सांगितलं.
Please submit study materials